Good morning, good morning, good morning. The Committee of Health, Hospitals, and Human Services is hereby called to order. Good morning. Today, the Health, Hospitals, and Human Services Committee is convened to consider 3 bills that will support healthcare and healthcare providers across the territory. We have quality healthcare in the Virgin Islands, and I believe it's important to provide legislative support where it is needed to support our healthcare system, providers, and community health. Our healthcare system is not without its challenges, but I think we all agree that our healthcare providers work hard to ensure a high standard of care to the public. The bills offered today will bring compassion to the end-of-life process for grieving families, remove barriers to the nurse licensure process, and also support licensure for our medical providers who are unable to practice because various licensure boards do not have a quorum. Before we proceed with today's agenda, I'd like to recognize that today is the 2nd annual Territorial Day of Prayer in the Virgin Islands. I ask that everyone stand for a moment of silent, a prayer for protection against COVID and for the well-being of all Virgin Islanders. I also ask that we pray for our neighbors in St. Vincent and the Grenadines who must now manage the dual emergencies of COVID and the eruption of the La Soufrière volcano. Thank you very much. At this time, I'd like to remind all present to turn their cell phones off or put them on silent to avoid any interruptions. All testifiers as well are asked to put their devices on mute unless they're speaking. We are now ready to proceed, and I'll ask the Madam Clerk to please read today's agenda into the record.
Agenda, Committee on Health, Hospital, and Human Services. The Committee on Health, Hospital, and Human Services has scheduled a hearing on Thursday, April 13, 2021, at 10 o'clock a.m. in the Fritz E. Loetz Conference Room on St. Croix to receive testimony on the following bills. Bill number 340028, an act amending Title 19, Virgin Islands Code, Chapter 37, Subchapter 3, adding a section 870 to authorize certified registered nurse practitioners employed by a certified home health agency, hospice, or nursing home to determine and pronounce debt under certain specified conditions, and requiring the Department of Health to promulgate implementing regulations, sponsored by Senator Novell E. Francis, Jr. Invited to testify are the Honorable Denise N. George, Esquire, Attorney General, Virgin Islands Department of Justice; Yvette Rivera, RN, President, Virgin Islands States Nurses Association; Joyce Heiliger, RN, MSN, MPH, Executive Director, Virgin Islands State Nurses Association; Luis O. Amaro, MD, Interim Chief Executive Officer, Snyder Regional Medical Center; Ms. Daima Williams, Interim Chief Executive Officer, Governor Juan F. Louis Hospital and Medical Center; Ms. Tracy Saunders, President, Continuum Care VI; Ms. Samantha Sabu, Executive Director, Continuum Care VI. Bill number 340040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter, VA, establishing the Nurse Licensure Compact to create a multi-state nursing license, sponsored by Senator Kurt A. Viale. Invited testifiers, the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health; Yvette Rivera, RN, President, Virgin Islands State Nurses Association; Joyce Heiliger, RN, MSN, MPH, Executive Director, Virgin Islands State Nurses Association. Carmen Vanterpool Romney, RN, BSN, CPM, Territorial Executive Director, VI Board of Nurse Licensure. James Jim Ponty, MS, Director, Nurse Licensure Compact, NLC. Rebecca Fostash, JD, Director, State Advocacy and Legislative Affairs, National Council of State Boards of Nurses. Luis O. Amaro, MD, Interim Chief Executive Officer, Snyder Regional Medical Center. Ms. Daima Williams, Interim Chief Executive Officer, Governor Juan F. Louis Hospital and Medical Center. Bill number 340041, an act amending Title 27, Chapter 1, Subchapter 1, by amending Section 7 relating to the continuing medical education requirements for permanent and institutional licenses by inserting a new Section 55 relating to the Commissioner of Health's authorization to issue licenses to radiologists, technologists, a new Section 56 relating to the Good Samaritan Law, a new Section 57 relating to penalties, amending Subchapter 6 relating to practices of pottery by making technical amendments sponsored by Senator Novell E. Francis Jr. by request of the governor. Bill number 34-0042, an act repealing Title III, Virgin Islands Code, Chapter 23, Section 415, relating to the Board of Examiners for medicine, surgery, dentistry, pharmacy, nursing, optometry, physical therapy, chiropractic, and podiatry, and reestablishing the respective boards, establishments of, and reestablishing the language in Title 27, Virgin Islands Code, Chapter 1, Section 1A, and establishing a temporary board sponsored by Senator Norval E. Francis Jr. by request of the governor. Invited testifiers, the Honorable Hustai Encarnacion, Commissioner VI Department of Health, Frank Odlam, MD, FACS, Chairman, VI Board of Medical Examiners, and Dr. Regina Flippin, podiatrist.
Thank you very much, Madam Clerk. Colleagues and testifiers, there you have it in terms of our bill for today. At this time, we'll take a 2-minute recess, and when we come back, we'll do roll call, and then we'll go to the testifiers for the first measure before us, which is Bill 34-0028. Committee of Health, Hospital, and Human Services stand in recess for 2 minutes. The Committee of Health, Hospital, and Human Services is out of recess. At this time, Madam Clerk, roll call.
Senator Marvin A. Blyden. Senator Blyden absent. Senator Samuel Carrion. Senator Carrion present. Senator Kenneth L. Gittens. Senator Kenneth L. Gittens absent. Senator Alma Francis Heiliger.
Present.
Senator Alma Francis Heiliger present. Senator Janelle Sorrow. Senator Janelle K. Sorrow present. Senator Kurt A. Vialet. Senator Vialet absent. Senator Novell E. Francis Jr. Senator Francis Jr. present. Mr. Chairman, 4 present, 3 absent.
Thank you very much, Madam Clerk. Any correspondence to be read into the record?
Yes, Mr. Chairman.
Please proceed.
Letter dated April 13th, 2021, to the Honorable Novell E. Francis Jr., Chairman, Committee on Health, Hospitals, and Human Services, 34th Legislature of the Virgin Islands, 20 Estate Golden Rock, Christiansted, Virgin Islands, 00820. Dear Senator Francis Jr., I will be tardy for today's Committee on Health, Hospital, and Human Services meeting. I apologize for any inconvenience this may cause, and I look forward to participating upon my arrival. Thank you for your kind consideration in this matter. Respectfully, Kurt A. Vialet, Senator, 34th Legislature of the Virgin Islands.
Thank you very much, Madam Clerk. At this time, please record Senator Gittens as being present and Senator Blyden and Senator Vialet as being tardy. And please proceed with the reading of the first bill. Once again, without the testifiers, you could just read the first bill into the record.
Bill number 34-0028, an act to allow for the pronouncement of debt by registered nurse, physician's assistant, and nurse practitioner, sponsored by Senator Novell E. Francis Jr., invited to testify. The Honorable Denise A. George, Esquire, Attorney General, Virgin Islands Department of Justice. Yvette Rivera, RN, President, Virgin Islands State Nurses Association. Joyce Heiliger, RN, MSN, MPH, Executive Director, Virgin Islands State Nurses Association. Luis O. Amaro, MD, Interim Chief Executive Officer, Snyder Regional Medical Center. Ms. Daima Williams, Interim Chief Executive Officer, Governor Juan F. Louis Hospital and Medical Center. Ms. Tracy Sanders, President, Continuum Care VI. Ms. Samantha Sabu, Executive Director, Continuum Care VI.
That concludes the agenda, Madam Clerk.
First bill, ma'am.
Thank you. Testifiers, good morning. Good morning to all. Let's do a mic check before we proceed. Attorney Counts? Attorney General Counts? Can we have a mic check or the representative
Good.
for?
Okay, good morning, Senator Ms. Jacobs, on behalf of the Attorney General.
Thank you. Good morning, Ms. Rivera, Nurse Rivera.
Good morning, Senator Sorrow.
Good morning, Ms. Heiliger.
Good morning, Senator.
Perfect. Dr. Amaro.
Good morning, Senator.
Good morning, Interim CEO, Ms. Williams.
Good morning, Senator Suru.
Morning, Ms. Sanders.
Good morning, present.
Perfect. Ms. Sabo, can you correct me on that?
Sabo.
Sabo.
Thank
Good
you.
morning. Okay, good. Anyone else I missed on the screen this morning? Ms. Sanders, yeah, she responded. Am I miss anybody else that I did not call for a mic check? Okay, perfect. Who speaks to Bill number 34-0028 at this time?
I do, Madam Chair.
Senator Francis, you are recognized.
Thank you. Thank you very much, Madam Chair. I again offer Bill number 34-0028. It's an act to allow for the pronouncement of death by registered nurse, physician assistants, and nurse practitioners. This bill is not new to the legislature. It was originally offered in the 32nd legislature by Senator Norita Nelly Rivera O'Reilly. I was pleased to sign on at that time to the bill and support it alongside with my colleagues, some of whom are present today. Bill number 34-0028, formerly Bill number 32-0212, supports a more compassionate process for families who are grieving the end of life of a loved one. This bill was previously passed by the legislature and forwarded to Governor Mapp for signature, who unfortunately was forced to veto because of technicality. In his veto message, Governor Mapp on July 9th, 2018, acknowledged that a number of states and jurisdictions have adopted similar statutes, but that in each of the cases, the jurisdiction required the promulgation of rules and regulations for the exercise of the authority. Accordingly, Governor Mapp asked the legislature to require the Department of Health to promulgate and issue appropriate regulations. As you can see, the language has been added to this bill before you today. This bill recognizes that our nurses and nurse practitioners should have the authority to pronounce death in a very specific circumstances, namely when the patient is in hospice care, in a nursing home, or other limited conditions. Our stakeholders and testifier will tell you today that this is a matter of compassion and empathy. It is not intended to assume anyone's authority, but simply gives the healthcare provider the ability to make a qualified and informed finding of death for persons who have reached the end of their life. This is a separate matter from the certification of death. Make no mistake about it. The pronouncement of death simply moves a very difficult process forward. Again, I want to ask my colleagues for their support in this particular measure, and again, to be able to query the stakeholders and the testifiers today so that you can be satisfied that, in fact, we're moving in the right direction. Thank you very much, Madam Chair, for the time.
Thank you, Senator Francis, for the introduction of your legislation. At this time, we're going to move to the testifiers. Ms. Sanders, for Continuum Care, you may proceed at this time with your testimony.
Good morning. Thank you, Senator Francis, for the invitation to testify today. My name is Tracy Sanders, my husband, Dr. Herbert Sanders, and I have been full-time resident since 1995. Together, we founded Continuum Care Hospice in 2000. We were the first Medicare certified hospice. Yes?
Can you put your camera on for me, please?
Oh, I'm sorry. Is it on now?
No.
I could see you prior to her asking. I did actually see you.
Okay, now we see
There you
Ms.
go.
Sanders. Perfect. You may proceed with your testimony. Thank you.
My apologies. Currently, we provide home hospice on all 4 islands and have maintained continuous Medicare certification. Continuum Care expanded operations to include Medicare certified home health care and durable medical equipment on St. Croix. Prior to starting Continuum Care, I was the chief operating officer for an 18-county home health and hospice in Atlanta, Georgia. And prior to my time in community health, I was the director of nursing for a 363-bed hospital in Southern California. Thank you for the opportunity to testify before you today on this important and long overdue bill. There are 2 reasons for passing this bill. First, certified hospice providers across the United States have had registered nurses pronouncing at death in the home since the 1970s. As defined by Medicare, hospice provides end-of-life care to individuals who have a life-limiting disease or terminal illness with a life expectancy of 6 months or less if the illness takes its normal course. 6 months is not an absolute, as no one can life expectancy with absolute certainty. Hospice affirms that life is sacred, respecting the wishes of the patient and family as they deal with end-of-life concerns. Hospice is preparation for an anticipated death. Upon admission to hospice, the plan of care is developed with orders by the attending physician that includes goals and interventions geared to a peaceful passing. They include comfort measures in every aspect of care: medical, physical, emotional, and spiritual. At Continuum Care, our plan of care requires a physician to specify whether to pronounce death, as hospices do across the country. At this time, we are required to select do not pronounce death when we should be selecting pronounce death. The time of death ritual, there are many components of care for patients at the end of life, yet the one that makes the most impact is the pronouncement of death. The act of declaring that a patient has died is a long-held memory for the family, yet previous literature has documented deficiencies in how important this aspect of care is carried out. A randomized study compared reactions to 2 videos showing death pronouncements. The vignettes involved a terminally ill man in his 70s with a chronic incurable illness whose death had been anticipated, with his wife, son, and daughter at the bedside. One version of the vignette showed a standard business-like death pronouncement. The other showed a death pronouncement with enhanced of 5 behaviors intended to convey compassion. Waiting until the family members calm themselves down, explaining that the physician has received information about the patient's condition, performing an examination of the patient respectively, asserting the time of death, and reassuring families that the patient did not experience pain. The outcomes was a physician compassion score, trust that the physician and the viewer, the emotions, sadness, fear, anger. The study found that the video showing a more compassionate pronouncement of death was associated with positive outcomes in each of these areas. The act of pronouncing death is recognized as a profound moment for families. The memories of how death pronouncement occurred have been recognized as a factor in bereavement and also as a sacred moment. Yet the realities of hospitals often mean that death pronouncement happens at a time when the on-call physician is present, a person who is unknown to the family and has probably never met the patient. When someone passes, there is an important time for grieving. In many cultures, when someone passes, the ritual of prayer and family gathering initiates the healing. It is in this time that the hospice team provides immediate grief and loss counseling. It is also a medical component of arriving at the home of someone who has passed to verify death by the absence of both respirations and pulse. As part of hospice orientation, the skills competency, the registered nurse must be competent to pronounce death. Secondly, from a historical perspective, it has been 22 years that Continuum Care has been providing hospice care in the territories. It is new to our islands. Continuum Care was the first Medicare certified hospice in the USVI. Although hospice has been in existence stateside since 1974, it was new to our community. The procedure from our beginning is still the practice today. When death occurs in the home, a call is made to Continuum Care. Afterwards, a call is made to 911. EMS dispatches an ambulance to the scene to verify death. Also, as a part of the procedure, the VIPD arrived to ensure no foul play and to take a statement from the family, as it is a death in the community outside a medical facility. Until August of 2020, the Department of Justice had an individual morgue attendant from the Department of Justice arrive to bring the deceased to the morgue. Indeed, this law needs to be changed. The death is an intimate event for the families, and it requires the respect for the deceased as well as the family and loved ones. And I must commend our own. Those in EMS and the VIPD have demonstrated respect, kindness, and consideration when they arrive in the home. This is an accolade to all of us in our community. The time in hours, not minutes, with the current procedure is staggering. It is an unnecessary use of vital resources. EMS with life and death emergencies in our community, and the VIPD with 24/7 responsibility for ensuring peace in our community. Additionally, during this time when the VI is under financial duress, time is money. The dollars spent for our current practice of death in the home is costing unnecessary dollars. More important to me as a hospice nurse is the human condition and the impact of death in the home for families and loved ones. On behalf of Continuum Care, my hospice staff, and me, I sincerely thank for the caring, compassionate, respectful cooperation of our EMS and VIPD with our hospice team. With regards to home health, we must discuss anticipated death. With regards to anticipated death for a patient in a home health certified home health agency or certified nursing home, I do have reservations. To clarify, there is no certified nursing home in the territory at present. The last certified nursing home in the territory was Seaview Nursing and Rehab Center that closed some years ago. Continuum Care Home Health LLC is a certified home health agency. We do believe that nurses in a home health agency should not be pronouncing death. Home health agencies provide curative and restorative healthcare services to homebound patients. It is a reasonable assumption that care would be short-term while the patient regains her or his physical functional independence, not to die. Additionally, not all home health patients have a registered nurse assigned to her or his care. It could be a physical therapist only. If death is anticipated, there are and they should be referred to a certified hospice where registered nurses are trained and experienced in end-of-life care. Federal law requires that all patients are asked about advance directives. Patients may go to home health with an advance directives or healthcare declaration that might state they don't want CPR, but with the caveat if they are incurable or terminal. But if they are referred to home health care, again, death is not anticipated. In closing, we support Bill number 34-0028 that provides for the pronouncement of death by registered nurse, registered physician assistant, or registered nurse practitioner in a certified hospice setting only, not a home health setting. Thank you for allowing me this time, and I am able to address questions you may have for me. Thank you.
Thank you. Thank you, Ms. Saunders. We'll go to Ms. Heiliger for the VI State Nurses Association.
Thank you, Senator. Ms. Yvette Rivera, President of VISNA, will be doing our testimony. Thank you.
My humble apologies, Ms. Rivera. You may proceed at this time.
Thank you, Senator Suru. Good morning, everyone. My name is Yvette Rivera, President of the Virgin Islands State Nurses Association. Dear Senator Francis, thank you for the invitation to appear before the Committee on Health, Hospitals, and Human Services, of which you are the chairperson. I also extend greetings to the members of this committee and other senators present. I am Yvette Rivera, President of Virgin Islands State Nurses Association. I offer testimony on Bill number 34-0028 and Bill number 34-0040. Bill number 34-0028, pronouncement of death. The proposed language for addition of a new section 870 to chapter 19 VI Code introduces the pronouncement of death by a registered nurse, physician's assistant, or certified registered nurse practitioner employed by a nursing home, hospice, or a certified home health agency, exclusive of other care settings. Our understanding of the current practice is that EMTs are called to verify the conditions listed in 19 VI Code Section 869 when a death occurs in any of the healthcare settings listed above. But this is not written in the existing statute. The proposed language is also specific to anticipated death, suggesting that the nurses, and physician assistant will have no pronouncement role in unanticipated death in these facilities. If any owners of the referenced facilities have been invited to testify, maybe they can clarify the current practice or practices. Visner has no objection to the bill's intent, but there's a need to ask why this is coming for legislative regulation at this time. The certified registered nurse practitioner should not require any additional skills based on the curriculum for such certification. The staff registered nurse may need to acquire the skills as outlined in Section 869. Advanced knowledge across the lifespan should also be welcomed by the professional nurse, but compensation is also consideration. At this time, RNs working in these settings are not covered in the collective bargaining agreement under our Economic and General Welfare Commission by the Professional Association. But Visner supports consideration of additional compensation for this assignment and employment contract. To be clear, nurses will only be pronouncing that anticipated death has occurred. The death certificate is signed by a physician as stated in the original bill. And that is my testimony on this bill.
Thank you. Thank you, Ms. Rivera. Dr. Amaro?
Thank you.
Okay, thank you. Good morning, Honorable Senator Novelli Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services. Good morning, Senator Cyril, other members of the 34th Legislature, present fellow testifiers, members of the press, the viewing and listening audiences. I am Dr. Luis O. Amaro, Interim Chief Executive Officer of Schneider Regional Medical Center. Thank you for allowing me to provide testimony on behalf of SRMC on the proposed legislation, Bill number 21-0241, an act to allow for the pronouncement of death by registered nurse, physician assistants, and nurse practitioners. I've had the opportunity to review the proposed language along with SRMC's medical staff and had no objections to the draft legislation. We found its content consistent with other state laws that allow registered nurses, physician assistants, and nurse practitioners to perform death pronouncements. Furthermore, we understand this legislation aims to ensure that death pronouncements are done in a timely, compassionate manner with dignity, respect, and concern for the deceased's family. Allowing registered nurses, physician assistants, and nurse practitioners to conduct death pronouncements, as noted in this bill, will significantly improve our response time in death pronouncements. Our commitment at SRMC is to provide safe, comprehensive, quality care to our patients, their families, and the Virgin Islands community as a whole. As a healthcare organization, advanced allied health practitioners are a crucial part of our team. We want to support any effort that allows them to practice at the full extent and within the measures of their training and expertise. We therefore support the advancement of Bill number 21-0241. Honorable Chairman Francis and members of the Committee on Health, Hospitals, and Human Services, thank you again for allowing us the opportunity to give testimony on this proposed legislation. I am prepared to take questions.
Thank you, Dr. Amaro. At this time, Ms. Williams, you may proceed at this time. Acting Interim CEO Williams. Ms. Williams, are you there? Okay. In the meantime, we're going to move to Attorney Thomas Jacobs, the Chief Deputy Attorney General. You may proceed at this time, Attorney Thomas Jacobs.
Okay, so good morning. Good morning, Chairman Francis. Good morning, Senator Searle, legislative staff, and to those of you in the listening audience. My name is Carol Thomas Jacobs, and I'm the Virgin Islands Chief Deputy Attorney General. I'm here on behalf of Attorney General Denise George. I'm honored to be here today at the Chairman's invitation to offer statements on the proposed bill number 34-0028. The purpose of this proposed measure is to amend Title 19 of the Virgin Islands Code by allowing for the pronouncement of debt by registered nurses and certified nurse practitioners under certain situations. I would like to point out that the Office of the Attorney General testified on a substantially similar measure in 2018. After reviewing the testimony given by the Office of the Attorney General at that time and comparing it to the previous legislation and today's proposed legislation, Attorney General George stands by the purpose and intent of what this measure seeks to accomplish. For this reason, there's little occasion for a more detailed testimony. However, the Office of the Attorney General does want to point out that several recommendations that were made in 2018 have not been incorporated into today's version of the legislation. For example, the authorization that is granted in proposed subsection C relating to the physician's responsibility to name individual practitioners allowed to make a declaration of debt should remain active for a finite period, say perhaps 120 to 180 days. And this will be consistent with many other jurisdictions in the nation. Second, the Office of the Attorney General would recommend that the nurse or physician assistant be required to document the precise criteria that they use in making the pronouncement of debt. For example, one statute from another jurisdiction which addressed this issue states a registered nurse who has determined and pronounced debt under this section after diagnosing the absence of human responses shall document the clinical criteria for the determination and pronouncement in the person's medical or clinical record and notifying the certifying physician. Finally, the Office of the Attorney General would suggest the addition of a section F or subsection F, which would state, notwithstanding any other law, only a qualified physician may execute a certificate of debt. With that, I want to again thank this committee for the invitation to appear and testify on Bill number 34-0028, and I'm available for any questions the members may have.
Thank you, Attorney Thomas Jacobs. Do we have Director Interim Chief Executive Officer Williams back? Okay. We'll go to Ms. Sabo at this time.
Good morning. Thank you for the opportunity to testify today. I think a common goal for all of us is to enrich the life of all Virgin Islanders. My name is Samantha Sabo, and I'm a registered nurse with 30 years experience. I live and work in St. Thomas and serve our community daily. Currently, I'm the Executive Director for Continuum Care Hospice in St. Thomas and St. John. I've worked in hospice in a leadership role and at the bedside in several states since the 1990s. I have served a population as large as 16 counties in a metropolitan area and small rural areas as well. In all of these stateside locations, registered nurses pronounce death. I have never been involved in a death where foul play was suspected. Additionally, EMS and police were never part of an anticipated hospice death. When A patient is admitted to hospice services. They are certified to be terminally ill by 2 physicians, and death is likely in 6 months or less. Death in the hospice setting does not present as an emergency or a sudden event. The registered nurses assigned to care for these patients and families begin at day 1 to prepare them for this anticipated death while affirming life every day. This care is provided in the patient's residence. We are part of that process and build trust by providing physical, emotional, and spiritual care for the patient and family. The dying wishes of the patient are key in their plan of care. I refer to hospice care and death as no less a miracle than birth. I liken it to birth in that it happens universally and miraculously once for all of us. And we have but one chance to get it right. That is why I'm so passionate as a hospice nurse, director, and educator to help change the process in the VI. Mrs. Sanders has given much of the information and the facts needed in her testimony, and I am hoping to further appeal to each of you that you might have loved ones that have experienced hospice or may in the future. We will benefit from a much-needed change in this current anticipated death procedure. At the time of death, our families are instructed to notify Continuum Care as we are available 24 hours a day, 7 days a week. A registered nurse visits the home immediately. This is the most intimate and sacred of visits that the hospice nurse is involved in. Although it is obvious by observation, oftentimes death is confirmed by the registered nurse by absence of a pulse and respirations. Compassionate care for the bereaved and the dignity of the deceased are of the utmost importance. The death is recorded and documented. With the current process in the Virgin Islands, the resources of the EMS and VIPD are interrupted as they are dispatched to the home in an anticipated hospice death. They need to obtain directions and find the patient's home and then record their required documentation. This often interferes with the need for compassionate care of the bereaved. When a registered nurse is able to arrive at the home and pronounce death in a timely manner, it does reduce the trauma for the bereaved. It allows the family to bathe, groom, and redress their loved one. This is so important as this is often the last image and memory that they will have of their loved one. The importance of this ritual is immeasurable. In conclusion, I fully support the pronouncement of death by a registered nurse, physician's assistant, or nurse practitioner in the hospice setting. Thank you, and this concludes my testimony. I'm open for any questions.
Thank you, Ms. Sabo. Do we have Ms. Williams back as yet? Okay. While we get Ms. Williams back on the line, I want to recognize the presence of Majority Leader Senator Marvin Blyden. Good morning. Good morning to Senator Milton Potter. Good morning. And the presence of Senator Kurt Vealy. Good morning. And Senator Frankie Johnson from Frederiksted St. Croix. Thank you. Good morning, sir. At this time, the committee stands in a brief recess. The committee is back on the record at this time. Interim CEO Williams, sound check.
Good morning, everyone.
Okay, you know your department or your agency gives me PTSD as far as the internet is concerned. So we're good to go?
Yes, we're good to go.
Can you promise me no interruptions? No?
We will try our best.
Okay.
Our humble apologies for the technical difficulties.
No problem. You may proceed at this time.
Thank you so much. Good morning, everyone. Good morning, Honorable Chairman Novell E. Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, honorable committee members, other senators of the 34th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. My name is Daima Williams, and I am the Interim Chief Executive Officer of the Governor Wong F. Louis Hospital and Medical Center. Our understanding is that the proposed legislation in Bill number 34-0028, which amends Title 19, Virgin Islands Code, Chapter 37, Subchapter 3, adding Section 870 to authorize registered nurses and certified registered nurses practitioners employed by a certified home health agency, hospice, or nursing home to be determined and pronounced death under certain specified conditions, and further requires the Department of Health to promulgate regulations to implement these changes. JFL is not in opposition of this bill directly. However, these changes to the Virgin Islands Code would not directly affect JFL as an acute care hospital facility, as we are not certified as a home health agency, a hospice, or a nursing home. We trust that our community health partners in hospice, nursing homes, and home health entities will provide testimony that will ensure optimal care for Virgin Islanders who are terminally ill and are dying, who need peace, comfort, and dignity as they transition. In conclusion, JFL thanks this body for taking a special interest in persons with life-limiting illnesses in their homes and the care systems that serve and care for them. I want to thank the Honorable Senator Novell E. Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, and the members of the committee for an opportunity to provide this testimony here today. I will be happy to answer any questions that you may have. Thank you.
Thank you,
Thank you.
Acting Interim CEO, Ms. Williams. Colleagues, we're going to a round of questioning at this time, 5 minutes. Senator Carrion, you're recognized at this time.
Good morning. Good morning to Madam Chair. Good morning to my colleagues, viewing and listening audience, and good morning to the testifiers. I want to thank you for your testimony on this bill. I do agree that we need to do everything that we can to make the process smooth for the grieving families. And I think, and I believe that's a period that is very emotional, and we should ensure that the pronouncement are made in a level that demonstrate true compassion. And I think that's what this bill speaks about, true compassion. I also agree with the Attorney General's office that those making the death declaration should document how this determination was made. Let me ask you, do other jurisdictions allow nurses and non-medical doctors to make official declarations of death?
Some, in fact, I think some jurisdictions do, but I guess it varies from jurisdiction to jurisdiction. I could tell you, I believe it depends on the jurisdiction. Some jurisdictions do and some jurisdictions don't.
In your research, did you find that a majority of jurisdictions do?
Okay, so I didn't conduct an analysis as to the the majority of jurisdictions. So when you're talking about debt, we're talking about pronouncement of debt, which is one issue, and we're talking about certification of debt. Most jurisdictions, with respect to certification of debt, the doctors certifies debt. And again, depending on the jurisdiction, the registered nurse may pronounce debt. So there are two different issues, really. Just want to make sure that's clear.
Well, thank you.
Here
for
we're
that.
talking about for bill number 34-0028, we're talking about mainly pronouncement of debt. But we wanted to add that provision about that only the physician can certify debt, because that is really that is a very legal matter. We want to make sure that that is done appropriately, not only appropriately, but when we're talking about liability and responsibility and supervision of other professionals, we want to make sure that we maintain that the physician certifies, issues the debt certificate. In some jurisdictions, in fact, nurses can do that, but we think the best approach, based from our experience, would be that the physician continue to certify the debt and the nurse can pronounce debt.
Okay, thank you for that. And Ms. Tracy Sanders, what's your observation based on your expertise in that area?
Yes, we certainly agree with the idea of pronouncing at death, and that's all that we're looking to do. As was brought up, the importance of a physician certifying the death certificate. A few months ago, we were on a call with the Virgin Islands and the CDC that outlined the importance of getting the death certificate correct, putting in what the diagnosis, which is the major cause of death, and any other comorbids that would be relating or contributing to the death. At Continuum Care, we look to only pronounce by the absence of respirations and pulse, and then the physician would do the certification on the death certificate.
And since you mentioned that, have we ever had any problems at the hospital in terms of locating a doctor, a physician, and able to that would be available to do these pronunciations?
We have, when we have a patient that expires, we have the death certificate, and it does go to our medical director to sign. We've not had any issues. We do have a backup medical director when our medical director might be off island, but it's always been timely to get the death certificates to be able to go to the funeral home in a timely manner.
Okay, thank you for that. So anybody else experience any issues in this area? In the pronouncement of death? Availability of a physician to make the pronouncement? I guess not.
Time.
Madam Chair, if I may, this last one. I wasn't clear in Ms. Rivera's testimony if she supports the bill or not.
Thank you, Senator Carrion. I support the bill. VISNA supports the bill to a certain extent because here in the Virgin Islands, there are nurses who are employed by the hospital but may work for Continuum Care or may work for a nursing home as a per diem staff. So we need to know what are their responsibilities towards the pronouncement and if they are covered under the bargaining unit in case something goes wrong. But having an advanced practice nurse or the physician assistant doing the pronouncement, VISNA has no issues with that because we as registered nurses can say, yes, there is no pulse, there is no breathing, and the person has died. And then the doctor is notified in the hospital setting, the doctor is notified, and the doctor is always available. Doctor is always available to certify the death. But in the case of outside of the hospital setting and under the hospice or home health care, is that a registered nurse who is doing a per diem or part-time work, what is her role and responsibility in that? That she doesn't have the specified training for that assignment of pronouncing the death.
Well,
But we have no issues with the bill.
well, thank you for sharing your concerns and your status on the bill. Thank you.
Thank you. Thank you.
Thank you. And point of inquiry, Senator Francis.
Thank you very much, Madam Chair. I wanted to go back to Nurse Sanders in regards to the question that my colleague asked in respect to any delay or situation challenges experienced by hospice in regards to being able to pronounce death and being able to find doctor for the purpose of that pronouncement. Have there been any challenges in respect to that? I think she did respond in terms of the death certificate and the certification of death, but the question really my colleague had inquired about was pronouncement, whether or not there were any challenge in respect to that. So just for some clarity purposes, Ms. Sanders, can you speak to that?
Yes. Right now, we do not pronounce. With the policy, the process that we have, someone from EMS comes out to the home, they will run a strip and verify no pulse, no respiration. We accompany that with the death certificate to the physician. We do notify the physician at the time of passing, but as I stated, and just to be clear, we do not pronounce. That's something we would want to do. We have really not experienced a delay. The issues and concerns really are no longer using EMS and VIPD because a hospice nurse that is trained, measured, competent is able to do the pronouncement with the passing of this bill.
So I think that thank you, Ms. Sanders. I think that what the chairman of the committee is asking is it what's the time frame between, of course, a hospice nurse can get there in a shorter time frame, but what is the time frame between, EMS and the police to get there, or the challenges in them getting there to pronounce death? On average,
The challenge.
Go ahead.
Excuse me.
Go ahead, Ms. Sanders.
The challenges we have is if there is a delay, if EMS is on another call or the VIPD is at another call, it does delay. Oftentimes the nurse will be at the home. We are able to confer with the family, initiate bereavement, getting from the family when the patient was last alive. But we do have to wait, and it does cause issues if EMS is on another call. Usually they're very timely, but there have been some cases where 45 minutes, an hour and a half, and that is in no way a fault of EMS or the VIPD. So those are the issues that we have.
Okay. The discussion is good. I wanted to be lenient to the bill sponsor. Is that what you were trying to decipher? Yes? Okay, good. Senator Francis Halliger, you may proceed.
Good morning, colleagues. Good morning to the testifiers. Good morning to the people of this territory. This piece of legislation, I seem to understand a little bit better because this is something that I literally experienced over in the past 6 weeks. About 6 weeks ago, one of my very close friends for the last 20 plus years was dying of cancer. And as I was in a video conference with her and her family, her daughter said, I think she stopped breathing. And I asked the question, well, do you need to call the doctor? Do you need to call the ambulance? And her daughter shared with me that because she was already under hospice, we have to wait for her nurse to come to declare her dead. And I sat on that video call for about a half an hour until the nurse arrived. And the nurse was able to do what she needed to do, and she was able to pronounce her dead at that time. And I think this piece of legislation is a long time coming here in this territory because we do have competent nurses that are capable of declaring that someone has passed. And I also understand that at times a doctor might not be available. There are times EMS and other individuals might not be available. So based on how it's written and what has been shared here today by the testifiers, I am in support of the bill. I think we have come to a place and a time where it is necessary here in the Virgin Islands that we do have legislation to empower our nurses at times to do things that they are capable of doing. So I don't really need to ask too many questions, but I did wanted to share that why I too am in support, because I literally went through this experience within the last 6 weeks. The question I wanted to ask was, that experience with me happened in the state of Georgia. And I know the question was asked about the various jurisdictions as to, have you done any research as to the jurisdictions that might have laws such as this that would give a nurse the ability to proclaim somebody had passed? But what I want to ask is, has there been any information or data or research where mistakes have happened by giving this authority to a nurse, where there might be some pushback as to why some might not feel it's necessary or even in the best interest of individuals? Anyone can answer.
I can take that question, Senator. There has not been any issues. When we talk about jurisdictions, both Ms. Sabo and I have worked stateside, and every hospice I've been involved in, and even with the professional organizations that I have, nurse pronouncement by a hospice nurse is very commonplace. That is the standard of practice stateside. We're always going to find issues that do come up. When I testified a couple years ago, when a similar bill was brought up, as Senator Francis explained, there were questions about what if, but we have found very little evidence that in a hospice setting, when it is an anticipated death, that there are any problems or issues with this.
Well, thank you so much for that. I have no further questions.
Thank you, Senator Francis Heiliger. Senator Gittins. Senator Fred Gregory.
Thank you, Madam Chair. And good morning to my colleagues, and good morning to the testifiers, and good morning to the people of the United States Virgin Islands. So I took some time to review the legislation before us, and I am in support of it. But I do have some concerns, and not necessarily with the legislation. And I note that there's no one here from Human Services, which is the entity that is responsible for, in fact, regulating these healthcare agencies, nursing homes, hospice, etc. And I really wanted to ask them today, do they truly have a system in place where they're in fact regulating these institutions? And I ask the question because a lot of times we find that they don't truly have nurses, certified nurses, in fact working in these institutions. And I know that from my own experience. But let me ask the Continuum Care representative that's here today.
Hold a second for me, Senator Fred Gregory. Can everyone mute their mic, please? You may proceed.
Yeah, let me ask that representative that's here. I kind of missed the name, so my apologies. As it relates to Continuum Care, tell me how that works as far as your RNs and LPNs, et cetera, here in the territory, actually providing support to these nursing homes and healthcare agencies that we have that's certified by Human Services?
Thank you. As for continuum care, we provide hospice care in the residence or the place a person is living. That can include at times the Herbert Gregg home. We haven't done it for a number of years, but our patients are confined to their home. We don't have a facility. We are in the home. Our staff, when they come on board, we follow CMS and federal regulations of nurse competency, initial skills competency, annual skills competency, and ongoing education. And this includes end-of-life care, determining that someone has passed, proper documentation.
Thank you. So you do not provide any support to those nursing homes, et cetera. You just do it for your for the continuum care. So I understand that. So that's my concern. My concern is that I don't know what it looks like in the St. Croix district, but I know that in the St. Thomas St. John district, that is a challenge. And like I said earlier, there's no one from Human Services here to testify on behalf of those particular nursing homes as it relates to what kind of regulatory work they're in fact doing around that. But let me ask the Department of Justice, because I know that the DOJ, once an individual dies outside of the hospital, there is some responsibility for the Department of Justice. So how will this bill impact the responsibility of the Department of Justice as it relates to the medical examiner, et cetera?
Okay, good morning, Senator. We do not, generally, we do not respond to hospice in St. Thomas and St. John or in St. Croix. Usually, unless there is some unusual situation, because that's not an unusual debt. Or it's more than likely it's not a suspicious debt. The physician, we're just waiting for a better word to say for that person to essentially pass. So that is not necessarily considered a suspicious debt, and generally would not fall under the jurisdiction of the medical examiner. But of course, if there is a suspicious instance in any facility, in any home, we will definitely respond.
Okay, thank you for that. So that clears that up for me. And then I just need to be clear, because I think somebody mentioned it earlier as it relates to, I think it was you as well, attorney, where there is a clear distinction between pronouncement of debt and certification. So from your understanding, it is clear that this bill does not require the nurses to certify debt as well, correct? It was just the pronouncement.
It's just a pronouncement.
Okay.
And that's one of the, and just to avoid any confusion or misinterpretation, that is why we suggest that we add subsection F, which would state, notwithstanding any other law, only a qualified physician may execute a certificate of debt, just in case someone may argue, well, it's implied in the statute or something like that.
Okay.
So, yeah.
All right, so I just wanted to make sure that we were clear on that. And I believe that for the most part, this is a straightforward piece of legislation, but I wanted to make sure that we were clear on that to prevent any issues down the road. And of course, at some point, we need to have that discussion, Mr. Chair, as it relates to the Department of Human Services and their true responsibility with regulating home health care and hospice care here in the Virgin Islands. So, Madam Chair, thank you for the time.
Thank
I
you.
return the balance of my time. Thank you.
That's rare. Senator Potter? Oh, sorry. Senator Gittins, are you? Senator Gittins, you may proceed. And then Senator Potter, I apologize.
Thank you, Madam Chair, and good morning to all. The pronouncement of a patient's death, as I believe was said before, should be certainly one that's timely and done in a respectable manner. And I do upfront support the measure. I was wondering, do we have anyone from the Department of Health testifying on this matter today? Any one of the testifiers are from the Department of Health, Madam Chair, to your knowledge?
No, Senator
Okay.
Gittens. We just have the hospitals and the Nurses Association
Okay.
and Continuum Care in the AG's office.
For the future, I'm just stating that especially when an entity has a responsibility within the pieces of legislation that we're offering, they should be here so that they can be fully aware as to their part to play in such critical measures. Because I'm seeing here that the Commissioner of Health and is supposed to be subscribed under penalty of perjury here with regards to the pronouncement of death. And they should be here to weigh in and at least have knowledge, but I know that once the measure is passed, the author of the bill will ensure that they have full knowledge of this and what responsibility they play. Now, as I research this matter as well, I've noticed that there's more than 20 states that have already addressed this. The Virgin Islands, in my estimation, right now, we're playing catch up as it pertains to moving this piece of legislation forward. Over 20 states have seen they've already addressed that RN or APRN has the authority to pronounce a patient's death. And of course, legislation would vary, and the variances have many factors. And as such, where the death can occur, whether in a hospital, in a nursing home, or at the private residence. And we've already heard one instance of some personal experience that I wouldn't even go further into, but again, just to support the measure, it is necessary, as we know all over, there's a doctor shortage, there's a nurse shortage, but if we put the two together, we can certainly address the shortage that we have, and as it pertains to who may make the pronunciation of death. Again, clearly, the pronouncement of one's death is significant. It's a significant obligation, and it must be carried out with grace, respect, and concern for the family that's grieving. So at the appropriate time, I will support the measure, and again, just remind us to ensure that we have all the individuals at the table when we're having these discussions. So just like how Human Services is not here, I was hopeful to see someone from the Department of Health, but that will not stop me from supporting this matter in going forward and making the Virgin Islands also part of the 20+ other states that have already addressed this. Thank you to the author of the bill, and at the appropriate time, Madam Chair, I will support this measure. Thank you.
Thank you, Senator Gittens. Senator Potter.
Thank you very much, Madam Chair. Good morning, colleagues. Good morning, testifiers. Good morning to the people of the Virgin Islands. Absolutely, death pronouncements should be done timely, and they should be done with a measure of dignity for the grieving loved ones. And it was made clear today that this has been occurring, this being nurses having the ability to offer death pronouncement has been taking place since the 1970s. So the time has come for us to implement this measure. So I want to commend the bill sponsor, Senator Francis, for having the foresight to bring this measure forward. But my first question really to the nursing professionals here today is, does the debt pronouncement process, does this require a skill set outside of an RN's typical training?
If I could speak for hospice, it is part of the training. It's part of the core curriculum from orientation for hospice nurses because we consider this part of our everyday duties. In home health care, where death is not anticipated, those nurses do not have that extensive training. And as I stated in my testimony, that is my reservation about having a nurse in a home care, home health setting pronounce death.
Okay, so you're suggesting that if this bill were to become law, that there would be a requirement for additional training for typical RNs who may be, assigned to a nursing facility, for example, in order for them to be qualified to make a death pronouncement. Is that what you're suggesting?
I believe the way that this bill is written, it's for certified nursing homes. And at this time, we do not have any certified nursing homes in the territory. We do have the centers, the Queen Louise home, the Herbert Gregg home, that are homes for the aged, but they are not certified facilities. The certified home health agencies in the territory, Continuum Care Home Health, and also Premier Home Health. And I don't see anyone from Premier Home Health on St. Thomas here to give their opinion on this bill. Thank you.
Okay. Any comments from VISNA representatives?
Senator Potter, Ms. Heiliger, Executive Director. This is VISNA's point, supported well by Ms. Tracy Sanders. We want to ensure, as you're asking, that nurses who are called upon to pronounce death have the adequate up-to-date scale. And as she said, for her staff,
Ms.
they
Heiliger?
have annual care. Am I being heard?
Can you turn your
Am
camera?
I being heard?
I can hear you. I can't see you. Can you turn your camera on for me, please, Ms. Heiliger?
Oh, I'm so sorry. I'm so sorry. So sorry.
You're excused.
Turn camera on. It's on, so I don't know why you're not seeing me.
Okay.
Because it's on.
Okay, Ms. And testifiers, don't forget before you speak, just state your name and title for the record for the stenographer. Okay, Ms. Heiliger, you may proceed.
It's okay. Turn camera on. All right. Are you able to see me yet?
It's okay, Ms. Heiliger. You're excused. Just go ahead and respond, and Senator Panner, your time will be restored. You're fine.
Thank you.
Joyce Heiliger, Executive Director, Virgin Islands State Nurses Association. You will note in our testimony that we said that the RN may, M-A-Y may, because we support what Ms. Sanders has said, that there needs to be annual training to ensure that all of the skills that that nurse needs, that nurse has. In the bill, 869 also says that this is made with the accepted medical standards. So we just want to ensure, because our purpose is to ensure that nurses are always competent to render the care that they're being asked to render. So to your question, Senator Potter, yes, we absolutely support what Ms. Sanders has said, that nurses are being trained, will be trained, and will be kept competent in the pronouncement of death in the particular settings. Thank you. Thank you.
Thank you for that, Ms. Heiliger. I think that is definitely a will be a priority once the legislation is passed to ensure that training will be available to keep the comfort level of the nurses who will be asked to perform these specific duties and responsibilities. I'm aware that the bill also speaks to the Department of Health having a role in promulgating rules and regulations. I noticed in some of the research that I did that there were some nurse licensure boards who were also involved and engaged in setting up the rules and regulations governing this added duties for nurses. Do you think the nurse board locally should be involved and engaged along with the Department of Health to develop the rules and regulations that will be governing this new initiative or this new bill? Ms. Heiliger, should the Board of Nurse Licensure also be involved in developing and establishing rules and regs?
Yes, sir. Yes, Senator.
Okay. Thank you for that. And my final question, really, I don't know if it's a technical one, and the nursing professionals can really educate me as to this. I noticed that the bill speaks to registered nurse and certified registered nurse practitioner. So I noticed that the certified piece was there, and one of the testifiers may have spoken to it. Madam Chair, may I continue just to finalize?
You may wrap up. Go ahead.
Okay. I noticed that there is a certified registered nurse practitioner as well as a registered nurse. So I was assuming that a registered nurse practitioner was an advanced practice nurse, and there was this added piece where they are required to be certified in order to qualify to do the death pronouncements. Is that something that was specific in the bill to ensure that the registered nurse practitioners were certified, or would a typical nurse practitioner be allowed to perform this extra service?
I don't know if Ms. Sanders wanted to take that, but the advanced nurse has to be certified.
Okay, and a registered nurse would just not necessarily need any added certification in order to qualify. It would just be a registered nurse would be able to perform this service, but if you are a registered nurse practitioner, you would have to be certified.
We don't like the term just a registered nurse. All we're saying is that nurses advance in their preparation, so the advanced practice nurse, based on the regulations, has to be certified. The staff nurse does not have to be, again, based on the regulations, certified, and that's why we want to ensure the competency of the staff nurse.
Thank you very much, Ms. Heiliger, and in no way do I want to diminish
Senator Potter, your time has been called. You know that?
Registered nurse. Yes, thank you very much, Madam Chair. Thank you very much, testifier.
You're welcome. Senator Johnson, are you prepared? Okay.
Good morning. Good morning, Madam Chair. Good morning to the testifiers. Good morning to all of my colleagues. Good morning to the people in Frederiksted and to the people of the Virgin Islands all in one. I must say kudos to the sponsor of this bill, and I think it's something that is well needed. I appreciate them bringing this forward. I would like to ask Ms. Stewart a question. I've been going through your testimony in depth, and I appreciate all that you are exposed here today. Based on your experience, how long does a medical examiner take to determine anticipation of death of a patient?
Are you speaking to me, Tracy Sanders?
Yeah, Stuart.
Okay. Stuart Sanders. Okay, thank
Yeah.
you. We don't get involved with the medical examiner.
Yeah.
If you could clarify your question, we have the pronouncement of death, we have the diagnosis, our physician certifies the death and the death certificate.
Well, in the hospital, for instance, if someone passes, based on the law that we have right now, how long would it take to get that medical examiner or doctor there to determine this person dead?
I would have to defer to Ms. Dima Williams on that because our program is a home hospice outside the hospital or facility
And
setting.
in your facility, you will have to rely on the hospital when that person arrives to the hospital?
They do not arrive to the hospital. What we do now is the patient is taken, they choose a funeral home, and the mortuary will come to the home and take the deceased to the mortuary, to the funeral home. They are no longer going to the hospital morgue. That was something through the Department of Justice that changed in August of 2020. So they are going directly to the funeral home that the family has chosen while they've been on our hospice program.
So at this present time with that new legislation, who determines that that person has passed based on your home?
It would be the registered nurse at the home determining with the absence of respiration, no pulse, that they have passed.
Okay, Ms. Dima Williams, can you assist me with that?
Sir, good morning, everyone. This is ICO Williams. Can you hear me?
Yes, ma'am.
Wonderful. And so it does work very differently within the hospital setting, as our physicians are licensed to do the pronouncements. So this bill is really specific to external deaths that occur as a result of hospice or home health management. And so if a patient were to come to us from that setting, our emergency room physician would do the pronouncement, and that person would then be, well, apologies, the remains would then be sent to the morgue.
And in the case in one of your patients on one of your ward, what's the time in relate to that?
Essentially, immediately, because our physicians are internal. Internal to the organization, registered nurses would not do any pronouncements, as that would fall outside of their scope of practice. And so this legislation really speaks to the provisions for home health or hospice pronouncements.
Okay, thank you very much. I have no further question. I think I leave a lot of time there for a lot of other folks. Thank you very much, Madam Chair.
Thank you. Ms. Sanders, do you agree that the bill will optimize the care, comfort, and quality of life straight through the end of one's life?
Absolutely, 150% I do. I'm in full support of this. And with the experience that Ms. Sabo and I have had, this is really something that will favor positively for our community and our families.
Okay. And of course, most bills, as they go through the process, will be tweaked and amended, but the intent or the content, the major content of the bill, it's not rare. It's also allowed in other states, correct?
Yes, ma'am.
Okay, good. And just to add, we've had personal, not we, I ain't working at nursing home, but I know of residents in nursing homes that have planned their transition down to the funeral home that they wish to use, and the funeral was already paid for, everything, and unfortunately, the funeral home couldn't transport them upon death because they had to wait for the medical director, the physician, to come and pronounce them dead, some 2 to 4 hours later. So it's really it's stressful for the family and the staff of anybody in a continuum care or in hospice. And I just want us, no bill is perfect, but the major components of the legislation, if we agree with it, I think that we should move forward today. And of course, that's why bills go through a process, because you have the Committee on Rules, and then you could also amend in the Senate session. So Senator Blyden, you may proceed at this time.
Thank you so much, Madam Chair. Good morning to my colleagues, viewing and listening audience, staff, central staff, testifiers. Thank you for your testimonies. Before I go into my line of questioning, I just wanted to correct the record by a statement Ms. Sanders made in terms of hospice care. I know there are 2 hospice care in the St. Thomas St. John district, Tropical Health and Premier Home Health, and they both are Medicare certified. So I just wanted to put it on the record, because it's important for folks to know that there are hospice care available in our district. I too, I'm a little concerned. Of course, I support the bill 100%. It is needed and necessary, but I am concerned that the Department of Health is not here. As to, I know one of the reasons why the last governor vetoed the bill. This bill was part of the reason was for basically regulation when it comes to Department of Health. I also would like to ask counsel for Attorney General Office when it comes to language in the VI law, which requires a physician perform the pronouncement of death. What language in the VI law requires that? May I ask?
Okay, Senator, I can't tell you that off the top of my head right now, but I could definitely look for that and let you know.
And the reason why I ask that, because based on testimony and based on what we know, at times the EMT perform the announcement of death on the scene. When they come upon a certain scene, it depends on what occurred there, whether it's a shooting or what have you. So that was my question in terms of what language in the VI law requires a physician to perform the pronouncement of death. And with that being said, I wanted to know if it will change or impact the bill based on Provision 19, Section 862, which states that the body of the deceased cannot be removed without a certificate of death, and which must be signed by a physician. So that's why I made that inquiry when it comes to that language, if it's where in the VI code can we find that. I know it's a practice, but I would like to know if that is in the code per se. And also, when it comes to the Department of Health again, with the legislation and Medicare, well, you know what? I think we're going to address that with amendments, so I'm not even going to go there. But let me ask Ms. in respect to see, I think the Department of Health really need to be here, because most of my questions were for the Department of Health. When it comes to the regulation and in terms of timing, because we know that's an issue also in terms of how long it takes, and if they have the staffing and or capacity to address those situations within a timely manner, whether it be the 180 days. And we know most of their rules and regulations are pretty old and have not been updated for some time. So most of my concerns and questions were for the Department of Health and not per se to the testifiers, because I do support the legislation, but I want to assure that our government agencies can do their part and carry out their responsibilities in a timely fashion. So with that being said, Madam Chair, I want to thank you for the time.
Senator Violet, you may proceed at this time.
Thank you. Thank you, Madam Chair. Good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning to the testifiers. Ms. Sanders, your recommendation is that in the bill we take out home health, and we also take out nursing homes, that we strike those two?
My point was, as far as a certified nursing home, I would be in agreement with that. However, I was just clarifying in the VI territory, we do not have any certified nursing homes. My concern with home health agencies is the type of patient that goes into home health. It is not an anticipated death. They come on home health care for restorative and curative care, with the anticipation it's short term. They get rehab, nursing, wound care, medical management, and they are discharged back to the community.
Okay, so I
Not an
listened.
anticipated death.
I listened to your testimony, and I do know that hospice is end of life care, and that person, it has already been determined that within a period of time that person will pass on. So the pronouncement of death would be applicable in those situations where a nurse can, RN can be able to do the pronouncement of death. But based on the reasoning in your testimony, we then should remove nursing home and home health, because there's not necessarily the expectation of death. And we only want to expand this to those cases where we are practically almost sure that that is going to be the outcome. Is that what you're saying?
Yes, sir.
Okay, so we have submitted an amendment that would remove nursing home and home health, because we want the hospice as end of care. So a doctor have already made that determination that based on the illness, a person is going to pass away in X amount of time. So it is expected, and that pronouncement of death would then be able to be done by a RN or a APR. We also, I think, Attorney General, you made some very good recommendations in reference to having a time certain of 120 to 180 days. So we have submitted an amendment for 180 days, and have also included the language that you suggested that the nurses would have to follow. Your recommendation was to include that in the bill, correct?
Yes, Senator.
Okay, great. Now, everything in this bill is only for those institutions that have a CON, Attorney General, correct? Certificate of need.
We're talking about a certificate of need.
Yes.
Okay.
Okay. Let me tell you where
yes,
I'm going, so you could determine. I want to make sure that the enactment of this bill will only take place for those institutions that have a CON and are providing that type of care, hospice care, but they are certified under Department of Health, and it is not for any other facility that have not sought a CON but are doing end of care. Is there any need for us to clarify that in the bill, or is it understood?
Well, yes, Senator, I think the Department of Health would probably be the best person to do that. But I think that if there is a requirement for a certificate of need for these type of institutions, that they should meet those requirements, so that we know exactly that's the way we're going to know how to effectively regulate these entities. So, but I think that's controlled by Department of Health. And if it's required by health, then they should be required to do so.
Okay. And I wanted to say that there are currently more than 20 states that have similar legislation. This legislation seeks to provide comfort for the family. You don't want to have somebody that pass away and then they're in the home for hours. Definitely the response of EMS, they're going to respond a lot quicker to situations where they actually have to save life, and if they have to decide over going for a pronouncement of death versus going to save somebody, they're going to save somebody and come back. But this creates a less stressful environment by being able to have a RN do the pronouncement of death and being able to deal with those situations as quick as possible. I think on the back end, we had a discussion, and I don't think that we ever resolved. After the pronouncement of death, you're able to go to the funeral home. After the pronouncement of death, you're able to go to the funeral home and not the morgue, especially if you were in hospice care. And I know that we don't presently have that on St. Croix, so then you still have to wait to be picked up in order to go to the morgue. And at some point, we're going to need to have that discussion as to how the funeral homes are going to be able, once you're under hospice care, to directly go and pick the body up. Thank you so much, Madam Chair.
Thank you, Senator Bailey. Quickly, before we go to the point of inquiry, on the removal of nursing homes, I guess I go back to Ms. Sanders. Families and patients plan their transitions in a great detail. So if a patient is a DNR, or if a resident is a DNR, why are we waiting for the medical director to come on site?
I think as far as the medical director, what we're looking at is the pronouncement of death. And just to clarify, someone might have a do not resuscitate, but for us in hospice, we look at that again. We have our own document. It's actually called Allow Natural Death, that we revisit that with our patients and families to make sure as they're in hospice that that's indeed what they want, that when their heart stops and their respiration stop, that they accept that as their natural death. What Medicare and federal requirements allow is anyone to change their mind. So someone might have a DNR on record, but could also change their mind and say, no, I do want everything done.
So you still agree with removing nursing homes from legislation?
I would be agreeable if they were a certified nursing home. I was just making a clarification for the territory that we don't at this time have any certified nursing homes. If we did have a certified nursing home, I would be in agreement.
Okay, so your proposed language would be a certified nursing home. You're on mute.
Yes, and I believe that's what is in the bill, that it's a certified hospice, certified nursing home, or certified home health.
Okay, thank you. I appreciate your response. Senator Blyden, you want to follow up quickly on a point of inquiry?
Yes, thank you. I was just inquiring to council if you were able to find that information in terms of what language in the VI law requires the physician to perform the pronouncement of death. Were you able to find that information? Counsel? You're on mute.
No, Senator, I haven't. I have not been able to do that as yet, but I could get that for you.
Very well.
Plus, you remember we're talking about pronouncement. You're just referring to pronouncement of death, because, as you say, in a medical facility, that is done routinely by healthcare providers who may not necessarily be a doctor. So I'm just like, I just want to make sure we're talking about pronouncement of debt.
Yes. Thank you so much.
And not signing of the death certificate.
Yes, we are. Thank you.
Okay.
Thank you, Madam Chair.
Good.
Thank you so much, Senator.
Madam
Bill,
Chair?
is there somebody? Ms. Heiliger? That's you?
Heiliger, yes. Ms. Heiliger, may I?
Ms. Heiliger. Ms. Heiliger?
Yes.
You had something to say?
I don't know what is happening because I can see myself at the bottom of my computer and my thing says camera on. I just wanted, with your permission, to share with Senator Kurt Bailey what I just went through. I lost my husband about 2 months ago, and he was under the hospice program. When he passed, the EMS were called to to pronounce his death. VIPD came. I already had arranged for the funeral parlor, speaking again to what Senator Bailey asked. I had already identified a funeral parlor, so he did not stay there waiting for any length of time for an MD, because that was a pre-arrangement that was had under the hospice program. So I think we would need to clarify that in terms of the issue as to how long that person has to wait. Under the hospice program, the family member has all of the arrangement done. So my husband was moved within less than an hour of his death. EMS came, VIPD came, and then the funeral parlor was called.
Ms. Heiliger, are you in St. Thomas or St. Croix?
I'm on St. Croix.
Point of inquiry, Senator Gittins.
Thank you, Madam Chair. I think just to clear the air, EMS, to my knowledge, does not do pronunciation of deaths. It is a protocol for police and EMS to respond, but I don't think that we should let it be, leave the belief out there that EMS actually makes any pronunciation of death. That is not the case. And that's why we should have had the Department of Health Commissioner here as well in this discussion, but I've noticed that she's on the other bills coming forward, so we may have to ask this question so that we can get clarity on the issue. Thank you, Madam Chair, and I've already discussed with the good senator with regards to the certification of the language with the certified nursing homes. Thank you.
Point of inquiry, Senator Veerley.
Thank you, Madam Chair. Ms. Sanders, be specific as to how this particular bill would change the procedure that we're presently following. If this bill is passed, is there still a need for EMS and the police department to come?
No, it would not. It would eliminate that piece so that they could attend to more pressing issues. When a patient would pass, they would call the hospice. The registered nurse would go out, make the assessment and the absence of respiration and pulse, pronounce the time of death. We notify the funeral home. The funeral home would come out directly to the home and bring the deceased back to the funeral home.
Okay.
So it would eliminate EMS and VIPD.
Okay, and that I asked that question because the police department is involved in any death that occurs outside of the hospital, but we're talking about individuals who are in hospice care, who have some type of end-stage disease, and we know that they're going to pass away within a certain period of time from the disease that they have, and that is why this bill would allow for the registered nurse to do the pronouncement of death without having to call the EMS and public safety. So I just wanted to make sure that that is clarified. This is for hospice care, and hospice care is end-of-life care. So this will just make the procedure easier for that particular family in reference to being able to have the person who is now deceased to not be there for a long period of time. So like Ms. Heiliger just explained, if the person was in hospice care, they'd have been able to go directly to the funeral home after the RN makes the pronouncement of death. Thank you so much. Ms. Heiliger, my condolences to you and your family.
Thank you.
Thank you, and our condolences to you, Ms. Heiliger. But can you mute your mic for us, please?
I will do that now, yes.
I appreciate it. Senator Francis, bill sponsor, you may proceed at this time.
Thank you very much, Madam Chair, and I'm inundated with texts in regards to this particular measure, and I must say that, yes, this is a serious matter, and one that's, speaking towards compassion and empathy. I think a lot of times people don't understand or appreciate the stress and anxiety that is involved in someone passing. albeit that you're expecting it. When it happens, it's a different animal. There's a lot of anxiety there, and the worst of all is when you have to wait hours. Then to see that your loved one is sitting there, laying there, just waiting for the medical examiner, the EMS, or the Virgin Islands Police Department to respond, that just add insult to injury. So this is what the attempt is really to address that particular issue. And while we don't have the Department of Health, this bill was sent forth to them, and one of the technical issue that caused the bill to have been vetoed before was because of the lack of identifying that we wanted the Department of Health to actually promulgate rules and regulation governing this particular issue. So while we sit here, we don't expect to get into, I think we'll assist with this. There's the bill in itself speaks to certified home health agencies as well as certified nursing home. And while we may not have that today, down the road there should be some effort to really certify our home health as well as our nursing homes, because again, this assists with them being able to receive benefits that's through the CMS and otherwise. But all is not lost. I think that the amendments that have been suggested here today is one that we will take under serious advisement and move forward on. Those that's prepared today will certainly be included. And, if not, we have a second opportunity during the Rules Committee and even right before session to make sure that we're passing and moving a legislation that's critical. At the end of the day, ladies and gentlemen, when we and colleagues, what we're considering here is really to be compassionate during this difficult time and just seeing our loved one and just giving them the best send-off possible. Death is inevitable for all of us, but nonetheless, you want to make sure that there's some level of comfort and peace during that difficult time. So, whatever we could do to assist in that endeavor, I believe that that's what we should be striving to do here, rather than, again, allowing for the anxiety and what while we're saying this as well is that we take away from EMS and also the Virgin Islands Police Department that may be responding to other calls, because the police and EMS can't trump what's being done by the RN or the hospice officials that will be making the certification. All they do then is come, take vitals. EMS would come, take vitals, have to call back to the emergency room, then for the authorization to be given there. We have that same level of expertise in the hospice through a registered nurse, physician assistant, that could certainly make that decision in terms of the pronouncement. Let's not confuse pronouncement with certification. Certification still will be the responsibility of the medical examiner and a pathologist, whatever they intend to do there to make that certification that will go on the death certificate. What we're trying to do here is minimize the time that it takes then to pronounce. No vital signs, and certainly for the deceased then could be going towards the piece of rest rather than allowing them to just sit there in the homes while we wait for EMS, the Virgin Islands Police Department, and the medical examiners to transport. So thank you for your support. Thank you for your suggestions that have been made here. I certainly thank the testifiers for all of their valuable input on this particular measure. Thank you, Madam Chair, for the time. I think I'm satisfied with the robust discussion that have been had here this morning. Thank you.
Thank you, and it was a good discussion. And before we entertain a motion, I just wanted to go back to this nursing home conversation. And whether it's a certified nursing home, hospice, or whatever you call a comfort care, that's the care that you receive there. And for the resident, the nursing home is their home in most cases. That becomes the end of life when you go to the nursing home. Rarely do you go to a nursing home and then come back to your home. So I just wanted to add to this nursing home conversation, because I really don't think it should be removed from the legislation. It should, the language should say certified. At this time, motion? Oh, sorry. The committee stands in recess briefly. The Committee on Health, Hospitals, and Human Services is back on the record. For the listening and viewing audience, there are amendments to be made to the legislation, so the committee will vote on the bill as amended later on today's agenda. In the meantime, we know we have professionals on the screen, and we don't want to monopolize your day, so we are going to excuse you at this time. But before you are excused, Attorney Jacobs, you are allowed 30 seconds to conclude.
Thank you. Again, I wanted to thank you, Senator, and thank you, Chairman, for inviting us to give testimony. We definitely appreciate being able to contribute to this important issue. If there is any other matters that you want to bring to attention, if there is any way we can assist with this legislation, please let us know, because we definitely believe that the legislation also reflects the spirit. Maybe there may be some tweaking, but we believe that it reflects the spirit to ensure that individuals who are who are passing have some comfort and ensure that this is done, that everything goes as smoothly and swiftly as possible, and bring some peace to their family and loved ones.
Thank you, Attorney Thomas Jacobs. Ms. Rivera? You unmute, Ms. Rivera.
I'm sorry. Yeah, thank you, Senator Sau, for inviting Visner to be a part of this proceedings. And this is a very important bill that I think will benefit the people of the Virgin Islands as we go through these difficult times, and to make the transition from this life into the beyond as smoothly and as respectfully and as compassionate as possible. Because at times like this, added stress is not needed on the families. So we are fully in support of this bill. Thank you to all.
Thank you, Ms. Rivera. Dr. Amaro?
Okay, we're gonna have.
Good morning again, and I do want to thank the committee for inviting SRMC to provide information and its viewpoints on this matter. Again, we are in support of the bill. We are again stating that this is a pronouncement of death, as stated before, not a certification of death. And for the facets of being able to identify an individual's passing, I think the relevant skills related to the professionals listed in the bill are able to accomplish that and be able to provide that continuation of compassionate care and at the end of life measures that is being sought. And so for that purpose and for that reason, Schneider Regional supports the bill. Thank you very much for the invitation.
Thank you, Ms. Williams. And then Ms. Saunders.
Good afternoon. Good afternoon. JFL also thanks this committee on Health, Hospitals, and Human Services for the invitation to testify today. Although the provisions of this bill is not necessarily applicable to the acute care setting, we do stand in full support and solidarity of our community partners as the spirit of this bill does recognize the timely pronouncement of persons who have passed and the duty to provide them with dignity at the end of life. And so we do stand in full support of the provision, although it does not necessarily speak to acute healthcare settings. Thank you so much.
Thank you. And lastly, Ms. Saunders.
Thank you again for the opportunity to speak with you today. As you can tell, I'm in full support of this. It benefits those that face end of life at a time that can be difficult. And as stated, we can be anticipating someone's passing, but when someone passes, it's really a very sacred, important time in one's life, particularly the bereaved for it. Thank you again. And also, so that I can go on the record, Continuum Care will work very closely with the Department of Health and Human Services and the Department of Justice. So if there's anything we need to do to work on the continuation of this bill, we're happy to do so. Again, thank you for asking Continuum Care to be a part of today's testimony.
Thank you, testifiers, and some of you are in the second block. So at this time, the committee will start the recess. You are excused for those who are not testifying in block 2.
Okay, thank you.
The Committee of Health, Hospital, and Human Services is out of our recess at this time, and we'll be moving on to the next item on today's agenda. Madam Clerk, please call up that item.
Bill number 340040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter VA, establishing the Nurse Licensure Compact to create a multi-state nursing license, sponsored by Senator Kurt A. Violet. Invited to testify are the Honorable Justa E. Encarnacion, Commissioner, VI Department of Health; Yvette Rivera, RN, President, Virgin Islands State Nurses Association; Joyce Heiliger, RN, MSN, MPH, Executive Director, Virgin Islands State Nurses Association; Carmen Vanterpool Romney, RN, BSN, CPM, Territorial Executive Director, VI Board of Nurse Licensure; James Jim Ponte, MS, Director, Nurse Licensure Compact, NLC; Rebecca Fuchs, JD, Director, State Advocacy and Legislative Affairs, National Council of State Board of Nursing; Luis O. Amaro, MD, Interim Chief Executive Officer, Schneider Regional Medical Center; and Ms. Daima Williams, Interim Chief Executive Officer, Governor Juan F. Louis Hospital and Medical Center.
Thank you very much, Madam Clerk. At this time, we'll go to do a quick mic check for those individuals that will be testifying as well in this particular measure. And we will first go to Commissioner of Health, Honorable Justa Encarnacion.
Good morning, Senator, Commissioner Justa Encarnacion.
Very well. Do you have anyone else with you, Commissioner?
Yes, I do, sir. Assistant Commissioner Nicole Sims, could you identify yourself, please?
Good afternoon, Dr. Nicole Sims, Assistant Commissioner, Department of Health.
Dr. Tyhan Caesar, Medical Director.
Good morning, Dr. Hunt Caesar, Medical Director, Department of Health.
And Deputy Commissioner Hadiya Charles.
Deputy Commissioner?
Good morning. Deputy Commissioner at the Department of Health.
Anyone else? I think I saw Ms. Deborah Richardson Peter on the line as well.
Yes, she is. Director Deborah Richardson Peter, and my apologies.
Okay. Very well.
No problem. Good day.
All right, thanks. And President Rivera, just a mic check real quick.
Good afternoon, Senator Francis, other testifiers.
Good afternoon.
With me this afternoon, I have Ms. Janet Habler, MSN RN. She's a Senior Associate Director of Policy and State Government Affairs of the American Nurses Association, along with Ms. Joyce Heiliger, our Executive Director. Also, Ms. Charlene Jones, who is the Treasurer of the Nurses Association. Thank you.
Very well, thank you. Ms. Heiliger is on the line. Ms. Heiliger, just a real quick mic check.
Yes, sir, I'm here.
Okay. Ms. Romney, Vanterpool Romney.
Good morning, Senator. Good afternoon, rather. Sorry.
Good afternoon. Good afternoon. And I know that the director of the Nurse Licensure Compact, Mr. Puentes, had to jump off to another call, so we'll go to Attorney Focht. You're recognized for mic check.
Yes, good morning. And I could also cover Jim Puentes, the director of the NLC's testimony as well.
Thank you for that, and we'll come to you shortly. And then we'll go to Dr. Amaro for mic check.
Good afternoon, Senator. Good afternoon, testifiers.
Good afternoon. Interim Chief Executive Officer, Ms. Daima Williams from the Governor Juan Louis Hospital and Medical Center.
Good afternoon, Senator Francis. Good afternoon, everyone.
Very well. You have anyone else with you this afternoon?
I do have members of my executive team present for any questions you may have. Present with me is Siobhan Thomas, legal counsel. We have Ms. Moorhead, our chief financial officer, Terry Lynch, our acting chief of HR, and our chief operating officer, Ms. Hazel Filbert.
Very well, thank you. At this time, we'll go to the bill sponsor for presentation of Bill 34-0040. Senator Viale, you recognize.
Thank you so much, Mr. Chair. Mr. Chair, I offer Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license. Senator Giddens have also just signed on this particular measure. What this measure does, it allows a nurse to have one license to practice in multiple states. So if you're able to, if we join the compact and you have a license in the Virgin Islands, you'll be eligible to practice nursing in the 35 such states that also have an impact. The reverse is good for the Virgin Islands because under this particular NLC, there are over 2 million nurses that are members of Nurse Licensure Compact, and the nurses from all of those various states would be able to utilize their home state license and practice in the Virgin Islands, and their home state license falls within the same qualifications that we have. They must pass NCLEX, etc. But the good thing is that the bill retains the ability of the local board to be able to conduct a criminal history check and everything. As a matter of fact, it mandates that you must go through that whole criminal history background before the individual is allowed to come and actually practice in your state. Recently, we have had a large number of nurses in and out, especially for our dialysis centers, nurses from the mainland, and at times there's a bottleneck in terms of being able to have the local licensure in the Virgin Islands. What this does is it offers reciprocity. States that have already gone through that particular process and have a nurse licensure compact, and if we pass this bill, we'll be joining those states. They would be able to practice in the Virgin Islands because of the reciprocity once the requisite criminal history have been checked. I think we can't go wrong with this particular legislation. More than 35 states presently have it. Guam have recently passed legislation in reference to adopting the Nurse Licensure Compact, and I think it can only help to fill the void that presently exists in the Virgin Islands in reference to the lack of nurses. I look at the facility that we recently toured, JFL North, and the fact that they have 100 bed, and despite the fact that they have 100 bed, they will not be able to staff up that 100 bed unless they have additional nurses. This would allow somebody from New York to say, well, I want to go to the Virgin Islands for 9 months and practice in the Virgin Islands for 9 months. And let me not use New York. I don't know if New York is one of the states in the compact. Let me use Texas or Florida or Arizona or New Mexico, Colorado, Alabama, South North Carolina, Virginia. All of these are under the compact. They would be able to say, we'll come to the Virgin Islands. We'll practice for 9 months down there because our present license that we have in Florida or Texas is applicable once we are able to pass the criminal history record. We need to reduce that requirement of individuals who are trained, are licensed, sanctioned by various jurisdictions, having to go through that same exact process again when they've been a nurse for 20, 30 years. And the same would apply for nurses on the Virgin Islands. It opened the door for them. So I don't see how it would impact our local workforce. It can only add. And we have so many Virgin Islands nurses across the nation. So many. This would give them an opportunity to come down and test the waters. And then there's language in there, if you change your primary state, etc., then you got to change certain stuff. But if they're thinking about relocating and not losing or having to apply for an additional license in the Virgin Islands, this would allow them to use the Georgia license, pass a criminal history background check, come down, practice for a couple months, see whether or not they like it, and hopefully they'll return home. So I think that this is a win, colleagues. I'm asking for your support. I'm open to anybody who is willing to sign on, like my friend Senator Gittins did, and Senator Francis is going to sign on. I think Senator Blyden is going to sign on. So colleagues, let me know. There's some technical areas that we're going to correct with numbering, subsection, and the date. And there was a mistake with the date on the back. It says 2019. That was the old legislation. It's from back then. This bill is over 3 years old, but the new date is going to be reflected. Those changes have been submitted to legal counsel. Thank you so much, Mr. Chair.
Thank you very much, Senator Viale, for your presentation on Bill 34-0040. At this time, we'll go to Dr. Morrow to be able to present because he has to jump off the call real shortly. So we'll come back to you, Commissioner. I know you're ready to go, right? But we'll come right back to you. Dr. Morrow, you're recognized for your testimony at this time.
Good morning, Honorable Senator Novelli Francis Jr., Chairman of the Committee on Health, Hospitals, and Human Services, other members of the 34th Legislature present, fellow testifiers, members of the press, the viewing and listening audiences. I am Dr. Luis Morrow, Interim Chief Executive Officer of Snyder Regional Medical Center. Thank you for allowing me to provide testimony on behalf of SRMC on the proposed legislation BR 210134, formerly Bill 330228, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the nurse licensure compact to create a multi-state nursing license. Primarily, we agree with the tenets of this bill. Specifically, it aims to significantly improve the long and arduous nurse licensing process here in the Virgin Islands. Given our critical shortages of RNs and allied health professionals, we need new approaches to improve access to essential personnel. Having a national nurse licensure compact will give us such access by allowing these professionals the option and convenience of choosing multiple locations to work from, including the Virgin Islands. According to the National Council of State Boards of Nursing, Incorporated, the nurse licensure compact allows a nurse whose primary state of residence is in an NLC state to hold one multi-state license with authority to practice in person or via telehealth in both their home state and 33 other NLC states, which fosters greater nursing mobility and the public's access to healthcare. The COVID pandemic highlighted our critical need for such clinical professionals. There was essentially a bidding war for RNs at the height of this crisis. Without the support of travelers and powerful staffing, we would not have been able to develop and maintain our facilities to accommodate our local population in the event of a COVID surge. The benefits of the NLC are numerous, but we are also cautious of the risks that are associated with deficiencies in background checks and licensure requirements. Each state or territory has different requirements for its nursing and allied professional licenses. This could mean some of the VI licensure board requirements may not be addressed in the compact's uniform policy. As such, we must ensure the compliance and enforcement noted under Article 5 of this bill, which requires states to participate in the enhanced NLC to conduct federal criminal background checks to determine eligibility for a multi-state license. We must ensure all safeguards that are built into our current state licensing process are required before a nurse is issued a multi-state license, and that the nurses practicing within the NLC have met a set of minimum requirements regardless of the home state in which they are licensed. Honorable Chairman Francis and the members of the Committee on Health, Hospitals, and Human Services, thank you again for allowing us the opportunity to give testimony on this proposed legislation. I am prepared to take your questions.
Thank you very much, Dr. Morrow. At this time, we'll go to the Commissioner Encarnacion for her testimony.
Thank you, Senator. Before I get started, I just want to say that I'm actually very honored to be on this the testimony today with the executive chair of the VISNA, as well as the president of VISNA and my other fellow nurses. Good day, Honorable Senator Noble E. Francis Jr., Chair of the Committee on Health, Hospital, and Human Services, Honorable Senator Marvin A. Blyden, Vice Chair, committee members, and all other members of the 34th Legislature of the Virgin Islands of the United States, and of course, the listening and viewing audience. I am Justa E. Encarnacion, Commissioner of the Virgin Islands Department of Health. I have here with me today Dr. Nicole Cragwell Sims, Assistant Commissioner, Hadia C. Charles, who is our Deputy Commissioner over Regulatory Affairs, as well as Dr. Ty Hunt Caesar, our Medical Director for this particular bill. Thank you for the opportunity to testify on BR 21-0344, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter establishing a nurse licensure compact to create a multi-state nursing license. The Nurse Licensure Compact aims to increase access to care while maintaining public protection. Under the Nurse Licensure Compact, nurses can practice in other Nurse Licensure Compact states and/or territories without having to obtain additional licenses, as Senator Villalay indicated. The general purpose of this compact is to facilitate the territory's responsibility to protect the health and safety of the public, ensure that and encourage the cooperation of the Nurse Licensure Compact states in the areas of nurse licensure and regulation, facilitate the exchange of information between Nurse Licensure Compact states in the areas of nurse regulation, investigation, and adverse actions, promote compliance with the law governing the practice of nursing, decrease redundancy in the consideration of issuance of nurse licenses, and provide opportunities for interstate practice by nurses who meet uniform licensure requirements. The Nurse Licensure Compact would allow registered nurses and licensed practical vocational nurses to have one multi-state license with the ability to practice in their home territory state and other Nurse Licensure Compact states. Under the Nurse Licensure Compact, there will be cooperation and sharing of information regarding licensure, regulations, investigations, and adverse outcomes or actions between these states. This is a model act that aims to standardize nurse licensure throughout the nation. It will improve retention and recruitment by offering community. The Department of Health is satisfied with the definitions in Article 2, along with the clearly identified proposed structure and operations of Compact, as described in the bill's summary. Article 1 defines the purpose of the Compact. Article 3 details the general provisions and jurisdiction of the Compact, and Article 4 provides additional authorities invested in party state licensing boards. Article 5 provides for a coordinated licensure information system for the exchange of information. Article 6 establishes the Interstate Commission of Nurse Licensure Compact Administrators. Article 7 sets forth rulemaking powers of the Commission. Article 8 provides for oversight, dispute resolution, and enforcement of the Compact. Article 9 outlines the effective date and provisions for amendment of the Compact, and also requirements for withdrawal from the Compact. Article 10 addresses construction and severability. The enactment of the bill will call for modernization of the current board structure that may require the need for increased finances and resources. In order for this legislation to be fully enacted, the following is necessary: the hiring of additional personnel, IT upgrade, securing of funds for purchasing of equipment and maintenance agreements, and reestablishment of operations. In conclusion, the department would like to thank Governor Albert Bryant Jr. and his team for presenting the bill to this committee for review and consideration, and Senator Villalay for sponsoring the bill, and Senator Giddens for signing on. Senator Francis of Virgin Islands Department of Health strongly supports this measure and remains committed to reducing health risk, increasing access to quality health care, and enforcing health standards. The VIDOH family, thank you for all that you do. We celebrated Public Health Week last week, but our mission continues, and so does our appreciation for you and your families, for they share you with us. Senators, we look forward to our continued collaborative efforts with the members of the 34th Legislature. This includes our testimony. I welcome the opportunity to respond to questions you may have. Thank you, Senator.
Thank you very much, Commissioner Encarnacion. Of course, we're going to be asking you how much money you will need to assist with the implementation of this measure, so we could have that discussion later on, since you have already put it out there. But at this time, we'll go to the Interim Chief Executive Officer, Daima Williams, for her presentation on behalf of the Governor Wang F. Louis Hospital and Medical Center.
Thank you so much, Senator. Good morning, Honorable Chairman Novell E. Francis Jr., Chairman of the Committee of Health, Hospitals, and Human Services, honorable committee members, other senators of the 34th Legislature of the United States Virgin Islands present, and the listening and viewing audience. My name is Daima Williams, and I am the Interim Chief Executive Officer of the Governor Wang F. Louis Hospital and Medical Center. Our understanding is that this proposed legislation, Bill number 34-0040, amends Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter which establishes the Nurses Licensure Compact to create a multi-state nursing license. To date, legislation for the Nurse Licensure Compact has been passed in 34 U.S. states. For JFL, this is equivalent to 34 opportunities for robust recruitment efforts in states that are members of the NLC. We believe that instituting the Nurse Licensure Compact will result in streamlined licensure, as some of the burden of licensure process will be relieved by the Virgin Islands Nursing Board. This will ultimately result in a shorter recruitment process and allow JFL to fill positions quickly. Without question, we are in favor of this bill, as the ultimate result would be improved access to care. The shortages of nurses in the Virgin Islands is not a challenge that is limited to JFL or the territory. It is estimated that by the year 2025, there will be a nursing shortage of 500,000 nurses in the United States. Below or included, we provided a visual representation of the factors driving the nursing shortage. JFL is in support of this bill, and we consider the NLC as a first step in conquering a nationwide nursing shortage and access to the critical care needs that our nurses meet every day. Suggested amendments: funding for a robust website. We would request that funding for the full implementation of an online-based application be allocated with the passage of this bill. Without funding for all costs of online implementation, this bill will have little impact on the speed of multi-state nurse licensure. We provide a screenshot of the landing page of the Florida Board of Nurse Licensure website for ease of reference. This website includes the ability to apply, renew, check the application status, and verify licenses and file complaints. 2, for the future, nurse retention must also be addressed. In addition to recruiting, this bill may also result in nurses choosing to leave the Virgin Islands. As such, retention of our hardworking nurses that are already here must be addressed. I cannot say enough about the dedicated group of nurses that ensure quality care for JFL's patients every day. Every gunshot wound victim, every trauma victim, every abused child on island of St. Croix comes to JFL. While recruitment is important, please do not forget our local, experienced, dedicated team members who are culturally competent and have already vested in our community. We ask for this body's consideration of financial incentives for retention of our current nursing staff, including competitive salaries for all nursing disciplines, a viable employee benefits package, and an attractive retirement package. We also request all support for the opening of JFL North, as a modern healthcare facility is important for staff satisfaction and ultimately nurse retention and recruitment. In addition, a housing purchase incentive would attract would be attractive to nurses that already employed a JFL or nurses that left the territory and are now interested in seeking home ownership on the island that they come from. Lastly, we also ask this honorable body to take another look at Bill number 33-0053, a bill which afforded cash incentive payments, relocation payments, and delayed retirement bonuses for nurses, teachers, correction officers, and police officers. In closing, JFL thanks this body for taking a special interest in the recruitment of nurses to the territory at this critical time. Thank you for inviting us to testify regarding this bill, which addresses the nursing shortage and the proposed statutory intervention to address this shortage. We thank our current nursing staff for their dedicated service to JFL. Our JFL caregivers are truly warriors for healthcare on the island of St. Croix. To them, we say, thank you for caring and your concern for our patients and our community. I want to thank Honorable Senator Novelli Francis Jr., Chairman of the Committee of Health, Hospitals, and Human Services, and the members of the committee for the opportunity to provide this testimony here today. I would also like to thank the bill sponsor, Senator Kurt Violet, for his vision and his heart for healthcare. I will be happy to answer any questions you may have on this bill. Thank you.
Thank you very much, Interim CEO Williams. At this time, we'll go to President Rivera for her testimony from the Virgin Islands State Nurse Association. You're recognized for your testimony.
Good afternoon, everyone. Good afternoon, Senator Francis, Virgin Islands State Nurses Association. Thank you, and other members of the Committee of Health, Hospitals, and Human Services for the invitation to give our address on this bill, bill number 34-0028 and bill number 34-0040. The bill number 34-0040, Nursing Compact Licensure for the Virgin Islands. Our position is that a significant amount of work is still needed for all relevant stakeholders before we formulate a position. A reference document from the American Nurses Association is attached to this testimony for distribution. Additionally, Ms. Janet Havler, Senior Associate Director, Policy and Governmental Affairs for the American Nurses Association, has been invited to be on the call as one of our subject matter experts. Consideration has to be given to the following: the demand and rationale for the compact licensure in the Virgin Islands, the financial impact for the VA Board of Nurse Licensure, its administrative capacity to implement this type of licensure, and redetermination of its regulatory role, the impact on the Nurse Practice Act, the current process for increasing the workforce during a declared local or national emergency. Voices of the Professional Nurse Association, VISNA. Protecting the nurses in the territory through labor representation and collective bargaining contracts is a voice that will be lessened. If this compact licensure is enacted, it can allow out-of-state territory nurses to easily replace Virgin Islands nurses who are advocating for safe work environment and fair compensation. VISNA believes that we should be recruiting and returning our own nurses to remain in the territory, building our economy, and most importantly, representing the culture of our communities. VISNA is cognizant of the fact that we are a diverse community with different cultures. Concern about the public safety would be the influx of nurses outside of an emergency, such as a natural disaster or the pandemic that we're currently in, who are not familiar with the Virgin Islands Nurse Practice Act, which, by the way, needs revision. Further research is needed, and we ask that this bill be tabled at this time. Again, thank you for inviting the leadership of the Virgin Islands State Nurses Association to testify in this matter. We ask that such invitations continue to be extended for all legislative matters pertinent to nurses and their practice. With me are the other members of the VISNA board who will assist in answering questions the committee may have. And again, I extend thank you for being part of this very important matter. And we stand ready to answer any questions that's put forward to us. Thank you.
Thank you very much, President Rivera. Executive Director Halliger, do you have a separate testimony, or you satisfied with what was presented already?
None, sir. Thank you.
Very well. Also, at this time, we'll go to Director Attorney Faust for her presentation, and also you'll present on the behalf of Mr. Puentes as well. You're recognized for your testimony.
Thank you. Good afternoon, everyone. I will start with Mr. Puentes' testimony. I think that would probably be the easiest because this will give a background on, or a background on the compact and how it functions, a very quick background, just so that everyone can have a good sense of how the compact operates. So first off, what is a licensure compact? It is a statutory agreement. So all states must must enact the model legislation so that they are all kind of agreeing to the same contractual compact, if you will. That's why the Virgin Islands introduced this model legislation. It allows a nurse to have one multi-state license in the state that she resides in, and then to use that license to practice in any of the other compact states or jurisdictions. There is no check-in process. There is no additional fee. It allows employers to recruit easily nurses to fill those gaps in care and have them start immediately, which is so vital when it comes to when there are healthcare shortages as well as disasters. Another benefit is that the NLC permits the nurse to practice in other compact states via telehealth. So telehealth, particularly during this pandemic, has really been booming, and it allows those nurses to practice on any patient in a compact state via telehealth without having to get an additional license. As has been stated, there are currently 35 states that have enacted NLC legislation, Guam being the most recent just this year. We're excited Guam is the first territory, and we're very excited that the U.S. Virgin Islands will hopefully be the next. So that is about 2 million nurses that currently hold a multi-state license across the country.
Excuse me, Attorney Fosh, do you want to share your screen to show the PowerPoint presentation, or you just be reading it?
Oh, sure. Yeah, absolutely. I will do that right now.
Yeah, if you could just go back to that last slide, I think is important to show the members of the licensure compact. We could start from there.
Sure.
Go ahead.
Hold on a minute. There we go. Can you see that?
Very well, yes, on the slideshow. Okay, great. Go ahead.
Perfect. So again, just backtracking a little bit. So here are the 35 states and territories that have currently enacted the NLC, and that amounts to about 2 million nurses that currently hold a compact license. The states that are green are states and jurisdictions that currently have a pending NLC bill this session. So as you can see, it's almost the entire United States and territories have either passed the NLC, or they have a current bill pending to join the NLC. One of the big advantages of the compact, or one of the many, is that it allows a state to be more prepared during times of a disaster. Most recently, the COVID-19 pandemic has shown us this, but even prior to that, hurricanes and any large natural disaster, the compact is invaluable to bring in nurses to help during those times. This is a report that shows the 10 top indicators of whether or not a state is prepared for a public health emergency. And one of the number one indicator for incident management is the adoption of the Nurse Licensure Compact. This is a listing of all of the different organizations that support the NLC. And I like to show this slide to highlight that the support is really across the board, that there are many different entities that support the compact, for many different reasons. Of course, nursing organizations support the compact because of the benefits to that nurse, which is cost savings and less burdensome kind of bureaucracy to be able to practice across state lines. AARP and a consumer group like that is very supportive of the compact. The Department of Defense and the National Military Family Association is very supportive of the compact because it allows their military spouses to easily start a new nursing job when they are relocated, which happens very often when they're in the U.S. military. As well as the American Red Cross, again, because of that disaster preparedness. So, again, this is a long list, but just like to show that the support is very varied. So in order to receive a multi-state license, you must first meet the home state's qualifications. So anything that the U.S. Virgin Islands currently requires for a multi-state license, that will still be required post-compact for a nurse applying for a compact license in the Virgin Islands. The nurse must also graduate from a qualified education program, pass an English proficiency exam if they're a foreign grad, only then. Pass the NCLEX, have no active discipline, submit to a criminal background check, which I know some previous testifiers have brought up, and it is very important and a new addition to this compact, and not currently be enrolled in an alternative to discipline program. And if you are, to self-disclose that. Have no misdemeanors related to the practice of nursing, no prior felony convictions at all, and have a valid Social Security number. These 11 requirements are contained in the compact language, and every nurse that has a multi-state license, a compact license, must meet all of these 11 requirements. There was discussed previously about different standards across the states and territories. These 11 licensure requirements is the compact's way to address that so that states can be confident that any compact nurse has, at a minimum, met these 11 requirements and have already been vetted to practice in their state or territory. I wanted to really quickly go through the disciplinary process because oftentimes there are questions about how nurses would be disciplined with a compact license. The remote state, so that would be the state that the nurse is practicing in, so not the state that she resides, but a different state where she's practicing under her compact license. That state is able to take action, disciplinary action, against a licensee's privilege to practice. And what the privilege to practice is the licensee's ability to practice in that state. So let's say a nurse with a Florida compact license travels to the Virgin Islands, assuming that the U.S. Virgin Islands joins the compact, travels to practice in the Virgin Islands, and an incident occurs, then the Virgin Islands would be able to take discipline and revoke that nurse's ability to practice in the Virgin Islands. And then that information would then be sent to the home state. And the home state, the state that actually issued the license, would be able to discipline that license. When a home state disciplines the actual nurse's license, then that would suspend the nurse's ability to practice on that compact license until the discipline has been accomplished. And I know that's just a very quick overview. So of course I will be available to answer any of the questions on that disciplinary process. The commission is a body made up of the heads of the boards of nursing of each state. They are the commissioners, and they meet twice a year in person and typically twice a year over teleconference. And they meet to discuss issues within the compact, how it can operate its best, just anything having to do with the kind of operations of the compact. There were a few times already that the expenses of the compact have been brought up, which of course is very important. Something that I would just like to highlight is that NCSBN, that's the National Council of State Boards of Nursing. We do offer grants to states and territories to implement the compact. We recognize that it can be a big lift for some states and territories, and we do offer assistance in that way. So some of the examples would be IT updates, updates to the IT infrastructure, including if any temporary staff would need to be employed to kind of help with that switch to the compact, expenses implementing a criminal background checks, as well as, even expenses to promote and educate nurses and hospitals on what the NLC is and how the NLC operates. So that is a grant process that the U.S. Virgin Islands Board of Nursing would apply to NCSBN for, and I can tell you that there has not yet been an instance where any grant proposal has been rejected. So you can rest assured that there is assistance when it comes to that implementation process. So that is a very quick overview. Again, I will be available for questions, and then if it is all right, I will move on to read my testimony.
You may proceed with your testimony at this time.
Thank you. Let me just stop. I want to stop sharing my screen. There we go. Okay. So, dear Chairman Francis and committee members, on behalf of the National Council of State Boards of Nursing, I'm writing to voice my support for Bill 34-0040, which authorizes the Virgin Islands to join 35 states and territories in enacting the NLC. The NLC allows registered nurses and licensed practical nurses to have one multi-state license.
Slow down a little bit for me, please. Slow down a little bit.
Oh, I'm sorry.
Yeah, right. Go right ahead.
The NLC is a vital tool to address nursing shortages as well as the fight against COVID-19. The NLC enables nurses to immediately cross borders and provide services to fill gaps in care. This is an important tool to help alleviate the nursing shortage in the Virgin Islands, as well as in times of disaster like hurricanes, when healthcare staffing is strained due to an increased patient volume and loss of healthcare workers. During the COVID-19 pandemic, nurses in NLC states were able to immediately cross state lines and treat patients. This mobile nurse workforce is vital to cover gaps in care, both during disasters as well as beyond. The NLC has many patient safety provisions, including the 11 licensure requirements to ensure that every nurse practicing under a compact license has been vetted and meets these statutory standards. A federal criminal background check is included in the licensure requirements. The Virgin Islands will likely need additional FBI-approved language to implement those criminal background checks for compact nurses. The NLC has been operating for 20 years, over 20 years, and no state has ever repealed the compact language. In fact, the compact has continued to grow, and most recently, Guam became the 35th jurisdiction to enact the NLC. The U.S. Virgin Islands can bring needed relief to the hospitals, nurses, and patients by enacting the NLC. The NLC increases access to healthcare, protects patient safety, and is a crucial tool to address the nursing shortages. Thank you for your time on this important piece of legislation, and I will be available for any questions. Thank you.
Thank you very much, Attorney Fosh, for your testimony there. I think this completes the round of testimony and Bill 34-0040, and we'll be moving toward a 5-minute round at this time, and we'll start with Senator Asoro. You're recognized for your 5 minutes at this time.
Thank you, Mr. Chair, and good afternoon to all. I want to go to the Board of Nurse Licensure, or not Nurse Licensure. Ms. Heiliger. Is Ms. Heiliger there?
I'm here, Senator.
Well, sorry, Ms. Rivera. I apologize, Ms. Heiliger, for harassing you.
Hi, good afternoon. Good afternoon. This is Arnel Commission for Board of Nurse Licensure. We did not get to testify.
That's right.
I'm sorry, who's this?
The Board of Nurse License, the VI Board of Nurse Licensure did not get to testify.
Very well. We're sorry for that. Let's get you to go ahead and do your testimony at this time. As Ms. Commission, you'll be the one testifying on it?
No, Ms. Romney will be the one testifying.
Very well. My apologies. Ms. Romney, you recognized for your testimony at this time. I'm sorry you're overlooked.
Thank you, Senator. Good afternoon, Honorable Senator Noble E. Francis Jr., Chairman.
Yeah, please, we have to mute one of the mics. You may proceed.
I'll begin. Good afternoon, Honorable Senator Noble E. Francis Jr., Chairman, Committee on Health, Hospitals, and Human Services, other members of the committee, other testifiers, and members of the community. Thank you for allowing the Virgin Islands Board of Nurse Licensure the opportunity to offer testimony on Senate Bill number 34-0040 and the Virgin Islands joining the Nurse Licensure Compact, NLC. My name is Carmen Vanderpool Romney, and I am the Executive Director of the Virgin Islands Board of Nurse Licensure. I have with me in the room Mrs. Arnel Lewis Commission, Ms. Tanisha Penn, and Ms. Juliet Petty. According to the American Nurses Association, the nurse licensure is a form of mutual recognition in which the licensing authority voluntarily enter into an agreement to legally accept the policies and processes licensure of a licensee's home state. The foundation for this agreement is a shared consensus on standards for nursing licensure and professional practice. Once a registered nurse and obtains a license in her or his home state, which is the state of residence, this license is recognized by any of the other mutual recognition party state in which the compact has enacted. Should the state of residence change, a new license must be obtained. A nurse may hold only one home state license at a time. I will now give you a brief history of the Nurse Licensure Compact and the Virgin Islands Board of Nurse Licensure. Previous board members have looked at the Nurse Licensure Compact, but did not see it as beneficial to the Virgin Islands. One of the primary reasons given was the potential loss of revenues to the Virgin Islands government. The present board has already begun to revisit the consideration of the VI as part of the Nurse Licensure Compact. A meeting was held in 2020 with NLC to begin deliberations. You may reference my testimony in the 2020 budget hearing indicating this commitment under our major accomplishments, item number 4, which stated that the VIBNL received a presentation on compact nursing through NCSBN, the National Council State Board of Nursing. The then board began reviewing the disadvantages and advantages with the territory becoming part of the compact. So what are some of the advantages of the NLC? 1, nurses with more than one license who reside in the Virgin Islands will now be able to apply for compact from their resident state being that the Virgin Islands. Nurses will have free movement between compact states. And so what are some of the disadvantages of the nurse licensure compact? 1, less retention of local nurses in the Virgin Islands. Possible loss of revenue. 3, removal of most local state involvement with nurses coming into the territory. 4, allow institutions to hire nurses without the participation and knowledge of the board. 5, institution will not have to go through the Virgin Islands Board of Nurse Licensure to hire a nurse who is part of the compact. 6, any nurse who is part of the compact can gain employment without going through the credentialing process of the local board. 7, the Virgin Islands Board of Nurse Licensure does not have the authority to revoke licenses from those who are not licensed in the VI, although they committed an infraction while working in the VI. The Virgin Islands Board of Nurse Licensure does not have an official position currently. Most of the members are new and have not had the opportunity to investigate and become more familiar with the statutes of the Nurse Licensure Compact. Thank you, Senator Francis, for the opportunity to make this presentation on Bill number 34-0040. We are humbly requesting that deliberation be delayed, allowing the board and our key stakeholders time to do due diligence. Thank you for your time today. We would be happy to answer any questions you may have at this time on behalf of the Board of Nurse Licensure.
Thank you. Thank you very much. Executive Director Romney, for your testimony. Was it your position, you said that the licensure board do not have a position at this time? Ms. Romney?
No, we do not, Senator.
Very well. Thank you. At this time, we'll go to Senator Sorrow. You recognize for your 5 minutes.
Thank you, Mr. Chair. I'll repeat what I said last week. My father's a Vietnam War veteran, and he's always told me to take a position and stand by your position. Because when you sit on the fence, you get shot from both sides. So the Board of Nurse Licensure, why do you not have a position today? Even if it's a position with some level of provision, that helps us.
As we mentioned in the testimony, it will, because this bill, it was given to us within such a short space of time. The board members who are new did not have time to meet completely and deliberate the compact.
So in part of your budget testimony, as you put in your testimony, part of the budget hearing, you indicated that the Board of Nurse Licensure was looking at this type of legislation, correct?
And you are correct. That was the then board, because now we have new board members. all the members are now asking is for them to have enough to give them time so they can meet with the stakeholders, which is something we did not get to do, who will be affected by this bill, including most of all, even the community nurses. We did not have that opportunity. So this is why we're asking for the opportunity and to impart in our responsibility to ensure patient safety and also to the nurses in the
So here's
Virgin
the
Islands.
question. The question would be, presently then, how long does it take for a license, a nurse license to, or the application to go through? What's the average time?
Oh, that's a very good question. Currently, to answer that question, honestly, it takes as quickly as we are sitting here for that license to be completed. One of the reasons, and based on what you have asked, we have heard many times that the board take forever to complete a license. On the record, this is incorrect.
So how long does
Since
it
I've
take?
been here since 2019, the board, an application can, once all the paperwork is in the presented to us, we will have that license in less than maybe within 24 hours. What was presented was cases where individual had disciplines, and we cannot approve, at least in this office, everything goes before the board.
Okay,
If
here's the
there's
next
a discipline,
question.
that nurse will go before the board. The board will not give that nurse the okay to practice in
Okay,
the
so Ms.
territory,
Vanterpool,
just
Vamni.
like that, because she's okay by her home state. Even though her home state might be okay with the infraction that she had against her license.
Hold a second,
there's
Ms.
a possibility
Romney.
that the board may not be.
Ms. Romney, you just took
So
like 3
therefore,
minutes.
those are some of the delays in which we have, and most nurses who
Ms. Romney?
and senators who are there can. I have spoken to
Romney?
some offices. These nurses had infraction. They did not submit all their documents. Those are the kind of things that delay a
Romney?
license. But
Okay,
we
Ms.
say on
Romney,
the
there's a
application up
follow-up.
to 90 days.
Please.
It is much faster than that.
Ms. Romney,
And I think that with the staff that we have, we are doing very well. And I give
Ms. Romney, I'll wait the next follow-up question. Senator Saro would like to follow up on her question at this time.
Okay, so this is a yes or no. Are your applications online at this time?
They are not online because you want a yes or no answer, correct?
Okay, they're not online. Okay, so how does the recruiting efforts of nurses, what does that look like? I guess I'll flip over to the Department of Health. Well, Commissioner Connessy.
What was the question, Senator? Could you repeat, please?
So this is not for you. I want to go to the Commissioner of Health at this time. Because you spoke for like 4 minutes of my 5 minutes. So I'm just trying to get a little two questions here this
Okay,
afternoon.
no problem.
Commissioner Connessy, do we have a shortage of nurses?
Actually, we do, especially right now that we are in the middle of the pandemic. And so we are seeing that throughout the territory.
With your indulgence, Mr. Chair. And is it safe to assume that most of our nurses work more than one job, right? You find them at the hospital and then they run over to a nursing home and then they run someplace else. And is that safe to assume that on record?
Many of our nurses, allied health as well as, but many of our nurses do work 2 jobs.
Okay.
Or work overtime at this point in time.
And they're working overtime because there's a shortage of nurses, right?
Correct.
Okay.
And ICO Williams as well as Dr. Mara can, ICO Dr. Mara can attest to that as well.
Okay, so let's put on record. ICO Williams, yes? No? Maybe so?
Yeah, no, I would absolutely agree with the commissioner. There is a profound shortage of nurses available in the territory. And as we expand from our current JFL to JFL North, we just anticipate that need is going to be more profound.
And then Dr. Amaro? Oh, he left. Okay, my apologies. So what does our recruiting efforts look like? And in the absence of, so if UVI is not And we go to the UVI commencement ceremonies, and UVI there's usually 6 or 7. We go to the, what do you call it, when you put a white thing on the head? The capping? Excuse me. What is it called, Commissioner?
Yeah, well, we have a pinning ceremony.
Pinning. Okay, so we go to the pinning ceremonies, and it's literally like 6 or 7 of them. And you go to graduation, it's like 6 or 7 of them. So when our local university is not even meeting the need of its local community. So I would just conclude by stating I am in support of the legislation in light that we have a pandemic, we have a shortage of nurses. And when you look at the median income of nurses, it's $73,000 across the nation. I think we start at somewhere like between 65 and 70. So I think that our nurses are starting within the ballpark of the median income across the nation. So, Mr. Chair, I look forward to voting in the affirmative at the appropriate time, and I would urge the Board of Nurse Licensure to modernize its licensure process, and applications need to go online like yesterday. Thank you, Mr. Chair.
Thank you very much, Senator Sorrow. Before we go to the next senator, which will be Senator Fred Gregory, I wanted to ask Attorney Fosh, if are you aware of what is the passing score that's required for the NCLEX, the examination NCLEX? What is the passing score that's required for that?
So that would differ from state to state. So the compact doesn't articulate what that score is. It's just that the nurse must have passed the exam, and then each state will determine what they would declare to be their passing score.
Very well. From your research or work, are you aware of what is the passing score in your state that you represent?
You know what? I don't know. So I'm in Illinois. I'm actually not a nurse. I'm an attorney. So I don't know, but I could certainly find that out and how they differ throughout the states, and I could send that to the committee.
Very well. Thank you. Senator Fred Gregory, you're recognized for your 5 minutes. Thanks.
Thank you, Mr. Chair, and good afternoon to the testifiers. I want to go back to Ms. Nurse Rumney because in her testimony, she spoke specifically about the disadvantages of the NLC. However, you numbered them, Nurse Rumney, but you didn't give an explanation as to why you came to the conclusions that you came to. For instance, when you made, in the first one, you said one of the disadvantages is the less retention of local nurses in the Virgin Islands. So help me to understand how you came about with that particular disadvantage. What is the, where are you getting your information from to come up with that conclusion?
Okay, some of the conclusion is not Ms. Vanderpool, but the board. But the less retention of local nurses must be looked at, and this is what we came up with. Yes, you may, and I think one of the testifiers said that it may appear that we will be getting nurses, but also in the interim, the retaining of our nurses who are going to be part of the compact now might be difficult because of the salaries that they may be offered away from the territory. So this must be looked at carefully. Not that we are just getting nurses, but we may be losing our local nurses who are very important to the community and our culture in the Virgin Islands.
Thank you for your response. So when we bring testimonies like this, then we should say, basically why we're coming to that conclusion. So if we're saying that one of the challenges is the salaries of our local nurses in the Virgin Islands, then we probably need to begin to have a competitive conversation because healthcare here in the territory is in fact a challenge. So if it requires us to become competitive, then that's what the advice that you should be giving us, and not necessarily less retention, but more so let's get to a competitive place. And then you spoke about the possible loss of revenue. So help me to understand that as well.
Okay, with that, we had, with the loss with revenues, we have a total of approximately about 1,000 nurses, and we had a fiscal impact done last year by NCSBN, in which even though we are going to gain on one hand, we may lose on the other. Currently, we have 92 Virgin Islands nurses with, who have licenses with national compact states, which means those nurses will be able to get a compact license if they do desire. So therefore, our fees will increase, yes, for those nurses, but then we also have the local single state nurses who will possibly stay with their own, with the license from the Virgin Islands. So we have a total of over 200 nurses that have a license in another state where they reside. So those 206 will not possibly be asking for a license in the Virgin Islands.
Okay, I understand. So,
okay.
So you're basically saying that it's a possible loss of fees that will be paid to the board. On average, how much annually do you collect? And how often is the licensure required, or the re-up of your license?
Okay, annually we collect approximately, last year, our collection annually was, I just have to look for that.
Okay.
But it caps in about 100,000 plus a year, and that's on the year when it's the
Okay, so it's
renewal
100K.
for the
You have to
RN.
remember that you're on my
We have
time,
also
so it's 100K on or about. So thank you for that information. But I don't think that we need to primarily concern ourselves with the possible loss of revenues. I think all of us will agree that we do have a healthcare challenge in the Virgin Islands, so we have a responsibility to do whatever we can to ensure that we ramp up the healthcare services here in the territory. And you talked about the removal of local state involvement with nurses coming to the territory, but wouldn't they still be required to submit some sort of an application to the board once they decide to come, they're interested in coming to the territory? Would they still be required to do some sort of a background check? Isn't there some level of contact that would be required from your between yourself, your entity, and the nurses coming into the territory?
No, with the nurse licensure compact, the nurses will not be coming through the local board.
So what board would they be coming through?
I will let Rebecca, could you explain that further?
Sure. Yeah, so the way the compact functions is that the nurse is vetted and meets those licensure requirements in whichever state she's applying for that license. And then the nurse can use that license to practice in any of the compact jurisdictions without needing to necessarily contact the Board of Nursing. And that's part of the reason the compact is so efficient at bringing in nurses to address nursing shortages, is because there is no process that the nurse has to stop and go through before she can practice. She can practice immediately.
So I think that is a concern that we probably need to figure out how we could work around it. But I think it's very important for us, particularly because of our geographic location, it is important for us to know, to have some idea as to how many nurses we have on the ground in the Virgin Islands, and whether or not we are in fact supported in earnest. So I don't know what other states are doing, but I believe that it is important for us to be able to collect that data so we could have some perspective as what we should be doing, because this is a ripple down effect. What we should be doing in our educational system, at our university level, etc. So I think that's something that perhaps we should look at. I don't know that you know, the legislation have to be straightforward to match every single state as it relates to, there must be some level of checking in, because we need to know, you know, what we have here from what we don't have here, so we could determine what our needs are. Now, let me ask, do we have, and I'm not sure, is the Commissioner of Health is on the line, right? Commissioner, do we have individuals in the St. Thomas St. John district in particular who have acquired their BSNs who are challenged with passing the, what do you call it, the NCLEX test? Commissioner, we can't hear
Commissioner,
you.
you're on mute.
We're not hearing you.
My apologies, Senator. Yes, we actually have had several nurses, individuals who have actually passed their BSN course, but not able to pass their NCLEX. And those are usually those who actually attend schools that do not train towards the NCLEX.
Okay, so I'm speaking specific. I know that there's a challenge in the St. Croix district, but I'm trying to figure out if you have data or information around the St. Thomas St. John district in particular.
I would have to look to see exactly how many nurses, but like I said, it doesn't matter which district, is really and truly those actually attending those schools that do not lean towards the NCLEX exam. For example, those schools in Puerto Rico, not to put them on the spot, but they do not teach towards NCLEX, and they have their own licensure process in Puerto Rico. So those nurses are actually, when they try to take the NCLEX, there's usually a challenge with them.
Okay, so I mean, because of the challenges that we have in the healthcare system, and I know that I spoke to the Good Education Senator, you know, I think that we are at a place here in the territory where we need to provide the necessary supports to address those types of situations. I don't really have any other questions. I think this is a good bill, and we have to figure out a way to, of course, I'm not a member of this committee, but I will vote at the appropriate time. But I think it's important that we figure out how to, you know, get ourselves to the next level in the medical field here in the Virgin Islands. So I want to commend the sponsor. Mr. Chair, thank you for the time.
Thank you very much, Senator Fred Gregory.
Mr. Chair, may I say something, Mr. Chair?
You may, Commissioner.
Thank you so much. I think one of the things, and ICO Williams touched on it as well, is looking at the retention portion of what we're doing here. We have the capability of really creating a robust retention program based on what this bill is actually allowing us to. And on the other hand, the commissioners, quote unquote, the ones who are actually going to be assigned to the commission, are also going to look at the bylaws of how the commission actually operates. They actually have input in how those nurses are actually going to be credentialed or vetted in that process. So I think that the entire bill, when you go down to the lower levels of the conversation within the bill, it actually outlines specifically what those bylaws and how those bylaws can actually support what we need in the VI.
Point of inquiry.
Thank you. Thank you very much.
Point of inquiry.
Before we go to the point of inquiry, Commissioner, I just want to say that we also have UVI students. I know that you mentioned individuals from Puerto Rico and elsewhere, but we also have UVI students that have been able to complete the BSN program, however, have not been able to pass NCLEX, and obviously have not been able to receive their RN certification because, in fact, the ATI examination requires a passing score of 90. Which is really outside of what's required in any other state for the passing score. And yes, at UVI, we can gloat and say that we have 100% of those individuals that passed, became RN, that were able to pass NCLEX. But the reality is that there's a lot of unnecessary pressure that's put on our students, to be able to, to arrive and amount to that passing score, versus other areas where the ATI is not as extreme in terms of a 90% pass rate. At this time, I want to first recognize the presence of Senator Carla Joseph, and then we'll go to Senator Heiliger for her point of inquiry. And then I'll come to you, Senator Villa. The question? Yeah, Commissioner, before we go to Senator Heiliger, are you aware of the ATI pass rate of well, at least that you're required to have a 90% in order to pass the ATI before you can receive your RN certification at the University of the Virgin Islands?
No, honestly, I know that we have a very high pass rate. The 90% sounds accurate in reference to how many people are not able to pass, because UVI usually has a very high pass rate.
I'm sorry, can you repeat
So
that? We had a reverb.
UVI historically has a very high NCLEX pass rate. So I would actually have to look into that. So, I mean, that's one of the stakeholders I think needs to be involved in the conversation as well, because really and truly they push. And UVI, I have to tell you, is one of the tougher nursing schools that you can attend. And the outcome is a product of UVI, so is DIMA. And so we really do good work. And so I really want to, I would have to look into a little bit more. I'll speak with Dr. Hall and also the chair of the nursing at UVI and see exactly where the conversation is. And I can actually maybe give you some feedback after that.
Very well, I'll appreciate that.
Senator?
Yes?
Senator?
Yes, ma'am, who's this?
Hello. This is Executive Director Vanderpool Romney.
You recognize.
For clarification as to where the score at UVI, it's 92% for 2020. We actually just had a meeting with UVI. Their passing rate for 2020 was 92%.
Yeah, 90% for that's for NCLEX, but we're asking what's the pass score that's required for the ATI. That's what we're trying to get to the bottom of. Which is the test before NCLEX.
Please.
Which is a test before the NCLEX testing that's required for you to become board certified. All right. Senator Heiliger, you're recognized for your 5 minutes. Oh, for your point of inquiry at this time.
Thank you. My point of inquiry, Senator Francis Heiliger. My point of inquiry that I would like to ask through the chair has to do with the background checks that was mentioned earlier. From listening to what is being represented, that there basically will be no connection if nurses do come through this program. I need to know who exactly locally will be responsible for doing the background checks.
Can we get someone to answer that? I think that the best person to be able to navigate that or answer that might be Ms. Deborah Richardson-Peter. I know that we passed legislation recently, and there's two things at discussion here. Certainly, we have the local background check that's done by the NCIC, and that will be done by the Police Department or Department of Justice. But we also have the situation where, because these individuals will not be residing necessarily in the Virgin Islands, or we coming from abroad, that there may be some requirement for an extensive background check, will then require some federal background check to be done by the FBI. Ms. Richardson-Peter, can you bring some clarity to that?
Yes, good day. Deborah Richardson-Peter, Director for Professional Licensure and Health Planning at the Department of Health. We actually got a background check passed. It was actually mandated that all professional licensees must have a FBI fingerprinted background check. However, there is a line that was, I guess it was included in the passage where it's stating that the background check has to be issued to the VIPD. The whole purpose of going through the process was so that the Department of Health would be issued an agency identifier number by the FBI. Once that agency identifier number, also known as an ORI, is issued, any background check should come to the Department of Health and not to VIPD. So we're trying to figure out if that's going to hamper us moving forward to meet the last criteria of the FBI process.
Very well. So please let us know if we need to amend that particular legislation to allow for the Department of Health to be able to navigate that so that we can make the necessary edits or amendment to the legislation.
Senator, may I ask a question, please?
That provide some clarity to you Senator Heiliger, Francis Heiliger.
Yes, thank you very much.
You're welcome. Senator Viola, you recognize for your point of inquiry.
Thank you. Thank you, Senator Francis. I'm listening to all the information. I got so much stuff I want to ask, and I forgot originally what I was going to ask. Ms. Attorney Fosh, can you explain subsection 113 that speaks to criminal history and the process with the FBI? Subsection 113, general provisions and jurisdiction.
You'd like me to speak to the FBI criminal background check?
Yes, specifically B, a state must implement procedures for considering the criminal history record of applicants for initial multi-state license or licensure by endorsement. Such procedures must include the submission of fingerprints or other biometric-based information by applicants for the purpose of obtaining an applicant's criminal history record information from the Federal Bureau of Investigation. Can you explain that?
Yes. So the vast majority of states require a federal criminal background check in order to be issued a nursing license, but not all of them. So the compact does require that if a nurse is, in order for a nurse to have a compact license, that nurse would need to undergo a federal criminal background check. And as a part of the application process, that federal background check would be reviewed and then, vetted to see whether or not that nurse could have a compact license. So a local background check is not good enough. A state background check is not good enough. It has to be a federal criminal background check. It sounds like there has been legislation to address that, but that would need to be in place before any multi-state licenses could be issued.
Okay, we presently have that requirement in the Virgin Islands. Does any of the states have a registry in reference to being able to account for who have the multi-state compact so that we can know exactly who is there, a specific section in reference to establishing a registry for those individuals so we can know who's practicing?
No other state has that. One state, Louisiana, has decided to require employers to report if compact nurses are working for them. So the employers report that to the Board of Nursing. They are the only state, though. The compact doesn't allow for a registry because that would be impeding the nurse from practicing. So if the requirement is on the employers to report that information, that is okay. It's just that the nurses are not. The nurses can't have any sort of kind of stop at a border before they're able to practice with a compact license.
Okay, so go to recommendation. Thank you so much.
Mm-hmm.
Very well. Thank you very much, Senator Viola, for your question there. Next, we'll recognize Senator Carrion. You're recognized for your 5 minutes at this time.
Good afternoon to my colleagues, and this is a very important discussion. I want to commend the bill sponsor for this. I know we all acknowledge that we clearly in the territory have a nurse shortage, and we definitely have to look into ways to be able to improve and add to the staff, the health professional staff within the territory. While we want to keep our nurses here, I am in full support of anything that will make their local license more portable and afford them more opportunities outside of the territory. And I think this also is two ways. It allows for nurses that are part of the compact to come into the territory and be able to practice and provide their services here, but also provides an opportunity to our nurses to be able also to move and go to other territories and also be of service there. Now, VIBNL, I think is Ms. Vanderpool Romney. She's on. You noted that there, in your testimony, you spoke about the concern about retention, less retention of local nurses. You also spoke about loss of revenue and removal of local involvement. Can you elaborate a little bit in that area? What are your concerns?
Okay, Senator, could you repeat, please, because I had some technical difficulties with the mic. I did not hear your question. I know you wanted me to answer.
Yeah, in your testimony, you spoke about your concerns about less retention of local nurses, the loss of government revenue, and also removal of local involvement. Can you just elaborate a bit more or provide us some example what you're referring to?
Okay, with the possible retention of nurses, now you're offering our local nurses the opportunity to freely move to and fro, which means, and also our salaries need to be competitive. And that Senator Fred Gregory mentioned, and also we looked at the amount of revenues that we can possibly gain, possibly lost. It may not add up. We will always be at a small loss. And the other thing with us not being part of the involvement, the board looked at nurses just being able to come in and work without going through the board straight from any state to the other state to work from here. And we wouldn't have no way of tracking it.
Okay, I hear you, but also I'm thinking about we can't afford to limit the opportunities to our local nurses out of fear of losing them. So then your recommendations are then to make the salary and benefits available for our local nurses more competitive.
Correct. And I want to, for the record, it's not that the board is against compact, it's just that the board has a fiduciary responsibility, and we want to make sure that, you know, we meet the needs of, the biggest thing is the patient safety.
That's correct.
And how we get there is important. And the board needs to meet as a group, which we did not have that opportunity to do.
But I understand the board now is reconsidering. Have you guys, well, there was a meeting, I think it was in 2020. What was the results of that deliberation?
Well, actually, the meeting that was held in 2020, and that's why I referred to the then board, was with members who are no longer part of the board today. Most of the members that were, or the members that are here now are new members, which they came on in December. So there's a lot of catching up for them to do and understanding of certain things. So this is what they're just asking for time for.
I hear you, and I hear you asking for more time, which I believe is important to, you know, do a due diligence and informing yourself and research and being clear and what you want. So I can respect that, but also we see that many states have moved forward. And 35 states were mentioned, and we can't be behind a ball game here in the territory. And we seem always to be the last to roll out anything that is happening nationally, and we can't continue to be behind the ball game. So I think at appropriate time, I will stand and support this measure. Thank you very much.
Thank you, Senator Carrion. I have a point of inquiry by Senator Villalba before we go there. I know Ms. Charlene Jones wanted to put something on the record. So, Ms. Jones?
Good afternoon, Charlene Jones, past President Visner. Good afternoon, Senator, and the entire committee.
Can you turn on your camera, please?
Okay, just a minute. Okay, I'm down at the bottom there. My question is, this bill also addresses LPNs. I don't see any LPNs present here or hear that their association has been addressed. And my concern is that there, especially I know within the LPN community, there is a big difference in the Nurse Practice Act. And if the nurses are not going to have to go through the board here, how are they supposed to know what the Nurse Practice Acts are in all the different states in which they practice? Who is responsible for them knowing what the Nurse Practice Acts? Because not everything is allowed in every state. So my concern is, how are they going to know what the ramifications are in each state in which they work? And also, what about the LPNs?
Okay, thank you for that. I'll go to the bill sponsor because he had a point of inquiry, and then I guess we'll refer the question to the proper individual. Senator Veely, recognize your point of inquiry.
Thank you, Mr. Chair. Before I go to the point of inquiry, I would think that most of those acts, those nurse acts, are pretty similar. Should have the same basic tenets across all states. I don't think that it should be so different. Perhaps Attorney Fosh could answer that for us, but I wanted to ask Wang Louis and Snyder. And I do know Wang Louis starting salary. What's the starting salary for a nurse at Wang Louis and the starting salary for a nurse at Snyder? I know that in the testimony it said the median is $73,000. And median mean those that are starting and those that also have years of service. So what is the starting salary in both territory, in both islands, on both islands?
Go ahead. Good afternoon, Senator Veely. This is ICL Williams for St. Croix for JFL. That starting salary is approximately $63,000.
St. Thomas? Dr. Amaro is off?
Yeah, he had to leave.
Okay, I think he had to leave. But if you look at the starting salary for St. Croix, the starting salary is $10,000 off and the median wasn't the starting salaries across the nation. The median was the median salary for nurses across the nation. So if you do the median salary at Wang Louis or at Snyder, it's going to be above $63,000 because 63 is the base. So I just wanted to put on the record that there's a lot of individuals in the Virgin Islands that do not realize that Wang Louis starting salary is $63,000. It's competitive. Thank you so much.
Thank you, Attorney Fox. Can you respond to Ms. Charlene Jones' inquiry?
Yes, the senator is correct in that while there is some variation between nurse practice acts, there's not large variations, and that's part of the reason that the compact has been able to operate so well over the last 20 years. Charlene asked who is responsible, and the answer is that the nurse is ultimately responsible to know what she can and cannot do in a certain jurisdiction. Typically, this is working with her employer, and because what nurses do typically differs from employer to employer. But just as in now, when a nurse would have multiple licenses, she doesn't necessarily have to, take a test that says that she read the Nurse Practice Act. It's the same with the compact. So the ultimate responsibility is on the nurse, but after 20 years of existence, it has not been an issue.
Thank you so much for that clarification. Senator Francis Heiliger, you're recognized for your 5 minutes.
Thank you so much. Good afternoon to my colleagues and testifiers and the people of the territory once again. Just for clarity, when it comes to the NLC, if a nurse is participating in this program, which was shared over about 2 million, as from what I understood, and this is potentially going to be opened up here in the territory for people to participate and have nurses come in, I want to find out about licensing fees. How does that aspect work? Because, for example, if a nurse pays for a license in Michigan and you have 200 people from Michigan come here to the territory, What is the responsibility for making funds out of this territory by working here in regards to having some kind of payment or fees to the territory to be working here in the Virgin Islands?
This is Mrs. Vanderpool Romney at the board. If the nurse is licensed through Compact in her home state, we do not collect for that.
So locally, you guys would collect that?
No, Senator. Only if she applies within the Virgin Islands. If it's a state outside, we do not collect funds for that nurse.
Okay, so this is where my concern, I'm trying to understand. So there's a potential for, say, 500 nurses to be working here in this territory, and no monies would be paid in regards to to no one in regards to paying for a license to actually work here. So wherever that person comes from is the state that will get that licensure money, but they're actually physically working here in the territory. That's what I'm trying to get clarity on.
Yes, Senator, you are correct.
Does anyone see that this could be of concern? Or is this okay with everyone here?
Senator, this is Commissioner Encarnacion, if I may respond to that. I think that there's some other benefits that we need to look at. And, as Senator Fred Gregory indicated, we actually have to figure out how we're going to support the VA Board of Nursing licensure. But the benefits of actually having adequate nursing staff throughout the territory, I think outweighs the fact that the VA Board of Nursing licensure.
Commissioner, I am in full support of the benefits. I love the idea that not only our nurses here, or even those from outside, could potentially be able to move back and forth and provide a much needed critical service. I'm in support of the bill, but there's also various aspects that I'm potentially concerned about that still need to be clarified for me. Because I would find it interesting that we're saying that in order for people to be working here in this territory, there has to be some sort of documentation. And all I'm hearing is we have to work out who's going to be doing the background checks. There will be no connection with the board whatsoever, because wherever they are underneath this NLC is what's going to govern what they're doing in our territory. And that's a major concern for me. So I'm trying to, even if they paid $50 to have a license, that would give us some way to document who these individuals are in our territory. It doesn't matter. We don't have a registry to know who they are, because they mentioned before that only the state of Louisiana requires that they have some kind of registry for the nurses of this type. So I don't want to create an open-ended situation where we might have an influx of nurses, which I do welcome, without really knowing who is here in our territory and who's documenting what. That is a major concern for me. And to know that it could potentially, I understand the revenue part, but just having all these people working and nothing documented concerns me. Miss Romney, I think it's Romney Vanterpool. I want to make sure I say it correctly. Vanterpool Romney. I want to ask you a question. Earlier, you had talked about when we touched a little bit about the loss of funding. And because I also see this as a plus, minus some of the disadvantages you mentioned, what are some of the things, since your organization does not have an official stance at the moment, what are some of the positives that you see can come about from a fiscal standpoint and a practical standpoint if this bill were to go through?
One of the positive things that could come out of this is the fact that, yes, we will have the possibility of bringing or recruitment of nurses into the territory. Where income or generating of revenues into the community, that will it will be an ongoing process, and these are some of the reasons why we are saying that we just want some time to, iron out these issues. We are not fighting against the bill at all, but there are some other issues that needs to be reconsidered, especially with us being the board. And we have been, I think there's a little bit of exclusion from, with the VISNA and with the board in these legislations that are being put forward that is going to affect the nursing community. So
I totally
be
understand.
certain that we are,
Mr. Chair, may I just ask my final question?
May proceed.
Thank you. I wanted to ask, in the testimony, and this has to do the State Advocacy and Legislative National Council of State Boards of Nursing. In testimony was mentioned about the other 34 states that are participating, and there, I believe they said 13 states have pending legislation. Could you tell me, or do you know a little bit more as to the status of the pending legislation? Are you aware as to where they are and why it has not been implemented thus far as yet?
Yes. So, I mean, it's hard for me to tell whether the bills right now, will pass or not. There are some really good movement in a handful of states like Pennsylvania and Ohio and Alaska and Vermont that we're, very positive about. Some of the states where we are not seeing movement are typically the states on the West Coast, California, Oregon, Washington. They all have filed bills because there is a lot of support. But the opposition there is coming from the nursing unions because there is, they have outlined some concerns, one of which is strike breaking that has come up. So typically the states where the NLC is not successful are in states with very strong nursing unions.
So you're in support, for example, of our board having an opportunity to really get a chance to dig through and share their concerns as well.
Oh, of course. Yeah, absolutely. And NCSBN has been working with Ms. Vanderpool Romney to answer any questions that we can, so far, and we would continue to do that.
Thank you so much. Thank you, Mr. Chair, for your indulgence.
Thank you, Senator Francis Halliger. Point of information, Senator VLA.
Thank you so much, Mr. Chair. I just wanted to put on the record that we have had traveling nurses in this Virgin Islands for a long period of time. We're able to phase them out on St. Croix. We still had them at St. Thomas. We were trying to phase them out. We have had the need to import specialty nurses in certain areas, whether it's ICU or surgical or different areas. This is just going to make the process easier in terms of getting specialty nurses in particular areas for a period of time. There might be a void in terms of the collection of fees by the licensure board, but the nurse licensure board is funded by this institution. So if we know that there's going to be X amount of impact and they need X amount of money to continue to function, we're the one that's going to provide it. But the intent of this bill is just to provide more nurses that can provide quality health care. I am looking at the component in this bill where the nurse can switch to home state. And I know when a lot of these nurses come to this beautiful Virgin Islands with this beautiful climate and everything else, they will elect to stay here. And this would eventually become the home state. But we have to be creative in healthcare, because healthcare is the one area where there's no looking back. When a mistake is made, you go to Kings Hill, or you go to Western Cemetery in St. Thomas. And when you have a loved one that is sick, you're very happy when you have a nurse by their side. And I want to make sure that we have nurse by the people at the Virgin Islands side. Thank you so much, Mr. Chair.
Thank you very much, Senator VLA. Next, we'll recognize Senator Gittens for his 5 minutes. Senator Gittens, you recognize.
Thank you, Mr. Chair, and good afternoon to all. I am in full support of this measure and have had several discussions with the chief author of the bill, and I call him the chief author because I too have signed on as a primary sponsor, but he's the chief author of the bill. And he did mumble something like that when he was introducing the bill towards the end. He couldn't even say clear, but I excuse the good senator. You know, this measure actually fosters greater access to these healthcare professionals that we're looking for and provides greater nursing mobility for us. Colleagues and ladies and gentlemen, one of the things that we have to realize here in the territory is that we only have a government-run hospital here in the territory. We're not like some of the states who have all these private hospitals in the area and maybe a government-run hospital. But part of our problem here is that we only have this one government hospital. So we have to be creative, like what was just said. And in this matter, or in this measure, it seeks to assist us with that shortage. This bill simply seeks to allow nurses to have one license to practice in multiple states. However, you know, I was taken aback too that the VA Board of Nurse Licensure didn't have a position here this morning. We got to take positions. And this measure wasn't discussed with the VA Nurse Licensure Board yesterday or last week. And I'm sure everybody on the board is not new. How many people do we have on the board? The VA Nurse Licensure rep.
Currently, we have 4 new members.
No.
One.
Do me a favor. Do me a favor, please. I just want to know how much members you have on board. Don't tell me new members, old members. How many you have on board?
We have 6 members.
6.
No, 7, sorry.
7, okay. And is that the full complement of the board?
No, it's not, Senator.
How many? What's the full complement?
We are requiring 9 members.
9 members, okay. So we're short of 3. What basically does a nurse pay for seeking a VA nurse license? What are they paying for?
What are they paying for with a nurse license?
Yeah. Do you have a breakdown of what they pay for? How much it costs first? Tell me what's the cost per
The
licensure.
cost for the nurse license is $125 for registered nurses, $150 for the advanced practice nurses, $75 for the certified nursing assistants. And LPN is $100.
So let's go with the RN. What are they paying for that $125?
The processing of their application as
So it's just an application fee.
the application fee is $125.
So, okay, because I'm looking at, and the finance chair was correct, this body provides you with funding, and you're concerned about funding. But even if you were to get someone from out of state that will be part of this compact once this measure is passed, I was wondering, that's why I asked, what are they paying for in the 125? If you could tell me, part was for the application fee, part was for a background check, the other part was for you to conduct something else, then I could see you saying that, okay, anyone coming in under this compact legislation,
Time.
may I conclude, Mr. Chair? Under this compact legislation, then the cost might drop, but not go away. So if there was a breakdown, rather than paying $125 if I was a RN, I might just have to pay $50. But again, I'll continue to listen to the discussions, and I truly hoped that you all would have had a position on this, as it directly falls under your purview. And you have a responsibility to coordinate with the other licensure areas where you will be able to share information. And I believe that there's a particular section within this bill that speaks to that as well. I'm going to wrap up here. Let me just ask you, are you in communication with other nurse licensure boards?
We are always in coordination with the other boards, etc. What we are saying, no one spoke with the board, the Virgin Islands Board of Nurse Licensure, about this bill prior, and the new members are not quite familiar, and that's why they ask for more time
Thank you.
before making a decision. And anyway,
Thank you for
so
your
that's where we're at.
thank you for your response, and thank you, Mr. Chair.
Thank you very much, Senator Gittins. Going back to Executive Director.
Excuse me, Senator Francis.
One second. Again, going back to Senator Vanterpool Romney, in regards to this measure, is there a recommendation? How you feel that the board could have some oversight in terms of the reciprocal licensure? Because obviously in other boards and other empowerment agencies where there's reciprocal recognition, in fact, there is some allowance for those individuals then to be able to either sanction, support, register, whatever that term may be, so that you could be aware, even if it's oversight, where you could be aware of what's transpiring within those respective, in this respective board. Any recommendation in that area? Ms. Romney?
Okay. Okay, sorry, Senator. Could you repeat that, please? Thank you.
The question is, obviously, you have some concern about these individuals being given reciprocal recognition without the board being aware or the commission being aware of them. I'm asking whether or not do you believe that there's some language that could be included to allow you to be able to have oversight or some registry so you could be aware of who is being considered, who have been approved, and there would be some record keeping of that, that licensure or that recognition of reciprocity.
Okay, yes, what it is, the only thing the legislation can be put forth, so the entities that employ compact nurses will have to give a report either quarterly or I would say quarterly to the board to let us know who's in the state practicing. The board is very much aware that we cannot alter or change anything in the compact legislation. So therefore, we have to abide with what is written in the compact legislation.
Very well, thank you. Senator Gittins, you recognized for a point of information.
Thank you, Mr. Chair. At the same, a lot of people are viewing and listening to this hearing, and I neglected to state during my time that the current CMAs and techs that's working at the hospitals now will not be adversely affected by this legislation. This legislation, again, only seeks to give us greater access to these healthcare nurses. So thank you, Mr. Chair.
Thank you very much, Senator Gittens. At this time, the chair will recognize Senator Blyden. You're recognized for your 5 minutes.
Excuse me, please, Senator Francis, before Senator Blyden speaks.
Yes,
This is
Ms. Rivera.
Rivera, the president of VISNA.
Yes, Ms. Rivera.
We have our representative from the American Nurses Association. She would like to make some comments. If you could allow her the time, please, because she has to leave. Thank you very much.
Very well. Who is this? Who's that person?
Janet Havler from the American Nurses Association.
Very well.
Thank you.
You're recognized.
Thank you so much. I appreciate this. And again, I'm very respectful of jurisdictional rights, and I'm not here to establish a position, but I wanted to kind of respond to, I had testimony prepared just in case, but I wanted to be able to respond to some of the comments that were made, and certainly I think some of the issues that have been brought up are things that are of concern to the American Nurses Association and expressed by other states. And I'll start with, again, the Board of Nursing in particular. The lost revenue impacts in that when nurses come into the state, they paid licensure fees to the home state. And now the Board of Nursing, when a complaint is registered or there's a concern, they do the investigation, which can be costly. And so they don't get a percentage. They don't get anything in order to enable them to do that. There is a fee that's charged by the commission for every compact, a state or territory, and it's $6,000, which doesn't sound like a lot, but it could be if there's lost revenue. And I think you've already addressed the fact that there could be additional staff needs and technology required in order to, again, operate safely and monitor through nurses, any complaints that have been registered in other states. And so that cost certainly can be offset by either the legislature in the Virgin Islands or grants awarded by the Nurse Licensure Commission. I think nurse education is a huge concern as well. I think that, again, it was brought up who's responsible for the knowing the Nurse Practice Act when you're going into a state, and it is the nurse. And you're right, there's not a lot of distinction between Nurse Practice Acts for RNs, but where there is a distinction, a significant distinction, is on Board of Nursing interpretations of boundaries. And so that's where nurses can get into trouble. And employers may or may not limit. They don't always know what the Board of Nursing has said. They're going to stretch as far as they can with what they want an employee to be able to do. So it places a nurse a little bit in jeopardy, and I'm speaking from a nurse perspective at this point. I am a registered nurse, even though my role at the ANA, the American Nurses Association, is policy and government affairs. I think that the other thing that came up was workforce. I think it's great to have people coming into your state. The Board of Nursing or territory, the Board of Nursing does not know who is practicing currently. They know who is licensed in their respective jurisdiction, but they don't know who's practicing. I'm licensed in 2 states. One of them is a compact state. I'm practicing in a different state. So there you go. They don't know what I'm doing here. But that said, I think for workforce projections and better planning, there should be a registry. I strongly advise that there's be some amendment done in order for you to look at things differently. And I think the assumption made that this is going to solve the workforce shortage, we have no data to suggest it's done that in any other shortage area in the entire country. Very few nurses, even though there may be, I forget how many, I think it was 200,000 nurses that have a compact license. I'm one of them. It does not necessarily mean that someone is using that license to cross borders. And again, there's no data out there, and I don't know if Rebecca can address this. I've heard anecdotally between 10 and 12% of nurses are actually crossing borders, and they're probably most likely travel nurses, and there may be some nurses working for insurance carriers that are crossing borders. So I think that, again, don't make that assumption that this is the panacea. I'm not suggesting don't support it. I'm just saying don't make the assumption. And I think the other thing that I would mention is sovereignty. Keep in mind that, yes, the commission is comprised of executive board leadership from across the country. However, that leadership can make decisions about the compact that affects every state and territory by a majority vote. And so it may not be enamored with what happens or what comes out of it. So I think you do lose a little bit of your sovereignty. And again, if you don't care, that's quite fine too. The criminal background checks, going back to just cost. So not only, I forgot this part when I was talking about the fiscal impact, not only is there payment of $6,000 to the commission, but there's also criminal background checks. And are you going to add that to the fees of the nurses' licensure fees? And if so, I would strongly suggest that you have 2 levels of fees. In other words, a nurse who decides that they want a single license, they're not planning to use the multi-state license, that they just can, again, sign up for the single license and pay a respective fee. And then one who wants the ability to travel and go off out of the territory, then they should pay the multi-state license. So those are just some initial thoughts. Again, and I really appreciate, there's differences between states, significant difference. Continuing education requirements are quite different. The uniform licensure requirements are all the same in order to join the compact, but there's a lot of variation beyond that, and I just wanted to point that out. So thank you very much. I appreciate you letting me speak.
Thank you very much, Ms. Hebler. Before you go, there's a question from Senator Blyden, and we're starting his 5-minute round anyway, so he'll be able to question you and query you in regards to that. Senator Blyden, you're recognized for your 5 minutes.
Thank you so much, Mr. Chair, and good afternoon, Ms. Hebler, and thank you for those suggestions and recommendations. Can you expound on the boundaries part? You said when it comes to the nurses, established what do you mean by boundaries? In which way? Can you give an example?
Oh, so practice boundaries. So there's different interpretations on what a nurse may be able to do. I'll give you conscious sedation as one of the examples where some of the boards of nursing have actually said, you have to be a certified registered nurse anesthetist in order to administer conscious sedation. And others have said, as long as you've been trained and deemed competent and the patient is on a mechanical ventilator, then you're able to do that. So I think those variations are things that are not always readily available to the nurses when they cross the border. They don't know. And sadly, no nurses do this. Even travel nurses don't even think about it. They do whatever the employer tells them to do, which is kind of frightening. And it's fine until something happens.
Okay, thank you for that. And
does that make sense?
Yes, it does. And also you spoke to the background checks and in terms of the fees and how they will be paid. Are you suggesting we put that in the legislation?
I think that's up to you. I think, again, there's a cost associated with, obviously, with criminal background checks, and probably why for so long many states did not require robust criminal background checks. And remember, again, all of these are done on initial licensure, or if somebody's getting a multi-state license initially, it's not repeated. So there's only a certain number of guarantees. That's why you have to trust the system that's in place called nurses, which is where the boards of nursing can enter data. And that's why the additional resources are necessary for the boards of nursing to be able to put data in when there's somebody that has been, the complaint has been filed. So I think it's kind of up to you what you think works best for you all. But I do know that most states that expense is transferred now to the nurse in some shape, manner, or form. It's got to be paid for somehow. Excuse me.
Okay, thank you. And. Basically, I am in support of this legislation. I will sign on also because it provides access to nurses, some pool of 2 million nurses, and I believe it will assist us in the territory when it comes to services for people, and that's critical and that's more important than anything else in my opinion. Many of the concerns and many of my concerns have been addressed by my colleagues, and I look forward to supporting this measure when it's time to vote on this piece of legislation. Thank you so much, Mr. Chair, for the time.
Thank you very much, Senator Blyden. Senator Gittins, you recognize your point of inquiry.
Thank you, Mr. Chair. I'm sorry if I pronounce your name wrong. Is it Ms. Hebler?
Hebler.
Thank you. You made a good point there when you made mention of the board's knowledge of who is licensed, but not necessarily who is actually practicing, which leads me to ask the VA Board of Nurse Licensure if they're part of a national organization, one, and two, who pays for a nurse's criminal record check?
we are part of the National Council of, have membership with the National Council of State Board of Nurse Licensure. And currently the Virgin Islands Board of Nurse Licensure do not do a criminal background check when the nurses come in. I think that Ms. Richardson Peter addressed that in her earlier.
Now that is a true concern to me. Aren't you required by law to conduct these criminal background checks?
Sir, it is Senator, it is written, and this has been something since I got on board just over a year ago, I have been asking questions in relations to it. I am knowledgeable as far as what Mrs. Richardson Peter said. Currently, the board does not do criminal background check. That's why we are very careful in the processing that we do and the information that we need from nurses from abroad.
I don't think that the board is being careful in this regard. I think the board is being reckless in this regard. That imagine that we could have people coming in here in the healthcare field, and we're saying that we're not conducting criminal record check as per law. We can't go around that. What's your board and what's your position on the board?
My position is the executive director on the board, and I have only been here a year. And I would say there's a lot of issues surrounding the functions and responsibility of the board, which has been my concern since coming into this position, that has never yet been addressed by most. We are the board. We need the resources. We need the ability to do what the board needs to do.
Okay, I'll end here, but I'm telling you, I'm truly concerned now on that response, and I'm imploring that the board follows the law to the extent, and seeking or getting individuals to do a criminal background record check with the police department isn't something hard to do. So I'm imploring on the board to fulfill this, please. And you as the executive director, of course, is going to fall squarely on you. Thank you, Mr. Chair.
Chair, could I address that situation?
Thank you very much, Senator Gittens. Yeah, you may please be brief. You may respond.
Okay, no problem. I do agree with Senator Gittens. We do check through nurses, which is the national database on the nurses. If there's any disciplines or any misdemeanor or criminal, we will see it through that method. However, locally, based on what we just heard, we do not have anything in place locally to check it. So it's not just the nursing board. This is an issue for the department as a whole to deal with. We do not have it. And secondly, I heard you said be brief with Senator Bailey. Yes, the Senate is responsible for us, but we have been trying to get staff on board for near 2 years. We have tried near a year and a half to get the online process going for the nurses. There's a lot of other issues that surrounds the board that needs to be addressed for it to function in the way it's supposed to be functioning. Thank you.
Thank you. Senator Viola, you recognize your point of information? I'll come to you.
Thank you so much, Mr. Chair. I almost called you Mr. President, Mr. Chair. This body have funded the Board of Nurse Licensure, and there have been requests for additional funding, and we have provided it. To include when there were issues with the building, we have provided it. If we provide funding for staff, that is the length at what we can do and accomplish. It is up to the Board of Nurse Licensure to hire the requisite staff. So in reference to staffing, does it make a difference whether you collect it in fees or whether this body supply you with the funding? The true difference is whether or not you're going to be able to advertise and get those positions filled. But this body is ready. I am sure all my colleagues are ready to do whatever possible to help you to make the process become online, to fund the requisite staffing, etc. And we'll need to take a deep dive into your budget to make a determination as to whether or not you have that funding in place. And I haven't pulled up the act, but Act 7890, and I'm going to pull it up now, speaks to background check by the chair will say the group, NCIC, for all medical boards, not the board of nurse licensure alone, for the board of medical examiners, every medical board, because of the fraud that occurred in the Virgin Islands with individuals who had criminal history working in the Virgin Islands. We passed legislation to stop that. So now it is up for those entities to implement. And if there's a need for funding to implement, then we need to know. But it's very dangerous to have nurses come into the Virgin Islands and we don't have that criminal background check. Then I'll suffice to say that, well, then this bill going to help because this bill mandating a federal background check. Thank you so much.
Correct. Senator Saru, you had a point of inquiry.
Can I respond?
One second.
Okay. Yes.
Senator Saru, you recognize for a point of inquiry.
Thank you. I just wanted to cite in the code is Title 27, Virgin Islands Code, subsection 221, Chapter 4B, that talks about mandatory criminal checks, and it lists all of the boards, and nurse licensure falls under that board. And Ms. Deborah Richardson Peter is also, she advocated to this body through numerous senators. She probably spoke to almost all of us on the need for passing that last legislation in the 33rd legislature. So I wanted, if the chair would allow Ms. Richardson Peter to confirm on the record that, she spoke about it? Okay, fine. So I think that the point by the Board of Nurse Licensure is moot, and they need to just do the job at this point.
Very well, thank you. At this time, I'd like to go ahead and proceed on to Senator Carla Joseph. You're recognized for your 5 minutes.
A pleasant good afternoon, colleagues, Mr. Chairman, members of our listening and viewing audience, the testifiers. This piece of legislation is really forward-thinking to meet a critical need in our healthcare industry here in the Virgin Islands, as well as to be able to hopefully exchange ideas and practices, best practices that have been done and implemented in the United States. I have a couple of questions I want to dive into immediately, and one of them surrounds the information system and exchange information. I looked at the legislation and I'm concerned whether we have what it takes here as far as the technology and the website, etc., to take advantage of this legislation at this time. It is a good legislation. However, my concern is whether it is going to be reasonably and practically implemented so we could meet the needs that we see coming forward or currently that is here and moving forward. So my question is to Ms. Vanterpool Romney. Tell us in detail what is your challenges, because I heard a senator inquired about online application. What are you seeing as your challenges where technology is concerned so that you could begin working on this information system, which looks like to me, based on my reading and my understanding, I could be incorrect, that it's almost as a registry also.
Good afternoon, Senator. Thank you for that question. Currently, we have been working since 2020 in formulating getting a contract through NCSBN with an online company. That contract is still going through our procurement offices in Department of Health. I cannot push anything forward. As they send me the information, I forward it to Department of Health. Currently, we are waiting since 2019 on staff. It has to go through the HR in Department of Health. As of today, I still do not have that staff on board. Currently,
Thank you so much.
Senator Bill.
Wait for me. Commissioner Encarnacion, because this is a very critical piece of legislation. You're hearing what Ms. Vanterpool Romney is testifying about. She sent information there in the Department of Health. What can we do to streamline it? Because it looks like she's doing her work, but she has a bottleneck that she's encountering in the Department of Health. What can you do in your leadership position to address this bottleneck and get this moving off the ground so it's now a reality for our people?
Okay, so it does seem as though she is doing her work from what her recount is. Just to let you know, in terms of the procurement process, we have to make sure that the indications of what she's placing into the scope of work for a policy, and I will follow up with my procurement office to see whether or not it's actually there or what we need to do with the contract that she's speaking of. That's one. In reference to the IT upgrades, that is something that we have to work with. If it's something that she needs, she has access to Director Hodge and our IT process within Department of Health. So that is no. I mean, she has access, so she can go ahead and access that anytime she needs to. In reference to staff, we actually exchanged a staff maybe a year ago. I got one of her staff members and she got one of mine, and actually subsequently today signed a letter coming from the governor, actually going to the governor, requesting an appointment of a staff member that she actually vetted and have approved. So that actually is going to the governor's office today, and that came from my HR. So that's the only thing that I can actually say. One of the other things that I would say is that I've been meeting with Ms. Romney and the rest of her board. I'd like, maybe one of the things that we can do is meet more regularly so that we can actually vet information and concerns in the board session rather than in a legislative hearing, because actually that would be something that I think would be more effective and efficient. So thank you for that question, Senator.
And thank you for your response, because it seems that, I'm sure she's doing some work there. She seems very committed, and she would like this, to go forward. Mr. Chairman, may I have the indulgence just to wrap up?
Yes,
Mr. Chairman?
yes, you may proceed.
Okay, thank you so much. And so that is one of the other issues. I just wanted to bring to the attention of everyone, because I did a real quick read of the legislation, and keeping in mind that there is a technical amendment going to be placed, but it mentions on page 7 under Article 3, talks about the general provisions, and we had some discussion relative to jurisdiction. So it says here, and I'm reading page 7, beginning page line 18, the practice of nursing in a party state under the multi-state licensure privilege subjects a nurse to the jurisdiction of the licensing board. That would be you, Ms. Vanterpool Romney. The courts, our courts, the laws of the party state in which the client, that would be the clients that the nurses are serving, is located at the time service is provided. So that, I think, is a key into looking at how we could get the finances, looking at how we could address issues relative to background checks and the like. But we have to try to get our ducks in order and implement instead of just, just talking about it. Let's move forward and get it done. Thank you so much, Mr. Chair, for the indulgence. I appreciate it.
Thank you very much, Senator Joseph. Senator Viale, you recognized for your 5 minutes at this time, bill sponsor. Before we go to Senator Viola, the bill sponsor, Senator Fred Gregory, recognized for your point of inquiry.
Thank you, Mr. Chair. Very quickly, I want to go back to the fact that the Department of Health does the procurement, that the board's procurement have to go through the Department of Health. It just seems to me like that's a conflict. So, Commissioner, just give me very quickly, what is the relationship between the Department of Health and the respective medical boards?
Senator, that goes back to legislature, and one of the legislative act years ago, so I would have to ask someone to look that up for me, and I can speak with my attorney. He's not on the line with us right now, but to say exactly when that was legislated, but it is actually an act that was put in place. So what it is that the funding was given to the Department of Health to secure the members of the board. And so fiduciary, basically we're the fiduciary agent for the board. So that is basically a legislative act. As if there any support that's needed, the Department of Health also provides that support.
So do you believe that it should remain that way? I mean, just based on the fact that this is a board and then you are serving as the fiduciary agent and then you're still serving as the procurement lead, the regulatory component. It just seems like we are kind of out of whack there. So do you believe that it should remain that way based on your experience and what you know since serving as the commissioner as it relates to the type of relationship that you have with all of the medical boards, but particularly in this instance?
Yeah. Well, it works very well with all the medical boards not actually having that fiduciary responsibility. So if it was supposed to be changed under law, I have no,
okay.
no, I wouldn't say that it's something that I would disagree with. As long as the board is functioning the way that the board should function,
right,
then there's also always going to be some connection. For example, with the Board of Medicine, Deborah Richardson Peters is actually a member of the Department of Health. However, she assists in overseeing many of the medical boards.
Okay, well, I think that that's something that we really need to explore because I see it as, and I'm certain that if we talk about it more, we would see the clear conflict between those relationships. Thank you, Mr. Chair.
Thank you very much, Senator Fred Gregory. I think a lot of that consolidation was done for the purpose of cost savings or maximizing the available manpower. But now that we're expanding and putting greater responsibility on the boards, I think it's important for us to go back and take a look at that and see, what's best in terms of industry standards in regard and respect to that. So that's something that we need to have a wider view on and be able to discuss at length. Senator Viola, you recognize for your 5 minutes.
Thank you so much. I want to go right there with the board. Attorney Fosh, what's normalcy on the mainland for Board of Nurse Licensure to fall under the Department of Health or to be autonomous?
Senator Vieira, who was that question to? I'm sorry, but
the attorney, Fosh, I have her pronunciation of her name right. The director for the National Council of States Boards of Nurses in?
Yes. Yes, I'm here. And I'm sorry, there was a lot of feedback when you asked the question. Do you mind asking it again?
Most state licensure board, nurse licensure boards, are they autonomous or do they fall under another government entity like Department of Health?
Yeah, it's both. I don't have the actual numbers, but I would say maybe a third of the boards of nursing fall under a Department of Health or some sort of an umbrella agency, and maybe 2/3 are independent. But that changes. There does seem to be more of a move to the umbrella board organization.
Okay, thank you so much. And what's your present staffing, Ms. Vanterpool? How many individuals you have working for the nursing board?
Currently 4 members, 3.5.
Okay, 0.5 is part-time. How many would you need to be autonomous?
I can work I would say 5. I'm looking for staff on St. Croix, so that will be 2 on St. Croix, and 5 on St. Thomas, and we can relook the duties and responsibility.
And presently, you have 0 on St. Croix?
Currently, I have 0 on St. Croix. I'm working on that with the past supplemental bill. That's something I asked for during last budget, and I just received it. And for clarification, sir, if I may,
Okay,
Senator.
The last budget, 1 minute, you didn't receive the monies you requested? We funded the monies that were requested in the last budget?
We funded the money up to now. Apparently there are, and I think I called your office. The board was given the monies up to now. I don't know if I have access to any of the money. Some of my stuff is, the board stuff is held up in property and procurement because the board is left out of the procurement of the approval of funding for the board. We
Okay, so
are
you're
not
saying
in the
that-
loop
you're
with
saying
any
that-
correspondence with
One minute, Ms. Vanterpool, Romney. You're saying that the monies that were appropriated for the fiscal 21 budget, you have not had have full access to those monies?
We do not, for the 2021, I am not certain because for the regular part of the budget, we have full access because I work very closely with the financial team in health. But for the supplemental, I don't know what's the status on that. I know we needed funding to pay our rent in this current building. I am not sure what's the status as of date. We cannot or do not know where the funding is or what is going on.
I have to
because
pull up
the
the
Board
budget.
of Nurse Licensure Chair nor myself is not included in the financial processing of our funding.
Okay, I
Some
have
of
to follow
it.
up the supplemental because I need to know what is covered in the supplemental that you're referring to. That supplemental is where? Under Department of Health? It was directly to you. Where is that supplemental?
The supplement is, and based on my understanding, and the commissioner is here, the monies for the board is placed in the Board of Nurse Licensure through Department of Health under a miscellaneous budget.
Yes.
But apparently the board, including the chair, is left out of certain process with the money. It goes through the Department of Health Finance team. They are the ones on it and not the board, the chair, nor myself.
Okay, so we will have a discussion as to how we can be able to make that process a lot smoother. But I wanted to say that, Commissioner, as I run out of time, but it is what it is. So, Commissioner, go ahead. 'Cause we need to get it.
When you finish.
Go ahead, Commissioner.
Okay, just to let you know that that supplemental was just approved recently, so it should she should have access. The executive director should have
You see
access
what I
to
mean?
those
Come on, man.
Okay, your mic, Ms. Vanterpool Romney, your mic was just on. Okay.
Yeah, it was just approved. This, I would actually, when she gets it, she'll actually see. It wasn't like last week or the week before, so it's just recently, honestly. And so I see and I hear her frustration.
Okay.
But okay. Thank you.
What we're trying to do is, a lot of decisions are made in order to consolidate and for this government not to have to spend additional funding. But we'll make a decision as to whether or not we need to tweak the process and what type of funding the board need in order to become fully efficient. And we're talking about online application, etc. So, Ms. Vanterpool and Commissioner, we're going to, I know the chair is really up on these health issues, so we're going to figure out the best path moving forward with the recommendation of both of you. I wanted to put on the record that, we're having a discussion here about this multi-state agreement when it comes to nurses. But of the $175 million that we pay for Cigna insurance, and it's somewhere up there, almost half of the money goes to the mainland. And when individuals fly from the Virgin Islands to the mainland that have the ability and opportunity to do such, they're going to stateside nurse and stateside doctors, and they're receiving the care there. And there's a segment that are able to afford that, but there's a segment that can't afford it. You know, so on one end, we'd be saying, well, you know, we want to protect this, we want to protect that. And a lot of people that want to protect this and protect that jumps on a plane and go to Cleveland Clinic and get professional services done by that doctor and that nurse. So, and members of this body jump on the plane. So why don't we create some flexibility where the ability for us to bring specialty nurses is going to be a lot easier without bureaucracy. Right now, we're paying PAFOD millions of dollars for nursing and EMS care in the Virgin Islands, millions of dollars. All this is going to do is cut one level of bureaucracy, one level of waiting. And I can't say I have an issue with the nursing board because whenever our office calls, they always assist us. But we'll be cutting that level of bureaucracy. And I need you to think of a nurse that is a part of the compact that lives in North Dakota, South Dakota, Wyoming, and want to go to a warmer temperature. And Google the Virgin Islands. We have no compact, got to fill out application, got to pay this fee. Google Florida, have to pay no fee. Where do you think they're going to go? They're going to go to Florida. We have to be competitive. Everything that they're doing to be competitive in this health, the field of health, the Virgin Islands need to be competitive. So we want them to come here. And I think that we're a lot more attractive than a lot of these states that are listed here, based on the quality of life in the Virgin Islands. Who will want to come here? Who? It's only we complaining about here or no? Everybody wants to come here. And if in the process we are able to attract some nurses, then I'm all for it. If the Board of Nurse Licensure is going to lose $60,000, we'll fund it. But right now, the most important component, which is making sure that every single healthcare professional in the Virgin Islands have a criminal history background check as per Act 7890 is not implemented. So this compact is the least of our worries. Our major worry is that we're bringing on individuals that are not adhering to the law. And this bill adheres to the law because it has a federal background check in it. We passed a bill in 2016. It was signed July 30th of 2016 because of fraud. A doctor was here in St. Croix that had a criminal history. Nurses that had criminal history. And we passed this law and made it applicable to all boards to stop individuals who are conducting fraudulent or engaged in fraudulent behavior on the mainland from moving here. And by God, the bill is not implemented. At some point, colleagues, we have to stop being scared of qualified individuals from outside. Can we continue this argument about keep it here, keep it here? I am for keeping it here. We got to be ready. If we don't love education, we ain't gonna be ready, especially in these fields. We're not going to be. We look down at education, a travesty for the last 4 years. You're being a distraction, but thank you so much, Mr. Chair. And I am open and willing to whatever we need to do to make this bill better. I'm willing to do that. If we need to, Attorney Fosh, my staff is going to call you in reference to the Louisiana law that mandates that employers submit that type of documentation to the Board of Nurse Licensure so that we can add it to this legislation. But the truth is, the policeman from Campo Rico hit it. despite the fact that we have a number of individuals who are licensed by the Board of Nurse Licensure, they don't know who practices in the Virgin Islands because half of them are not here. Thank you so much, Mr. Chair.
Thank you very much, Senator Viale. Again, the conversation should not be about loss of revenues, but access to care, you know what I mean? And I am all for diversification. I'm for the leveling the playing field. I'm about quality of care, but we want to make sure that our locals also have a voice and an input, but more importantly, that at least there be some mechanism by which there's a registry that someone could be accountable for individuals that's coming into the territory, be it the Department of Health, be it the Board of Licensure. There should be some documentation of who these individuals are, what are their credentials, you know, so that we could be able to certainly be accountable. Implementation continue to be a problem. We spend a lot of times reviewing these legislation, moving them, passing them, but there's always some difficulty in implementation. That particular bill that speaks to background checks, you know, go back to 2016. There was some effort during the 33rd legislature again to strengthen it and bring about some resolve, and we're still having that discussion today. So we keep having these circular discussion that is not transcending into us, you know, being able to move the needle on these particular issue, and we can't continue to spin wheels. I think it's important that we move forward. At this time, you know, we have two other measures to consider. I am open to any burning questions in regards to Bill 34-0040. I know Dr. Amaro has rejoined us, so I know that there was a question for him. Senator Viale, you had a question for Dr. Amaro? Was it the salaries of nurses, the average? Yeah, Dr. Amaro, I think all of the other stakeholders and testifiers have been asked about the average starting salary of our nurses. Can you speak to that real quickly? Is the same as St. Croix? All right. Senator Joseph, you have a question? All right, make it brief and quick.
Thank you kindly, Mr. Chairman. I wanted to ask Ms. Rebecca Fauch, because I noted in the legislation there's an opportunity for representatives of non-party states of the compact to actually be invited to participate in activities of the commission. Has that been made? Because it would definitely help the Board of Licensure become acclimated to the functions of the commission and the like. Have you been interfacing with the Board of Licensure here in the Virgin Islands so that you could have some type of provisional affiliation or representation?
Yes, the board is more than welcome to either attend a commission meeting or even just call into one of the virtuals, which may be easier at this point. But yeah, I think that would be an excellent idea to be well acquainted with how the process works. And I could certainly work with Carmen to make that happen. But yeah, I think that's an excellent idea.
Been doing that. This has not happened.
Carmen, I don't know if you'd be better to answer this. I don't believe so, but I mean, other executive directors from other states have attended because it is open to the public. So even states that are not part of the compact, they have attended so that they can get a better feel for what those commission meetings are like.
I definitely would encourage you, Ms. Vanterpool Romney, to take advantage of it so you could have an idea, because it would be a great resource to you, and I don't believe it needs to be legislated. It just needs for you to carve out the time. Thank you so much, Mr. Chairman, for your indulgence.
Thank you very much. At this time, what I'll do is allow for the stakeholders. We're moving on to the next measure, but I'll allow for the stakeholders to give a 30-second wrap-up on this particular measure, and then we'll be moving on to the other two measures that's before us this afternoon. We'll start with you, Commissioner Encarnacion, in regards to 34-0040.
Thank you, Senate President. Let me just give you some information that you requested before I close out. The ATI, which is a national test administered by ATI, it's basically across the nation. So the 90% pass rate is not just for the territory, but it's nationally. And it provides a certificate of readiness. One that person passes that ATI, he or she is given a certificate of readiness to actually sit the NCLEX. As of, Ms. Romney indicated that it was 92%. Dr. Hall actually voiced that it was 94% of the individuals taken NCLEX in 2020 passed, as well as in 2021 thus far. And of course, there are more individuals left to take the test, but so far, 100% of the individuals this year that have taken the test have actually passed, which I think is excellent. But of course, there are more people that is waiting to take the test. In reference to the bill, I would reinforce that the Department of Health, I do as a nurse, really and truly support this bill heavily. I think that they always say that the devil is in the details. And I think looking at the bill itself, if you actually read through the entire bill, it actually gives you all of the details that you need to set up the program. And so in reference to our regulatory entity in the Department of Health, we would be willing to assist, because you don't want the commission of the Board of Nurse Licensure to actually be the one that is telling us in the VI that we're no longer applicable. So we have to figure out back and forth how we can work better together. In reference to comments made by Ms. Romney in regards to the red tape that we may be seeing in the Department of Health or the GVI, I'm willing to work with her on a more regular basis. I've called for meetings with the boards. We will be calling for more meetings with the board so that issues that actually have arisen will be spoken about at the table and continue to build upon that relationship, because collaboration is really and truly, and consistency is actually what yields to success. And so whatever we can do in the Department of Health to support, I'm willing to do so. Thank you so much again for the governor, Senator Villalay, and you, Senator Francis, for allowing us to speak to this bill today. I can honestly see good things coming out of the bill, with, of course, regulatory efforts being put in place as well. Thank you so much.
Thank you very much, Commissioner Encarnacion. Next, we'll go to Ms. Rivera.
Thank you, Senator Francis, and other members of the committee for inviting Visner. Visner will be working closely with the Board of Nurse Licensure, because there's some issues that we still have with regards to this compact license. I know there are nurses here in the Virgin Islands, I'm not in the Virgin Islands right now, that have license in different states, and those states are compact states, some of those states, but they have the individual license in those states. And it is a good idea on the surface, but working close to the issue, getting the nurses here is fine, but there are times working closer to the issue and in close contact with the nurses that we're bringing in, there are some, how should I put it? There are some cultural issues, and there's some things that are happening that is now readily accepted. I'm trying to be diplomatic here. But if all these things that we're saying is in place, and we follow up on them and keep a close eye on them, and have the Board of Nurse Licensure knows who are practicing in the Virgin Islands, not just having a license, but who are actually practicing, that will be fine. Also, the background check. I know when I was working, the background check was done by HR of the hospital. I don't know, that should be still happening, but I'm surprised that the board is not doing that. But any which way, we need to stay focused. And I support the board in their stance, but we are still in the ancient times where we had having to fill out paper application to renew a license. We are due for renewal in December, and we are going to be filling out paper when we should be able to go online and do that, which is what is happening in most of the states. You go online and you submit your application, and in no time you get your license. Last year, the year before, it took us about 6 months to get our license in our hand. We had to get a paper from the board saying, yes, she's duly licensed and she can practice. So those are things that the board needs support with, not just talking, but be actually on the ground with the board, supporting them in their efforts. And business stands ready to work with the board and also stands in support of this bill that Senator Vealie puts forward. But we still have some concerns, and we will not stand in the way because it's for the betterment of the Virgin Islands community. And many people are leaving. Some of them are not leaving because they want to leave. They're leaving because they not get the services. Plus, many of the residents of the Virgin Islands, especially the older folks, many of them do not have any children or support persons here. So that's sometimes some of the reasons why they're leaving and going to the mainland, to be near to their children and other family members for support when they're sick. So it's not that they want to leave, because nobody wants to leave their homes, but for their own health and interests, that's what they're doing. So we will work, VISNA will work with all the entities involved, the Department of Health, the Board of Nurse Licensure, the legislature. And we thank you again, Senator Francis, for inviting us to be a part of this. And we're looking forward to working with you on the Health and Hospital Committee. Thank you very much.
Thank you very much, President Rivera, for your comments there. Next, we'll hear from the interim CEO of the Governor Juan Francisco Louis Hospital and Medical Center, Ms. Daima Williams. You're recognized for your 30 seconds closing on this particular bill, 33-0040.
Thank you, Senator Francis, and thank you, Senator Vealie, for your sponsorship of this bill, and to the Committee of Health, Hospitals, and Human Services for the invitation to testify on Bill 33-0053 for the Nurse Licensure Compact to create a multi-state license. Whereas we appreciate there is further work needed to be completed to address some of the identified opportunities to date, a multi-state license would allow for a greater volume of nurses who are readily available to serve our community and thereby increasing access to healthcare. We'd also like to encourage the inclusion of additional benefits as discussed in our testimony and considerations as well. As we do think that retention of nurses are equally as important. As we continue to manage our current COVID-19 pandemic, and we do anticipate a significant increase in the numbers of beds in JFL North, a multi-state license would be beneficial to the island of St. Croix to address some of our nursing staffing needs. We thank you so much for the time.
Thank you very much, CEO Williams. Next, we'll go to Ms. Rumney, Territorial Executive Director of the Virgin Islands Board of Nurse Licensure. You're recognized for your 30-second wrap-up and Bill 34-0040.
In closing, thank you for the ability and the opportunity to present on Bill number 34-0040. The board takes this opportunity also to say thank you to all the nurses out there who have been working so hard during this pandemic. It is our duty and responsibility to ensure the safety of all involved in the Virgin Islands and also ensure good scope of practice for the nurses. It is not our intention to stop or block any bill that will help enhance the health care of the people of the Virgin Islands. These are our people. This is my home, my country. It's more than dollars and cents. It's their health. And that's the most important thing for me, is to ensure that everyone will receive high quality nursing care coming through the Board of Nurse Licensure or National Compact or National State Board of Nurse Licensure. Thank you to all for allowing us this time.
Thank you very
good
much,
afternoon.
Executive Director Vanterpool Romney, for your comments. Next, we'll go to Attorney Forsht, Director of the State Advocacy and Legislative Affairs, National Council of State Boards of Nursing.
I will keep this very short. I just want to thank you for the opportunity to testify and answer questions, and know that I am available to answer any additional questions and, of course, work with the sponsor on any amendments he is proposing. So thank you again.
I want to thank all of you for your testimony this afternoon in respect to Bill 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license, again being sponsored by Senator Villela as well as other senators. We'll be taking a vote on this particular measure a little bit later on in the proceedings. And at this time, I'd like to, again, thank you. Those that's not a part of the next measure before us can be dismissed and log off. And at this time, we'll ask the Madam Clerk to please call up the next items on the agenda today. And please be mindful that there's a total of three measures that's really out of the one bill that was sent down by the governor for consideration. However, it was separated in three companion bills. And obviously, we'll be voting on them individually. But nonetheless, there will be actually, the bills are broken up into three bills, smaller bills. At this time, we'll take a 2 minutes recess. The Committee of Health, Hospital, and Human Services stands in recess for 2 minutes.
Go ahead, Francis. It's on. That's good. We're back on the record. Madam Clerk, can you please read the rest of today's agenda on the record?
Bill number 34-0041, an act amending Title 27, Chapter 1, Subchapter 1, by amending Section 7 relating to the continuing medical education requirements for permanent and institutional licenses, by inserting a new Section 55 relating to the Commissioner of Health's authorization to issue licenses to radiologists, technologists, a new Section 56 relating to the Good Samaritan Law, and a new Section 57 relating to penalties, amending Subchapter 11 relating to the practice of podiatry, and by making technical amendments, sponsored by Senator Nova Francis Jr. by request of the Governor. Bill number 34-0042, an act repealing Title III, Virgin Islands Code, Chapter 23, Section 415, relating to the Board of Examiners for medicine, surgery, dentistry, pharmacy, nursing, optometry, physical therapy, chiropractic, and podiatry, reestablishing the respective boards, establishment of and establishing the language in Title 27, Virgin Islands Code, Chapter 1, Section 1A, and establishing a temporary board sponsored by Senator Nova E. Francis Jr. by request of the Governor. Bill number 334-0046, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 193, relating to the service term of members of the Board of Naturopathic Physicians, sponsored by Senator Nova E. Francis Jr. by request of the Governor. Invited testifiers, the Honorable Ustai Encarnacion, Commissioner, VI Department of Health, Dr. Frank Odlum, MD, FACS, Chairman, VI Board of Medical Examiners, and Dr. Regina Flippin, podiatrist.
Thank you, Madam Clerk, for that. Senator Francis, you're recognized for the introduction of your bills.
Thank you very much, Mr. Chair. Whoosh! Yeah, this bill certainly brought a lot of chatter and discussion in respect to moving this measure forward. But I want to thank you for the opportunity. Bill 34-0041 and Bill 34-0042. I'm sorry, and there is an additional bill that's floating around, Bill 34-0046. They're all companion bills, and based on the Revised Organic Act, it was recommended by legal counsel that because of the board situation and the quasi-judicial authority and some of these measures, that in fact these boards will have to be separated into independent bills. Thus, the reason for us to separate these measures out. But an act amending Title 27, Chapter 1 of the Virgin Islands Code to include the sections of Subchapter 2 that are needed were deleted in Bill number 33-0348 and are not currently incorporated into the bill.
of Board of Medical Examiners, Subchapter 1, amending and updating provisions of Title 27, Chapter 1, Subchapter 11, and Titles 27, Chapter 4 to allow for the podiatry and naturopathic physician boards to function, practice, and issue licenses with their limited members, amending Title 3, Chapter 23, Section 415 to provide for the operation of the podiatry board and relocating the sections to Title 27, Chapter 1 to coincide with the medical practices included in the medical board. There's a perception that, in fact, what's being created here is a super board that will be allowed in the absence of having sufficient board members then to act in the stead of these various board. The medical examiners, there's some 8 boards that falls under that purview, and certainly we'll be having a robust discussion in respect to that. How do we best move this measure forward and really address some of the void that we're seeing in our community? One in particular is the fact that we only have one podiatrist on island, and there's a number of patients and others that's waiting. We have had a podiatrist that have relocated to the Virgin Islands for quite some time and is awaiting some licensure and have been unable to do so because, again, we don't have a podiatrist board in place. So this is a temporary fix to the problem in being able to address that. We're hoping, and that we could really get the Board of Medical Examiners with the podiatrist to then vet that particular member and hopefully be able to get that person licensed and be able to address some of the concerns that we're seeing. And it's all about medical safety and situation that we're experiencing. We have a lot of diabetes on the island, as you're aware of, and that certainly the conditions of the feet and their need for urgent care, timely care, is important. So unfortunately, the podiatrist is seeking to become a licensed in the territory. I have not been able to because the board does not have a quorum. My original intention was to repeal the podiatry board and give the board examiners the authority to license podiatrists. What is before you is a language proposed by the governor, and which is more comprehensive and seek to address the quorum challenges of other boards as well as correct language such as the Good Samaritan statute that was at some point removed from our statutes before and present some issues and challenges. This proposal gives the Medical Examiners Board the authority to act as the de facto board for the podiatry board and other specialties. It also updates the continuing medical education, language, and certification requirements. We have highly skilled podiatrists in the territory, and I'm fortunate to have Dr. Regina Flippin available to testify on this matter today, who has really been at the forefront of assisting in this endeavor and providing medical care. She's traveled throughout the territory to assist, and it has really gotten to a point where it's becoming a heavy lift at this point. And so there is a critical need for more. As our testifiers and stakeholders will attest, this measure does not seek to consolidate or take away the board's scope of authority. It simply recognizes that we lack a full complement of practitioners in specialty areas and takes corrective measures to ensure that healthcare is not put on hold to the detriment of the Virgin Islands community. Again, I know that we'll be having a robust discussion in respect to this, and at the end of the day, we'll make some decision forward with the recommendation of legal counsel as well as the testifiers of how best to address this continuing situation and problem so that we could really, again, work towards improving our health care in the territory. Thank you for the opportunity. I am expecting my colleagues to make some valuable discussion in respect to how do we best address this situation collectively. Thank you, Mr. Chair, for the time.
Thank you, Senator Francis, for that in-depth, detailed explanation of the 3 pieces of legislation that we are about to vet. I see the testifiers on the screen. Can we do a quick mic check, starting with Commissioner Encarnacion? Good afternoon, Commissioner.
Good afternoon, rather.
Okay, very well. Good afternoon, Dr. Odlum.
Good afternoon.
Yeah, and good afternoon,
Can you hear me?
Dr. Flippin.
Good afternoon.
Very well. So we can get started. We're going to begin with you, Dr. Flippin. You may proceed with your testimony.
Good day. To the Honorable Senator Norval E. Francis, the 34th Legislator of the Virgin Islands Vice President, the 34th Legislative Committee on Health, Hospitals, and Human Services. I would first like to thank you for the opportunity to be a part of this discussion. I'm Dr. Regina Flippin, a podiatrist board-certified foot and ankle surgeon. I'm a fellow of the most respected and recognized certifying board, the American College of Foot and Ankle Surgeons. I practice here in the United States Virgin Islands and Milwaukee, Wisconsin. I've been practicing for 20 years, and 8 of those years in private practice on St. Croix. I've served on numerous boards, which include, but are not limited to, the National Podiatric Medical Association.
Dr. Flippin, can you please slow down?
Yes.
Take your time, please. Remember, folks, the stenographers have to record this, so take your time, please. Appreciate it. Thank you.
Sorry.
No problem.
Okay. Thank you. Okay. Should I start over?
No, you may continue forward.
Okay. I'm the founder and owner of 2 Joint Commission accredited ambulatory surgical centers, one of which, in order to fully understand the issue at hand, I feel it necessary to understand podiatrists or medical doctors that
Dr. Flippin,
specialize
Dr. Flippin.
in the foot, just as cardiologists, orthopedic specialists, yes. Can you hear
Dr. Flippin.
me?
No, we're having some technical
Yes.
difficulties. You're cutting in and out very often.
Okay.
Okay, what we're gonna do, right? We're gonna go to the other testifiers and see if we can get that corrected in the interim. Okay. So we will go to Commissioner Encarnacion. Then we go to Dr. Odlum, and by then hopefully we have your situation
I'll
taken
get
care
on
of.
a different computer.
Okay, thank you so much.
Okay.
Commissioner Encarnacion, you may
Thank you.
proceed with your testimony.
Thank you, sir. Good day, Honorable Senator Norval E. Francis, Chair on Health, Hospital, and Human Services, members of the committee, and all other members of the 34th Legislature of the Virgin Islands of the United States, and the listening and viewing audience. I am Justa E. Encarnacion, Commissioner of the Virgin Islands Department of Health. I have here with me today Dr. Nicole Cragwell-Sims, Assistant Commissioner, Dr. Ty Hunt Caesar, Medical Director, and Deborah Richardson Peter, Director of Professional Licensure. Thank you for the opportunity to testify on the proposed legislation updating podiatry and naturopathic sections of Title 27 of the Virgin Islands Code and adding Board of Medical Examiners members to boards so podiatrists and naturopathic physicians can be licensed in the Virgin Islands. The Office of Professional Licensure and Health Planning provides support for 9 health professional boards. The division assists applicants who seek licensure within a territory to provide professional services. The Board of Podiatry has been established but lacks a quorum, and although the Board of Naturopathic Physicians was established, no members have been appointed to date. Physicians in both podiatry and naturopathic medicine are underrepresented within a territory, and quorum mandates are challenging. It is essential to have regulatory boards to provide oversight for their respective fields to ensure public health and safety. However, in the absence of quorums, the Board of Medical Examiners can ensure that the regulatory mandates outlined in the VI Code for podiatry and naturopathic medicine are adhered to. The likelihood of the Board of Medical Examiners maintaining a quorum ensures that these underrepresented fields maintain the standards of care within a territory, as outlined in the VI Code. The territory has a high number of persons with chronic diseases that contributes to the various conditions that require podiatry services as part of their plan of care. In addition, naturopathic medicine enhances treatment options and access to alternative care. This measure would improve access to critical podiatry services and naturopathic medical options. Thank you, Senator Norval E. Francis, for sponsoring this legislation, and of course, to the Governor of the Virgin Islands for introducing the legislation to you, Senator Francis. As always, I would like to thank the VA Department of Health staff for their strong support of the COVID-19 mission. In conclusion, Senator Francis, the Department of Health is committed to reducing health risk, increasing access to quality health care, and enforcing health standards. As always, the department commits to continued collaborative efforts with the members of the 34th Legislature. Senator Blyden, this concludes our testimony. Thank you for your support of our efforts as we fight to improve the Department of Health services to our community. I welcome the opportunity to respond to questions you may have. Thank you, sir.
Thank you, Commissioner Encarnacion. Dr. Odlum, you recognized for your testimony.
Good afternoon. As per usual, my testimony will be quite brief. Thank you for the opportunity to testify in the governor's. I'm sorry, but at the time when I wrote this, I didn't have a bill number. So I kind of refer to it as the proposed legislation, but it's the same. This proposed legislation serves two main purposes. There are a few items that were in Title 27, Subchapter 2, that were inadvertently left out of Act 8435. This proposal corrects those omissions. It adds the continuing medical education requirements and reinserts the Good Samaritan provisions. Number two, the proposed legislation seeks to fix a long-standing problem that many of our medical regulatory boards experience, and that is lack of quorum. The proposed legislation allows the Virgin Islands Board of Medical Examiners members to function as temporary board members, so to speak, to any of those boards that cannot function due to lack of a quorum. It does not take away the right of those disciplines to govern themselves, but allows for a mechanism for their boards to function. The Virgin Island Board of Medical Examiners supports the passing of the proposed legislation. Respectfully submitted, Odlum. Thank you.
Thank you, Dr. Odlum. And Dr. Flippin, we're going to try one more time. Let's see how it works this time. You're recognized for the introduction of your... You're mute. You're muted.
Mute. Okay. Can you hear me now? Can you hear me now?
Loud on clear.
Can you hear me now?
You may proceed.
In order to fully
Yeah, you may proceed, Doctor. We're going to take a quick recess. We stand in recess for 2 minutes. We're back on the record. Dr. Flippin, can we try one more time now? I think we should be good.
Thank you. I'll start from where I left off. In order to fully understand the issue at hand, I feel it necessary to understand some vital terminology. Most people think that a podiatrist is a medical doctor that specializes in the foot and ankle, just as a cardiologist, orthopedic specialist, dermatologist, or internal medicine doctor. Similarly, my invitation to attend this meeting was addressed to Regina Flippin, MD. A podiatrist is not a medical doctor. We hold the degree of DPM, Doctor of Podiatric Medicine. We do not attend allopathic medical school. We attend podiatry medical school, just as a dentist is a doctor of dentistry and a veterinarian is a doctor of veterinary. What is vital is we are medically and surgically trained specialists that treat the foot and ankle and prescribe medications. We are the experts in the lower extremity because our podiatric medical school training is completely specialized from our second year of study. We then go on to complete a 2 to 4 year surgical residency. It is important for you to understand these dynamics, which is one of the many reasons why podiatrists should not be placed under the medical examiner's board. Most lay persons and a high percentage of medical doctors do not fully understand the education, training, and scope of practice of a podiatrist. Of course, they know what a podiatrist does. Similarly to a real estate attorney has some idea as to what a criminal attorney does, but not its full scope of practice. Podiatrists are recognized by all 50 states, the federal government, and national accrediting agencies as independent healthcare practitioners who are permitted to provide medical and surgical care within their scope of practice. The skills of podiatrists play a significant role in treating lower extremity complications related to diabetes and other chronic conditions. The early warning signs of diabetes are often manifested in the feet. A podiatrist is usually the first healthcare provider to detect and treat complications such as wounds and neuropathy in the diabetic patient.
Diabetes is the leading cause of non-traumatic amputations. 2 peer-reviewed published studies evaluated care by podiatrists for patients and diabetes and demonstrated that compared to other healthcare professionals, podiatrists are best equipped to treat lower extremity complications from diabetes, prevent amputation, reduce hospitalizations, and provide savings to the healthcare delivery systems. Because of a podiatrist's vast medical and surgical knowledge, it is understandable how one would assume a podiatrist is a medical doctor with a podiatric specialty. This is one reason why it is imperative that podiatrists maintain their autonomy and govern themselves. The mission of boards is to serve and protect the public from incompetent, unprofessional, and improperly trained professionals. This is accomplished by ensuring that only qualified professionals are licensed to practice their respective fields with high standards. How can a medical board properly protect and serve the public when they are not fully aware of the actual training a podiatrist undergoes? Over the years, there have been a vast array of changes in training and the scope of practice of a podiatrist. A podiatrist today is not the same podiatrist of 30 years ago. 30 years ago, a podiatrist could practice with 1 year of training, whether it be a preceptorship or residency. Today, it is mandatory for a 3-year surgical residency. It is clear that the medical examiners who advised the governor in preparing this revision is oblivious to this fact because they still have antiquated language noted in this proposal. In section 1, number 6, quote, complete a minimum of 1 year of residency. It further states under bullet 3, or a board-approved course. In 2021, it is next to impossible for a podiatrist to practice in the United States Virgin Islands, let alone the states with a, quote, board-approved course training, and successfully and competently address the health disparities noted in the territory affecting people with the foot conditions that I treat on a daily basis. The current statute 168E states 3 members of a board constitutes a quorum. The governor has been misleading and uninformed by stating there has not been enough podiatrists to meet a quorum. When I came to the island in 2012, there were possibly 8 licensed podiatrists to my knowledge, to include myself, Dr. Ken Fox, Dr. Gail Rucker, Dr. Ian Cook, Dr. Stephen Chipman, Dr. Ma Otta, Dr. Kevin Gibson, and a doctor that I can't recall his name that came to the territory part-time from Washington, D.C. Additionally, I have completed and submitted 3 applications applying for board appointments. According to the St. Thomas source dated July 20, Deborah Richardson Peters, the Director of Professional License and Health Planning, stated that, quote, every licensure board shares the issue of expired terms or board vacancies, among other obstacles to fulfilling their mandates. She further is quoted stating, the Podiatry Board, which currently has only 1 member, lost 4 members in 2012 when they collectively declined to continue serving on expired terms. This is an issue the governor created, and as stated in the same article, it is a low priority from Government House and a burdensome appointment process. There was a board, but the governor failed to reappoint the members. This is not an issue of lack of people to serve. This, again, is the governor failing to do his duty according to the written bill. It was an issue in 2012, and it remains an issue today. Most recently, during this current administration, on December 10th, 2019, I personally asked the governor about appointing the Podiatry Board and presented him with the attached letter, Appendix 1. I was told by Governor Bryan, quote, I am not going to appoint a podiatry board, end quote. I attempted to explain and express the urgency at that time by also giving him crucial photos of diabetic ulcers and wounds, people of the territory at risk of losing their limbs and lives. During that time in 2019, The licensed podiatrists were myself, Dr. Ken Fox, Dr. Ian Cook, and Dr. Gail Rucker. This is a testament that the governor is being misleading as if there were not enough podiatrists to have a quorum. The statute states 3, and we had 4 with no consideration for a podiatry board. The vast majority of the United States and territories have a separate podiatry board. I've attached for you a map from 2016, and as noted, there are only a few states where this is not the case. The territory should be leaders and progressive. Why would the territory want to consider what is not usual and customary as indicated by the number of states with independent podiatry board? As I mentioned previously, podiatry is a different specialty and should be recognized by its own profession. We are here today to fix an issue that has already been addressed and working. The disconnect is the governor not doing his duty as the leader of the United States Virgin Islands and protecting the people of the territory's health and welfare. I have attempted to discuss this issue with several current senators and the urgency of this matter, and the only resolution that they continue to be faced with is the governor wanting to place the podiatry board under the medical examiners board. Why is this so important to Dr. Odom and the medical board, may I ask? The only reason I see it to be such an issue with them is to control the competition. The podiatry board does not have to be made up of podiatrists. To state that there are not enough podiatrists in the territory to have a board is a misnomer. The board can be made up of one podiatrist, one medical doctor or nurse, or anyone in the health field, and one person from the community. This is not a difficult task. The governor is requesting the governing body to bypass written, approved legislator and law. If this precedent is allowed, imagine what the repercussions could be for other professionals. Professionals should regulate their own professions. Follow the current bill, appoint a board, and license podiatrists. What is being created is not addressing the issue at hand. You are actually creating a new problem. To adopt this proposed change will allow competitors to oversee and license other competitors. There are potential anti-competitive issues that could arise by one profession overseeing another profession who is also a competitor. In 2015, the U.S. Supreme Court sided with the Federal Trade Commission in the case of the North Carolina State Board of Dental Examiners versus the Federal Trade Commission, that there are anti-competitive issues when you allow competitive boards to oversee its competitors. See attachment Appendix 3. This legal battle has set a precedent of not allowing competitive professionals to oversee competitors. General surgeons see podiatrists as competitors, as we both do wound care and foot surgery. Orthopedic surgeons see podiatrists as competitors, as we both medically and surgically treat the foot. The concern is this will prevent access to the consumers and also increase healthcare costs for the consumers. DPMs being regulated by the MD board could lead to similar problems that arose in North Carolina. The St. Thomas source dated July 2012 made mention of, quote, the Department of Health does not have anyone to actively supervise any board, end quote. To give the Medical Examiners Board autonomy over the Podiatry Examiner Board with no supervision can lead to adverse effects stemming from, again, competition. The only losers are the people suffering from foot and ankle issues, losing limbs and losing their lives. In the section under 1, the Board of Medical Examiners, Bullet C, subsection A, until there are enough licensed members to form a board. What constitutes enough? That still does not mandate the governor appointing a board. As mentioned, there have been 4 to 6 licensed podiatrists and the governor refused to appoint a board. The answer is very simple and logical. The governor can appoint a board made up
of myself, a podiatrist, a medical doctor, and a person from the community. Once that is done, the board would then be able to do licensing for the territory, allowing more podiatrists the opportunity to practice. I personally have a minimum of 8 colleagues who are podiatrists that have been waiting since 2012 to become licensed in the territory. And I've spoken with all of them in the last 24 hours, and they would be ecstatic to apply once this issue is resolved. This change in the bill seems to attempt to backdoor placing podiatry under the medical board. You cannot have one party overseeing another party when they do not know and or understand that profession's full scope of education, training, and practice. How does placing the podiatry board under the medical board benefit the community? It does not, because medical doctors do not know nor completely understand podiatry or podiatrist scope of practice. Just as you have real estate boards regulating realtors, attorneys regulating attorneys, nurses regulating nurses, medical doctors regulate medical doctors, podiatrists need to regulate podiatrists. We are here trying to fix a problem that is not broken and does not need to be fixed. We currently have a system, laws, legislation in place. The system works if the system does what is written in our current bill and appoint a board. As I further read the governor's proposal, so many other issues seemed unethical to me. Please note the following excerpt from page 3 of 6, section B. 1A. The Board of Medical Examiners include 4 physicians, 3 members from the BI community. The Board of Dental Examiners includes 5 dentists. The Board of Pharmacy, 5 pharmacists. The Board of License, the Board of Nurses, all nurses. The Board of Optometry, all optometrists. The Board of Chiropractors, 4 chiropractors. Only when it gets to the Board of Podiatry Medical Examiners, it has 5 physicians and or podiatrists, at least one of whom shall be a podiatrist. This proves the point that the governor and medical examiners are attempting to oversee podiatry by including 5 physicians and or podiatrists, at least one of whom shall be a podiatrist. No other board states as part of the board's makeup include physicians. Why is it not proposed 5 podiatrists? The dental board does not suggest 5 physicians and or 1 dentist, one of whom should be a dentist. The pharmacy board does not suggest 5 physicians and or pharmacy, at least one of whom should be a pharmacist. The nursing board does not suggest 5 physicians and or nurses, one of whom must be a nurse. The Board of Optometrists does not suggest 7 physicians and or optometrists, at least one of whom should be an optometrist. The Chiropractor Board does not suggest 4 physicians and or chiropractors. The only board that has physicians noted as part of the makeup of the board is the medical examiners and podiatry. Medical examiners are not podiatrists. Then why should they have a dominant role in the podiatry board? The Medical Examiners Board does not suggest 5 nurses, one of whom must be a physician. This is how far-fetched this proposal seems. This suggestion borders on blatant discrimination against the field of podiatry. Furthermore, why would podiatry need more professionals to its board than the medical examiners? The Medical Examiners Board only has 4 physicians and 3 members from the community. The Podiatry Board only needs 4 members and 3 to form a quorum. To allow the appointment of 4 physicians to a 5-member podiatry board is in essence creating another medical board, because the governor could indeed appoint 4 medical doctors, 1 being a podiatrist. Remember, podiatrists are not medical doctors. This bill seems clearly to have been influenced and written with the assistance of the Medical Examiner Board with no input from podiatry. This shows what will happen if you will place podiatry under the Medical Examiners Board. We will be mere pawns with no respect or regard for our profession, as was done with this proposal. If one was genuinely interested in solving a problem, they usually bring all parties involved to the table to find a solution. solution. Podiatry was not brought to the table on this issue, even though I've made numerous attempts over the years to address this issue. Most recently, I reached out to the governor's legal counsel to no avail. There is an ongoing struggle with medical doctors in certain specialties, such as general surgery and orthopedics, continually attempting to undermine or stifle podiatry as a profession as we are perceived as competition. We are the experts in wound care, limb salvage, and foot surgery. The governor states the need for this proposal is the podiatry board has not been able to form a quorum. How can a board form a quorum if the appointing authority fails to do his duty and appoint a board? The quorum was here. Of course, there is no quorum because the governor will not appoint anyone to make a quorum. The governor's refusal to do his duty, mandated by the legislator, is what has put undue stress on the people of the territory. It has cost millions of dollars to leave the island as people have had to travel outside of the territory to obtain podiatric treatment. This clearly shows that the governor does not have the health and welfare of the community at hand, and it is a travesty the number of limbs that have been lost since my letter to the governor requesting a podiatry board. Every 3 minutes, a limb is lost due to diabetes. This island is suffering immensely with diabetes, diabetic wounds, ulcers, osteomyelitis, infections, and the community is losing their limbs. Several years ago, if a board were appointed, we would have the needed podiatrists on the island. Again, follow the legislator that has already been written, approved, and documented. We have a governor who refuses to govern by the laws that have been put into place and adopt a board. Certainly, the answer is not changing codes to fit into the governor and his supporters on the medical examiner's board agenda. I repeat, I was told by the governor himself when there were 4 podiatrists on island, I am not appointing a podiatry board. It was not even up for discussion. The best indicator of future behavior is past behavior. What in this proposal will make the governor appoint a board? The answer is nothing. And should he appoint a board and this proposal is approved, he can appoint 4 physicians to the podiatry board with only 1 podiatrist. This is just another medical examiner's board. We've had enough. A board wasn't appointed. So I'm doubtful changing this code will encourage him to appoint a legitimate podiatry board. I've listed the names of licensed podiatrists practicing in the territory during this administration, and a board was not appointed. Again, I ask, how many is enough? I'm here because my interests are in this great community. If this proposal is allowed, it would set a precedent for other areas to follow. My heart hurts daily as I have to tell a patient they will need an amputation that could have been prevented and avoided. I have no political gain or interest, and neither is that my agenda. I already have a license to practice in the territory. I have nothing to gain by fighting against where podiatry should be placed. However, I have a social duty and a moral compass to do the right thing because it is the right thing to do. I'm fighting for those that will come behind me that may not have the strength to fight. I'm fighting for equality. I'm fighting for justice. I'm fighting against discrimination. In conclusion, laws and or bills are not written so when one gets into office, they can attempt to change them for the needs of supporters. Laws are written for the welfare of the people. We are a democracy. While Governor Bryan has been in office, there were at least 4 licensed podiatrists in the territory, yet no board was appointed. To date, myself, Dr. Gail Rucker, and I believe to my knowledge, Dr. Ken Fox and Dr. Cook have licenses in the territory, and yet no board is appointed. May I ask again, how many is enough to appoint a board? The territory has approximately 100,000 people. Is that not enough people to appoint a board of 1 podiatrist, 1 physician or nurse, and 1 upstanding person from the community? I ask you,
Please do the proper thing for the people of this community. Please stop in its tracks the governor and the medical examiners board attempting to cause a greater problem such as discrimination and anti-competitive issues proposed by the FTC and have us facing yet another legal battle. I ask that you search your hearts, search your souls, and do the right thing, not because of politics, but because it is the right thing to do. Failure to appoint members to the board should not result in policymakers considering legislation such as the one before us. Fill the board is the only solution, the solution that is already mandated by the code. Filling the board is the ethical solution. Filling the board is the solution, period. Thank you.
Thank you so much, Dr. Flippin, for that heartfelt testimony. And thank you, Commissioner Encarnacion and Dr. Odlum, for your testimony also. Colleagues, we're going to go to a round of questioning. But before we go there, point of inquiry, Senator Francis.
Thank you very much, Mr. Chair. I wanted to go back to Dr. Flippin because, of course, you have given a compelling testimony in respect to her efforts to start up a board that could address this issue. Obviously, the legislature don't have the authority to appoint individual. Yes, we have consent and approval. However, we don't have authority to then appoint individuals. I wanted to glean from her, based how would she recommend the fix outside of the legislation is already in place. We have not been able to fill such a board. We don't have the authority to force the governor to do such a board. What do you see as the fix? Because obviously, I've spoken to you. I've gotten calls from a podiatrist too that just sitting in the wait for some approval. How then would you recommend that we consider addressing that particular issue?
Absolutely. Thank you for your question. One way I believe it can be addressed is, since I am currently the only podiatrist that's practicing, is there can be a bill passed for emergency purposes. I would consider that an emergency where the Senate, you, the governing body, can override and license podiatrists without going through the board. That's something that happens during the hurricane season when we need doctors. If there are certain doctors that need to get here, it's my understanding that they're able to obtain a quote special type of license. So I don't see why that could not be a way to get doctor's license here. And then once we do have the necessary number, whether it's 3, whether it's 10, however the case may be, once they have their special license, they can transfer over to get a full license here.
Very well. We do have a separation of powers issue in regards to what you have recommended there, but nonetheless, we'll continue to probe and, take the necessary course of action to really address this prevailing issue. Thank you for your response. Thank you for your testimony, and I look forward to our continued discussion in respect to how best to address this issue. Thank you very much, Mr. Chair, for the time.
Thank you, Senator Francis. We're going to do a 5-minute round, starting with Senator Saru. Senator Saru, you recognize for your 5 minutes.
Thank you, Mr. Chair. And Commissioner Encarnacion gave me a little warning a few weeks ago about tone, so I'm going to be nice today, Commissioner Encarnacion. So we had an emergency class. Dr. Odlum, you tricked me, I think I missed that part of our, don't look at me like that, of a legislation where we had an emergency class, a clause that would give some level of reciprocity for specialized doctors, and we ended up removing it inadvertently with the override. And I think that would be Dr. Flippin, a temporary solution where we had that clause that would allow those specialists in certain areas that we saw had a void. We would have been able to fix that through that particular loophole. So I will take responsibility for not conducting my due diligence in such a manner Now, I remember sending a letter to the governor, January 29, 2020. At the time, I was the chair of the Rules Committee. And I wrote to the governor and to Attorney Bourne. I CC'd Ms. Julia Sheen and Takera Riera. And I said, warm hellos. I am circling back, but I do not agree that there has been a lack of licensed professionals to fill the board. Dr. Flippen has been in active practice in the territory since 2012 and licensed since 2000. Dr. Flippen sent the appropriate application to be part of the podiatry board a minimum of 7 times. And each time she was ignored or told it was not of high importance. At one point, practicing in the territory were 4 podiatrists, Dr. Fox, Dr. Cook, Dr. Ruck, and Dr. Flippen. Dr. Fox submitted letters requesting their appointment to the board, and it fell on deaf ears. Having highlighted the above, it is inaccurate to say there has been a lack of licensed professionals to fill the board. Additionally, the reason we have not been able to get more licensed podiatrists in the territory is due to a non-functioning board. There are 4 podiatrists that have been trying to apply for a license since 2012, and they have made no headway because the board is defunct. Lastly, to answer the governor's question, because he asked this in a previous email, do we have a way to fill this board without podiatrists in the territory? The answer is yes. The board does not have to be filled with all podiatrists. And I said, for your reference, please see below. Title 3 VIC, subsection 415.8, the Board of Podiatry Examiners, 5 physicians and or podiatrists, at least one of whom shall be a podiatrist, and all of whom shall be licensed to practice in the Virgin Islands. 3, to be appointed by the governor upon the recommendation of the Commissioner of Health for initial terms of 3 years, and 2 for initial terms of 4 years. Thereafter, all appointments shall be for 4 years or such until time as a successor is appointed. Then I said, let us correct the errors of the past. Please send down nominees to fill this board. The need is great in the territory, and this is a step in the right direction as we work to improve our healthcare system. Kind regards, JKS. The date is January 29th, 2020. So, here we are. So we spent a whole year to draft a cumbersome unconstitutional legislation because, you know, per the revised Organic Act, do we have our testifier still? Oh, okay, I need back 5 seconds. So per the revised Organic Act, we know you can't have boards commingle into one legislation. But what I want to say today is that we have a habit of establishing levels of bureaucracy when people don't do their job. The Department of Sports, Park, and Recreation has a duty, and because we didn't hold them accountable, we create the Sports Commission, an appropriate $100K. We have LAPC and the Virgin Islands Police Department to work in tandem, and because we don't hold those people accountable, we create an Office of Gun Violence Prevention. This is what a body do. And we can't continue on a path of, I would call it a usurping of power, right? So I love Dr. Odlum, and he's a brilliant man who's giving back to the community, a good son of the soil, Commissioner in Connoissance as well. But I can't necessarily agree with today's approach. What we need is an Office of Do Your Work. That's what we need, an Office of Do Your Work. It's not, when I chaired the Committee of Rules, I pleaded, I was prepared to move nominees immediately because in the history of the institution, when we chaired Rules, we moved over 100 nominees like never before. We understood the importance and it's such a responsibility of moving nominees. And in the absence of not doing our job, this can't be the solution. So if we have to go and create a temporary something with a sunset clause of 6 months, so be it. But I don't agree with the commingling of boards. We have to give disciplines their due respect. And we are here, Dr. Odlum, your testimony, I understand, because you're responding to a need, but it starts from the top. And we have to hold Government House accountable because per the code, he is responsible for the appointment of nominees, and the body comes with the advice and consent of the legislature. That is the law. And if we follow the law, we wouldn't be creating these precarious legal documents. Thank you for the time, Mr. Chair.
Thank you, Senator Saru. Senator Carrion, you recognized for your 5 minutes.
Good afternoon. Good afternoon to everyone. Good afternoon to the testifier before us this afternoon. Dr. Flippin, you have clearly done a great deal to educate us this afternoon with regards to, and the community, with regards to the field of podiatry. And like you said, I agree with you that professionals should be regulated by their profession. And to you, Dr. Flippin, after hearing your testimony, I understand your concerns, and I could tell the passion on this issue. Let me ask you this. I don't know that competition is the issue, but I do agree that specialists in the field are best equipped when they're regulated by each other. How many licensed podiatrists do we have today in the territory?
To my knowledge, there are 3 or 4, but I would not be the best person to answer that. Myself, Dr. Gail Rucker, I understand she has a license. I was told Dr. Ken Fox, even though he retired, but again, that's something maybe Commissioner Encarnacion can answer. Or Deborah Peters.
I'll pass that over to Deborah Richardson-Peter. Director Richardson-Peter. You're on mute. You're on mute, Director.
Sorry. Deborah Richardson-Peter, Director for Professional Licensure and Health Planning. To date, we currently have 5 licensed podiatrists that's holding VI license. There are only 2 that are local, which are Dr. Ian Cook and Dr. Regina Flippin. From the inception of podiatry licensure, the first license that was issued was in 1977, and that was issued to Dr. Ian Cook. And to date, only 12 podiatry licenses have been issued.
I'm sorry, say that last part. How many?
What was that? Can you repeat your question?
No, I didn't hear the last one. My colleague said 12.
Oh, there were 12, and from the inception of podiatry licensure in the territory, there have only been issued 12 licenses total from 1977 to now.
Okay, and
currently we only have 5 licensed podiatrists, and that includes Dr. Cook and Dr. Fiam, which are local, and there are 3 that are not practicing in the territory. That's Dr. Sprov, Roberts, and Rucker, and Dr. Fox is retired. He is not currently licensed.
Thank you. Thank you for that, Director. Commissioner Encarnacion.
Yes, Senator.
Are you involved in the process of nomination? Does the Office of the Governor reach out to you for recommendations to fill these boards?
We can actually provide recommendation, especially through the health planning division. So yes, we definitely can do that. I have to say that this is actually being done to assist the process. So I agree that we have to look to see what is the best option. And Dr. Odlum, I'm sure, can speak a little bit more to this. One of the things that I'd like for the senators to consider is that if you make this an emergency process, you still have to have a set of professional individuals who are vetting or credentialing anyone that actually comes into work within a territory. And that is actually a concern of mine if we take a different approach to this.
And thank you for mentioning it. And now that you mentioned that, let me ask you, and Dr. Olam could also pitch in. I don't know if he wants, before I ask my other question, if he wants to say anything with regards to what we mentioned.
Yeah, good afternoon, Senator.
Good afternoon.
My goodness, we didn't sign up for this. Dr. Flippin, I have absolutely no desire to regulate podiatry. Title 3, Chapter 23, subsection or Section 415 speaks to the current makeup of the podiatry board. At least one podiatrist and five people, one must be a podiatrist. That law was written probably before I was born, maybe not, but quite a long time ago. And it was because there was, at that time, one podiatrist. And now we have a situation where we have a couple on island, and I am called because everyone thinks, just like you mentioned, that medical board controls all of it. And we do not and have no desire to do so. The question was, could we assist, basically? And you mentioned that we have no idea the education that you go through, but yet at the same time, you mentioned that there could be a podiatrist, a layperson, and a doc. They have no idea the education you go through. You have to learn it. And like getting a driver's license, there's requirements in order to get it. If you have those requirements, you get it. We don't select out, and it would be extremely easy to pick up if we ever tried such a thing. Once, just because you have a license in the territory does not mean the governor will or should necessarily appoint you to a board. So having a podiatrist, 2, 3, now basically you're a board to manage yourself. It'd be like me giving myself a license, which is what Dr. Fox did for years. So we're just here to facilitate whatever you come up with. The legislature is the one that creates the framework by which we function. I don't take this stuff personally at all. And I'm willing to put input into the best way that it can be done. But, you're going to be we have a population of what? Less than 150. Demographics is what determines where people live and how many people come. We're never going to have 20 podiatrists in the territory. Just by numbers, it's not going to happen. So, I think the proposal was you have a quorum, we're out of it. The day you're out of a quorum, I won't be getting called because there's a doctor who's out there who's trying to get a license, but he can't get it because there's nobody to look at the application. So anyway, I'll happy to answer any questions or allay any concerns. Senator Soro, you mentioned about the emergency thing. Nothing that we took out would have affected podiatry because it's two different acts. And I thought we had the Good Samaritan law in there, but when we had done the Act 8435, I thought it was in there, but I was wrong.
Thank you, Dr. Oldenburg, for clearing that up. So I understand, but do you see a disparity then when comparing other boards to this board?
Well, you have to look at a historical perspective.
Basically, yes or no, do you see some sort of disparity?
Certainly it's different, but that law was written a long time ago.
Got you.
Naturopathic is kind of similar as well.
And my last, Mr. Chair, if I may, my last question in regards to what the commissioner mentioned, and I think my colleague, is having the legislature, or I think it was Dr. Flippin, having the legislature issue emergency licenses really an acceptable solution in long term?
Absolutely not.
Right, and I agree, feel the same way.
if I may, and we talk about ensuring that it's actually coming out of the right level of government, and in terms of emergency execution, that actually goes into an executive order, first of all. Second of all, like I said, you still have to have a credentialing portion of it, and you cannot, as Dr. Woodland said, credential yourself. You cannot man yourself. That is actually going to lead to some discrepancies as well.
May I speak?
Yeah, Dr. Philippine?
Yes, it's Dr. Flippin. Currently, the solution is for the governor to appoint a board, which we stated we can't make him, appoint the board. So I'm sure we are a group of very intelligent people that can become very creative in getting podiatrists licensed on the island. Now, to address what Dr. Odom stated, I only went by the proposal that was sent to me for the current bill. And in that current, anything past or old. So I'm addressing what was being suggested to be placed into the bill.
I think we lost her. But thank you, Mr. Chair, for your leniency, indulgence with regards to the time.
Thank you, Senator Carrion. Senator Francis Heiliger, you're recognized for your 5 minutes. But I believe we lost Dr. Flippin, Senator. So
okay.
I'm not sure if you want. Let's take a quick break, or you want to proceed until she gets back on. It's up to you.
Well, I'll proceed. I do have some questions for her. I guess I could proceed until she signs on.
Okay, thank you. Proceed.
Okay, no problem. The first thing I would like to ask of the testifiers, good afternoon once again, as to the legality of merging boards, whether temporarily or otherwise. I'm trying to, for me, a lot of times I like to do things correctly. So I need someone to explain to the legal aspect, can we merge multiple boards together even if it's temporary? Through the chair, could we get some legal response in regards to that? But I'll carry on otherwise. As it currently sits, with the question of how to, for example, with podiatry, how to get a quorum on that board, it says, from what I understand from all the testimony, it says at least one. So based on what was just shared from the Department of Health, there are 5 licensed podiatrists here in the territory. And we clearly know, based on our population, we're not going to have hundreds of them here. So if you have 5 individuals already registered and have licenses here in the territory, and the other requirements to be on the board, would it have not been easier to just try to appoint at least one of those individuals and get the other required individuals that apparently we have readily available, as opposed to trying to create a whole new bill? I'm trying to understand the logic in what's happening here, because I think a lot very logically, and I'm confused at the purpose of this. So if anybody can explain that to me, Commissioner Encarnacion, Dr. Odlum, someone, because I'm trying to get it.
I can start, Dr. Odlum, if you can assist as well. But we're really trying to really get over the hump. That's basically what we're trying to do. And as Dr. Odlum has said, the VA Board of Medical Examiners is not going to take over podiatric credentialing unless at the time, at this point.
Ma'am, one second. That's not what I asked. I understand what you want to do.
No,
I'm asking the necessity of doing it if you already have the capability to just appoint people to the board. That's what I'm trying to understand. Why is that part not being done?
I would have to actually vet the candidates to see whether or not, remember we have 3 that is of our island that's not practicing locally. We have 2 that are practicing locally. 1, of course, is already there for the board, but the other one isn't. I would have to refer to Director Richardson Peter to see whether or not those individuals denied being a member of the board. That might be one of the areas that we need to focus on as well.
Okay, so based on what you're saying, somebody is already assigned to the board, at least one podiatrist. So are you saying that requirement has already been met?
I would refer to Director Richardson Peter so that she can give you that information.
Okay, thank you.
Good day. Currently, there are only 5 licensed podiatrists. Board membership does require residency, and out of those 5, there are only 2 that are local, which is Dr. Flippin and also Dr. Ian Cook.
As of right now, the board does not have a quorum. Is any of these 2, I think Dr. Flippin said she's not one. Is the other individual assigned to the board?
No, there's no one on the board currently. The last board member that was assigned to the board was Dr. Kenneth Fox, and he retired. So there's no one on the board currently.
And the other question, in regards to the 2 that have residency currently, because we stress that our population is small, so we don't expect to have a lot of them here. I also heard in testimony that there potentially might even be 8 more trying to get into the territory. Have any due diligence or any type of investigation or consideration has been made of the 2 that currently live here to see if your desire or it was applicable for them or either one of them to meet the requirement to be on the board? Has anything been done even with the 2 that are residents here?
My understanding is that Dr. Flippin has submitted her application to serve on the board several times. However, the board members are appointed by the governor, so I am not privy to what has happened since that time.
Other resident, have they ever applied or just her?
That would be a question for boards and commission. I'm aware of Dr. Flippin's application because it came through our office at one point, but I'm not aware of anyone else who applied. Individuals can apply directly with boards and commissions at Government House.
Okay. So is there anyone here that I could find out if the 2 residing physicians that are podiatrists had applied to be on this board?
Can you
as to why this particular board is not being filled? Because clearly there are already rules, regulations, and laws that exist. So I'm trying to understand what is happening, why the mandate is already in the code, but for some reason the trigger is not being pulled to do what needs to be done. And the only solution that we're coming up with, as opposed to actually doing what the code already says, is to create a whole nother law. That's what I'm trying to get at.
Senator, if I may. This is Odlum. The other members for that board would be physician. If Dr. Flippin had applied, and let's say she was granted, that would still just give you 1 member to that board. And then the other applicants would have to be physicians. The Board of Medical Examiners isn't even complete. And so it's not, I mean, we have a new member on our board, and I know hospital board, I mean, we got new members. So I think there have been people being appointed, but you don't have a bunch of people running around wanting to be on board. So the governor or Deborah or I can ask, I would love to have, I need another physician from St. Croix, and we need 3 public members on our board. And we have never to date had a public member volunteer or even request to be on the board.
Well,
So
the key
that's,
for me,
it's not that the legislation does exist.
but quick question, with the legislation already in existence, the physicians to meet up outside of that one podiatrist, even if we combine and create this whole thing, you still have to look to physicians and other individuals you have to gather to create even this temporary board. So it'll still boil down to me, why not ask those same people to go on this board? It's the same thing outside of meeting the mandate for the one podiatrist. But quick thing, legal counsel is here. I want you guys to know to respond in regards to my question as to the legality of trying to merge all the boards. That's all I needed to find out. But you could answer before they respond. Thank you.
No, I hear what you're saying is like take the same medical board members and make them part of the podiatry board. Basic, you know, as if they want to be on it. Our desire, quite honestly, we didn't have one. It was more if there's people who were applying, you didn't have a quorum, and once you have your folks in, or once the governor is able to populate the board, then we're out of it. You ask a good question. It's just not I don't have the answer. I don't necessarily want to be on another board, so to speak.
Steve, because that's what is really confusing me here, because I'm of the same Nike thought process. Just do it. I don't understand what's happening here. But I would like legal counsel to explain as to the legality, and I think my time was called, so I should be finished.
Thank you so much, Senator Francis Halliger. Before we get to legal counsel, I'll go to the sponsor, Senator Francis. Point of information.
Thank you very much, Mr. Chair. I just wanted, again, for full disclosure in respect to my colleagues' conversation and regards to legal counsel. The legal counsel did provide a drafter's note on page 7 of the bill, which speaks to the fact that it'll be inappropriate for the boards could be amended collectively, all 8 boards, and in fact, if that's the decision, then we'll have to do independent bills in order to be in conformity with the Revised Organic Act. Outside of that, we would not be able to just move all of the 8 boards under one legislation. So that is something that was recommended. If in fact we intend to move forward on this, that we need to consider that in the Committee of Rules and Judiciary. And, you know, again, based on our conversation today, I'm sure that there'll be some alternate movement in regards to this bill. However, I wanted to afford the rest of my colleagues to be able to do their Q&A, and then we'll huddle and make a decision on how do we move forward. But on the recommendation of legal counsel, if you could just review and take, in terms of the drafter's note, speaks to the fact that it needs to be separate boards because there is 7 different boards or 8 different boards confined in this particular piece of legislation. Thank you, Mr. Chair.
Thank you, Senator Francis. Senator Francis Halliger, we good?
If we're good?
Yeah.
In regards to the drafters note? Well,
Yes.
So we don't need legal counsel. We're just going to go based on what was written. That's all I
Yes.
need to know.
Yes.
Okay.
Thank you so much.
So I just want to make one more statement. So
Sure.
if we already have the legal counsel saying that it might not be in our best interest to do this, and we're potentially going to create another level just to do something that's already on the code that we just need the governor to execute. This is too much. But thank you so much.
Okay, thank you, Senator Francis Halliger. Point of inquiry, Senator Francis.
Thank you, Mr. Chair. The issue is not the commingling, or is that legal counsel is not saying that we cannot move forward on this. What they're recommending is that each of the board need to be considered separately, rather than commingling all of the board in one particular measure. It'll have to be independently decided upon. So there was no reference that it can't happen. However, the suggestion and recommendation by legal counsel based on the drafter's note is that they should be considered independently, and that could be something that could be considered during the Rules and Judiciary Committee if, in fact, this bill is moved out of this committee today. Thank you, Mr. Chair.
Thank you, Senator Francis. Senator Saru, point of inquiry.
Thank you, Mr. Chair. In the absence of the governor not appointing board members or not acting in a timely fashion, Dr. Flippin, are you willing to come to a level of compromise in a sense where we establish a like an ad hoc type committee or temp board with a sunset clause of 180 days to approve the discuss the pending licenses, podiatry licenses?
Absolutely, absolutely. And if I may, not to take up your time, Dr. Olam kept stating that, we don't want to, as soon as enough podiatrists are here, we will, just back away. And my mama taught me a long time ago, what's said is as thin as air, but what's written will always be there. So if it's written in the bill, then you may not be able to you may not just back away. So that's kind of my thought on that. But I'm absolutely open to some type to come together. I'm sure we can come up with something to resolve this. I just don't feel this is it.
And may I ask the response of also Dr. Odlum and Commissioner Encarnacion if that would be, I don't have the details in my head worked out or the committee as yet, but some ad hoc sunset 180-day clause for pending licenses. Dr. Odlum? And then Commissioner.
Sure. I mean, the thing is, if you, again, you can do, the code is what determines what you can do. So my understanding would be that unless there's some legislation that gives us the authority to do that, you can't do it. And that's what I thought this whole process was for. As far as I know, there's only one outstanding podiatry license pending. And so, you give a temporary legislative authority to vet that applicant. Fine. I mean, you can give it to the commissioner which I don't know if she wants that, with consulting with podiatrists. That's fine by me. The only reason I'm here today was basically it was a request. Is it something that we would be willing to do? If it could legally be done with legislation, I mean, absolutely. I really am on enough boards, and I don't necessarily want any more work. It wouldn't be a tremendous amount of work because, like Deborah said, since the inception of the board, we've licensed, there've been 7 podiatry licensees, so it's fine with me.
Yeah, they've been 12.
12. So it's not creating a whole bunch of work. But it's not fair to a person who wants to get licensed, who is putting in an application and basically he's putting in the application to the abyss. There's no one there. And we can say all we want, well, the governor has to appoint somebody. Well, find them. And you can't, and it's a little disingenuous to say, well, it has to be this person because that's the only person. That's not normal. That's not normal thought. Those other jurisdictions where you have combined boards, it's for a reason. We live on a rock. And that's that's our reality. Historically, there was just one
But
board.
Dr.
All
Odlum,
9.
Dr. Odlum, it took me a little historical tour. And
Yeah,
I
know.
appreciate it.
It's just frustrating.
No, I understand. So I just wanted to ask if that was of course, we'll have to draft the legislation, but if that was a temp solution, some level of sunset clause, ad hoc committee, we have to come to a consensus today. That's all. I was just asking that. And Commissioner Connoisseur, I'm waiting for you. Oh, go ahead, Dr. Odlum, and then Dr. Mr.
No, I was saying from my standpoint, sure, that would be fine. I mean, we're okay with that.
Commissioner Encarnacion, you may respond.
Okay, thank you. Yes, thank you. First of all, I want to thank Dr. Odlum because I have to tell you that the question came up when I was having a conversation with Director Richardson Peter, and we could not find a solution. Once we had a discussion with him, he immediately said, let's think about it. Let's figure out how we can actually get it done, because we do need podiatrists within a territory for critical needs. So, whatever we need to do to get this process going, I'm willing to work with the process. I have to say that if you put a sunset clause in and one of the podiatrists decides that they're no longer going to be within a territory, you still have one. And so that means that you reverse right back into the legislature because it's a sunset clause and the clause has already subsided and we only now have one. So what do we do here? So this bill actually provides not only an immediate fix, but once you have the individuals within the board that you need and the license that you need, then you can actually cease to this. You can actually reduce the numbers, or the medical examiner board would have to oversee it, see that board at a point in time. You can go back to what's there. So that it gives you the flexibility that you would need outside of a sunset clause. You don't want to do that and have to figure out what you do after that. Just a caution.
Thank you for that, Commissioner. And I must say we have 3 Virgin Islanders. They're testifying, and there's nothing we cannot do once we put our minds together. And with that being said, Senator Fiele, you're up for your 5 minutes.
Thank you. Thank you, Mr. Chair. Before we began vetting these bills today, we actually had a conversation on the floor among ourselves as senators in reference to what is the best approach to be able to solve this particular problem that we're facing. In looking at 340042, which includes 8 different medical boards, one of the concerns we had in our sidebar discussion was the fact that we were making the Board of Medical Examiners a super board when it came to all of the medical boards, because included is the Board of Dental Examiners, the Board of Pharmacy, the Board of Nurse Licensure, the Board of Optometrical Examiners, the Board of Physical Therapy, the Board of Chiropractic Examiners, and lastly, the Board of Podiatry Examiners. So in our discussion, we said that clearly there's not a shortage of dentists, pharmacists, nurse, optometrists, physical therapists, or chiropractors as to see the reason why we would need this particular legislation to create this super board that would act in the absence of being able to fill these other boards, because we have enough individuals in the Virgin Islands to fill all of those other boards right now without an issue. The discussion then turned to the Board of Podiatry Examiners as to how we could come up with a temporary measure, that would allow the board to be filled, and then for us to be able to reinstitute the Board of Podiatry. How can we give an entity that licensure power and then afterward revert back to the Board of Podiatry Examiners? In looking at the composition of all the boards, we realize that all of the boards are comprised mostly of individuals that have subject area expertise. The physician have 4 physician medical examiners, dental examiners are all dentists, pharmacy all pharmacists, nurse licensure, literally all nurse. The Board of Medical Examiners have 3 members from the community. But just about all the boards are made up of members who are actually practicing in the particular area. The entity that was left out was the Board of Podiatry Examiners, which only have one. And we believe that that might have been that way because at the particular time when this bill was passed, there were probably the same issue that we're dealing with now, which is a shortage of podiatrists. So in order to get it to work, they only had one member. So we have been discussing throughout all the testimony as to what is the next approach. And I wanted to ask Commissioner Dr. Odlum and Dr. Flippin, who is always passionate about, I hope she's back on, can we create a de facto committee not to exceed, we just discussed it, not to exceed 180 days, that is comprised of the one podiatry board member, the chair of the Board of Medical Examiners, the Commissioner of Health, and that temporary committee would be dissolved in 6 months. At the end of that 6-month period, hopefully we'll have at least one additional podiatrist, and then we can move to where we have at least 2 podiatrists and a layperson from the community to form the podiatry board. What do you think about that? Dr. Olam, I'll start with you.
What? Oh, sorry.
Oh, no, go ahead then, Commissioner. Go ahead.
What happens after the 100 and I think it's 180 days, and the person who actually does receive a license decides that he or she doesn't want to be on the board, or decides to no longer be licensed within a territory? Do you then do an extension of that committee? What's the plan after that?
We will definitely conduct an assessment at the end of the 180 days and then make a determination as to how we need to move forward. But definitely one of the ideas would be to influence any person that is going to be licensed as a podiatrist to serve on the board for a minimum time period. But right now we have had Dr. Cook. I heard his name called, who has applied for a license, and he's been waiting for a long period of time. And we can't have individuals knocking on the door and we don't have a temporary process in place. So perhaps at 120 days we will assess as to the direction moving forward that we need to implement as a Senate.
Senator, I'm sorry.
Go ahead.
Thank you. Thank you, Senator Ville. I can guarantee you that if there were such a issue for someone to get a license, literally within the past 24 hours, I've spoken with 8 podiatrists that are interested in coming here to practice that will have their license in most expeditiously. So that's 8, 9, that's 9 including me. I don't have, so what Dr. Odom said, it's no guarantee that I'd be on the board. I don't have to be on the board. I also have enough to do. I have a practice in the States as well. My concern is the profession as a whole. And I would like the record to show that I am so appreciative to have even been invited to the table to discuss this opportunity. And I'm a bit disheartened at Commissioner Encarnacion when she stated that as far as what's going on with the board, what to do, to not even include podiatry. It would have been maybe a good idea to ask the only podiatrist that's kind of practicing here. So I just want to say I appreciate the opportunity to be able to sit at the table to have this discussion.
So let's put it on the record. Would you be willing to serve on the podiatry board?
Yes.
Okay.
Yes.
So I'm thinking about, I mean, if we do the de facto committee to just deal with podiatry, Dr. Odlum and Ms. Encarnacion, and all we need is 2 individuals for a quorum to be able to begin to name individuals, but we'd also need, I'm trying to think of the quickest way, and I really thought that you are a member of the podiatry board, Dr. Flippin. You're saying you're not presently a member. Okay.
There's no podiatry.
Okay, so in terms of time, even if the governor sends you down now, then you need to be vetted through the rules committee. That's still a process. And I'm thinking about how can we fast track the process. If we can encourage the governor to send your name down, definitely. But how can we fast track the licensure of other individuals who want to practice in the Virgin Islands? And there are basic requirements that they need to meet. So once they meet those basic requirements, there should be no reason as to why they don't receive the license. Dr. Odlum?
Senator, may I ask you a question?
Yes.
Senator, what with the bill as it's written right now, would there be any amendment to the bill that would fill the same purpose that you're speaking of, rather than trying to go into another route? The bill is here. Once it goes into law, we can actually expedite what we need to expedite, have the licenses vetted, credentialed, and processed, and we're where we're supposed to be. I think that we're kind of trying to cut our nose off to spite our face, and we need to figure out what is the best thing. Like Dr. Flippen indicated, there are a lot of people that are waiting for, and she cannot handle all of them, but a lot of people are waiting for services. So what can we do expeditiously?
Well, I think expeditiously, the first thing we could do is remove all the other boards, because I don't know about my colleagues, but I'm not in favor of having this same language applied to those boards that have more than ample individuals to serve. And the governor has done a good job thus far in sending down members of board and commissions. So I think he can send down individuals for that. And your recommendation is to allow the Board of Medical Examiners, so for a time certain, a period not to exceed 120 days, let's say, to be able to issue license to podiatrists. And then after the 120 days, we have language as to how the new podiatry board is going to be comprised.
That's my recommendation. It's right here.
Let me ask my good doctor, Dr. Flippen, who does really good work. Dr. Flippen, would you be willing, I don't want it to sound like it's up to you alone. I mean, it's a decision that we all have to make, but would you be amenable to, for us temporarily, for a period not to exceed 120 days, for individuals to go through the Board of Medical Examiners to get the podiatrist license, and then after the 120 days, we take that power away from them and reconstitute the podiatry board?
Well, let me ask this question, yes and no. Why can't, and again, the other licensed person have a podiatrist at the table? It doesn't have to be me. There are 5 podiatrists that have license. So at least in that process, include a podiatrist.
Okay. Dr. Olam? The thing, Dr. Flippen, the Board of Medical Examiners are individuals who have already named and been vetted. So you're saying that when you say a next podiatrist at the table, which we only really have one because I don't know the next one who's practicing, you're saying that at least you would be given the opportunity to be at the table, but you'd be a non-voting member because you haven't been sent down?
Well, no, that actually was not what I was saying.
Okay, but I'm asking because I'm trying to come up with a solution and be realistic and be truthful and real as to what we're facing.
Sure.
So,
yeah,
in order to wait for the governor to send your name down as an appointee to the board, we're pushing it back a couple months. I'm trying to come up with a solution where we can have individuals apply within the next 30 days and be able to have them licensed and then be able to constitute a board of podiatry with some new language that I'm sure the committee chair, Senator Francis, will meet with you so we can have some recommendations as to the composition moving forward.
So Senator Ville, this is another question I have. One, since 2012, I've been here. Why all of a sudden there's an urgency for 30 days for this to happen?
No,
Can this not
Okay, I just threw that out there, and I wasn't even in the Senate in 2012, but I know that we had an opportunity and we lost the opportunity because individuals weren't named. So I think at the end of it, Dr. Flippin.
To ask your question, I'm not amendable to. I don't feel that it's a good idea to allow that to happen. I don't feel that it's in the best interest. The way that you're stating it for, and as Commissioner stated, because it's already there, the language to allow the medical board to do that. I don't think it's a good idea. So if I have to answer the question like that, I would say no.
Okay, you will say no. You said. I mean, you will say no.
Correct.
Okay, no problem. Dr. Odlam?
I think it would be nice to ask the doc who's waiting to get a license, which way he or she would like it to go. I think you brought up the stuff with including all the other boards. I don't know why that was done. I believe it was just done so that it would look consistent, even though it was moot for those boards because they're all fully established. But I agree it doesn't need to be those other boards. The podiatry aspect of it, and we haven't touched naturopath. Naturopath is probably even in a worse condition than podiatry. But again, there's one person who I keep hearing about that has applied or is applying or wants to apply. And so he or she is waiting for that license. You know, if they meet criteria, if they meet whatever other criteria are per the code, whatever passes, they get their license. If they don't meet, then they don't. It's not, mystical.
And Senator, if I may, you also need to ask the patients that are waiting for care that sometimes have to leave the territory because they don't have ready access to care. So those are the two considerations.
You're 100% correct. And it has been.
Point of information.
Okay, and I remember at the end of this particular meeting, we have to have a solution because we can't just pass the buck and don't come up with a solution and then we go back to the exact same situation that we had before. So definitely I know we'll be in contact with all of you guys. I know we're going to have a working meeting to come up with some language that would allow the process to move forward. And it would be temporary in nature just so that we can have some individuals that will be able to be licensed in that particular field. And then we would strengthen the language of the podiatry board similar to what exists with the other medical boards. Thank you so much, Mr. Chair.
Thank you, Senator Vialli.
Point of information.
Senator Francis Halliger.
Thank you so much, Mr. Chair. I just wanted to put on the record that as I sit here and listen to this debate back and forth, I'm going to be honest with you. I am 100% in favor of just scrapping 340042 and going with just creating something temporary so we can get to the next step. There's too many things inside of this bill in the attempts to merge boards, try to do things independently, put medical examiners. It's too much for me. I think I am one that believes in simplicity. And if we could come up with something temporary, just a paragraph or a few lines in order to give the authority temporarily. And I do agree with a potential sunset clause. And if it does not get enough people in that time frame, we could go back. We're the legislature. We do it all the time for a variety of things. If we give something a timeline, if the governor does not do it by 180 days, we've gone back and altered the law to give them additional time. When it comes to our state of emergency, if things are not done in a time frame, we have the right to go back in and give the extension. So I don't understand a lot of the back and forth about this. Clearly, this was a piece of legislation, from my opinion, that is masking some issues that are happening here. I personally don't want to participate in the unnecessary back and forth of it. So I am in favor of something temporary and moving us further along to get the people here, the doctors here, to service the people of the territory. I just wanted to put that on the record. Thank you.
Thank you, Senator Francis Halliger. Before I go to the sponsor of the bill, let me just state, Dr. Flippin, in terms of you stating that this is a specialty field, and it is of high importance. And you spoke to having an ethical solution, and I believe that's where we're at right now. We're trying to come up with an ethical solution to the many individuals you spoke to who are suffering as a result of not having podiatrists like board here in the territory. And I believe, as my colleague said, at the end of this hearing, we have to come up with a solution moving forward temporarily until we can do something differently. Okay? So I'm going to go to the sponsor of the bill right now. Senator Francis, you're recognized for your 5 minutes.
Thank you very much, Mr. Chair. And just let me say for the record that coming up with a solution was the reason for the bill in the first place. Right? I did submit a bill draft 21-0382, which really speak to addressing the issue of the podiatry based on conversation from both Dr. Flippin and also the pending physician that had relocated here and was waiting for quite some time to be licensed. And in addition to that, then finding out after discussion and putting in this bill draft that in fact there was a comprehensive bill draft that was sent down from the governor's office to the president of the legislature. And obviously in an attempt to move along because it spoke to this comprehensive move, and there was an attempt not to just piecemeal this particular issue and to address it comprehensively, hence why the bill was moved forward. So I don't want to conflate the issue, but in fact, what we're trying to do is fix a plane in midair. And this bill don't just address the podiatrist issue. It also spoke to the issue of continuing education. It spoke to the Good Samaritan law as well that needs to be addressed holistically. So it is something that also needs to be considered as we move forward with the move. My original attempt was again to allow for some temporary appointment to the medical examiner's board by a podiatrist that could sit as part of the review of any request for a podiatry license. So hence the discussion about moving on to an ADCA, I think will certainly address that particular issue, but we still have the issue of the Good Samaritan as well as the continuing education that need to be contemplated at some point. At the end of the day, we're talking about quality health care and being able to improve our healthcare system and minimize our individuals that have to be going off island to receive care. We have a serious void in the St. Thomas, St. John district because we don't have a podiatrist there. And for that matter, Dr. Flippin often has to then travel over to fill that void a lot of times. So, hence the whole discussion about how do we move this forward. And obviously, she spoke about a pending issue from 2012. Certainly that was well before our time. But nonetheless, we're here today, and we didn't want it to continue, and that's the reason why we made some effort. And it's unfortunate that we have to have this type of brute, honest discussion on the floor in terms of a hearing, but nonetheless, it's necessary. A lot of times, that's what it takes for us to be able to address these particular issues, bring them to the forefront, and address them head on. Legal counsel did review the measure and made some recommendation as well because they found some concern with the comprehensive attempt to address these measures. Hence, we come up with not just the Bill 34-0042, but then there was a subsequent breakout of this, and it came almost to 3 bills because, again, by the Revised Organic Act, we weren't able to just address this issue by 1 bill. Further, legal counsel has recommended that, in fact, if we will be attempting to address a total of 8 boards, that perhaps we need 8 separate bills to address that particular issue to be in conformity with the Revised Organic Act. So we have work to do. I'm hoping that we could go back to the table based on the testimony that's been presented here today, continue to engage the stakeholders, both all of the individuals, Dr. Flippin, Dr. Odlum, Commissioner Encarnacion, and hopefully we could craft a bill that would be in the best interest of everyone, as well as ourselves in this committee, that we could be able to craft a bill that will address all of the issue of that's at the forefront of us today. So I totally agree with the continued discussion in this respect, but at the end of the day, we must bring some resolution to this problem, because I think everybody have already indicated that it is a problem, and it's one that needs urgent and emergency attention. So thank you for the discussion today. In this regard, it's obvious that this bill requires some additional work. And, you know, I believe that we have the political fortitude to sit down and work out whatever that issue may be, and that we could really come up with a solution moving forward. Thank you very much for the time.
Thank you, Senator Francis. Point of information, Senator VLA.
Thank you so much, Mr. Chair. I just received a text from Dr. Cook stating that he will be happy to serve on the board once he receives his license. So we have two. So I'm sure that we can grow that number. So we are going to come up with a temporary fix. We don't have a choice. And we will have to have a conversation as to how we're going to move that particular bill, Mr. Chair and sponsor. I'm thinking that we might need to pass a bill that we're going to totally squash in the nature of a substitute, but to get it to rules and to get it to session on the 29th, we move this bill that we know that we are not going to consider, but we move it to get it to rules, and then we bring an amendment in the nature of a substitute that speaks to just the temporary language and just the podiatry board, giving temporary powers to the Board of Medical Examiners. And we get those individuals on and reconstitute the makeup of the podiatry board. Thank you so much, Mr. Chair.
Thank you, Senator Vielle, and that can work. Testifiers, I'm going to give you 30 minutes to give a closing statement. 30 seconds.
30 minutes?
30 seconds to give a closing statement, beginning with Dr. Odlum.
I was hoping you wouldn't go with me first. Senator, you know, I've been before you guys a lot of, you know, many times, and hopefully you know I'm genuine in my approach. This is not an issue of competition or anything. We were approached as a quick solution. I like your idea, whether it be temporary. Just know that we'll be back to this body, because the temporary fix will just be that. It'll be temporary, but that's fine. It's not fair to have an applicant out there waiting, you know, forever. I again appreciate the opportunity to come before this body. It's always a pleasure.
Thank you so much, Dr. Odlum. Dr. Flippin.
Thank you. I just, again, would like to say thank you for the opportunity to allowing someone to represent podiatry at the table concerning this bill. And I'm very appreciative. Thank you, Dr. Odom. Thank you, Commissioner Encarnacion, for your input. I'm really easy to work with. I'm sure there's a very simple solution that can be beneficial to the people of the Virgin Islands. And that's where my heart is with the people of the Virgin Islands. So thank you so much again for this opportunity.
Thank you, Dr. Flippin. And by the way, nice painting behind of you.
Mm-hmm. Thank you.
Commissioner Encarnacion.
Senator Blyden, thank you so much. Really and truly, Senator Francis, and I really appreciate the governor bringing the conversation to the table. Much needed conversation. A lot of thought has been put into it. I have to say that I want to reinforce what Dr. Flippin said. And I ask that the senators make a decision not based on anything other than what the community actually needs. And right now, the community needs podiatrists within the territory. That's all I have. Thank you so much.
Thank you so much, and thank you for spending the day with us. And you guys have a blessed evening. The Committee on Health, Hospital, and Human Services standing recess for 1 minute.
We're out of recess. Colleagues, it's been a long day. Certainly, it's been a very good discussion, and we continue to work on the behalf of the people of the Virgin Islands. At this time, do I hear a motion? Senator Viola, you recognize for an amendment.
Thank you, Mr. Chair. Mr. Chair, I offer amendment number 34-1A3. Bill number 34-0028, Section 1, internal, subsection 870 is amended as follows. A, on page 2, subsection B, line 9, strike certified home health agency and inserts license and insert certified before nursing home. On page 2, subsection B, paragraph 2, lines 12 to 13, strike home health agency and insert certified. On page 2, subsection C, designate the existing language as paragraph I and insert a paragraph 2 to read as follows. The attending physician shall update the information provided in paragraph 1 every 6 months. On page 2 and 3, redesignate subsections D and E as subsections E and F, respectively, and insert a new subsection D to read as follows. D, a registered nurse or a certified nurse practitioner who has determined and pronounced death under this section shall document the clinical criteria for the determination and pronouncement in the patient's medical or clinical record and shall notify the certifying physician. I so move.
Amendment properly moved by Senator Viola, seconded by Senator Blyden, Senator Sorrow. Hearing no objection, so ordered.
Motion.
Motion, Senator Viola.
Mr. Chair, I move that Bill number 34-0028, an act amending Title 19, Virgin Islands Code, Chapter 37, Subchapter 3, adding Section 870 to authorize registered nurses and certified registered nurse practitioners employed by a certified home health agency, hospice, or nursing home to determine and pronounce death under certain specified conditions and requiring the Department of Health to promulgate implementing regulations. As amended, receive a favorable vote in this committee and be sent to the Committee of Rules and Judiciary for further consideration. I so move.
Motion properly made by Senator Viola, seconded by Senator Blyden and Senator Sorrow. Roll call.
Senator Marvin A. Blyden. Senator Blyden, yea. Senator Samuel Carrion. Senator Carrion, yea. Senator Alma Francis Heiliger.
Senator Heidegger?
Yes. Yes.
Senator Alma Francis Heiliger, yea. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins, yea. Senator Janelle K. Sorrow. Senator Janelle K. Sorrow, yea. Senator Kurt A. Viola.
Yes.
Senator Kurt A. Viola, yea. Senator Novell E. Francis Jr.
Yea.
Senator Novell E. Francis Jr., yea. Mr. Chairman, 7 yeas.
Thank you very much, Madam Clerk. Bill number 34-0028, an act amending Title 19 Virgin Islands Code, Chapter 37, Subchapter 3, adding Sections 870 to authorize registered nurses and certified registered nurses practitioners employed by a certified home health agency, hospice, or nursing home to determine and pronounce death under certain specified conditions and requiring the Department of Health to promulgate implementing regulation have been favorably approved by the Committee of Health, Hospital, and Human Services and will be sent to Rules Committee for further consideration. And that is as amended. Motion, Senator Sorrow. Motion, Senator Viola.
Thank you, Mr. Chair. Mr. Chair, I move that Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license, be adopted by this committee and sent to the Committee of Rules and Judiciary for further consideration. I so move.
Motion properly made by Senator Viola, seconded by Senator Gittins, Senator Carrion, and Senator Blyden. Roll call.
Senator Marvin A. Blyden. Senator Marvin A. Blyden, yea. Senator Samuel Carrion. Senator Carrion, yay. Senator Alma Francis Heiliger.
Yes.
Senator Alma Francis Heiliger, yay. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins, yay. Senator Janelle K. Saro. Senator Janelle K. Saro, yay. Senator Kurt A. Viale. Senator Kurt A. Viale, yay. Senator Novell E. Francis Jr. Senator Francis Jr., yay. Mr. Chairman, 7 yeas.
Thank you very much, Madam Clerk. Bill number 34-0040, an act amending Title 27, Chapter 1 of the Virgin Islands Code by adding a new subchapter 5A, establishing the Nurse Licensure Compact to create a multi-state nursing license has been approved by the Committee of Health, Hospital, and Human Services and will be sent to the Rules Committee for further consideration. Motion, Senator Saru.
Thank you, Mr. Chair. I move that Bill number 34-0041, an act amending Title 27, Virgin Islands Code, Chapter 1, Subchapter 1, by amending Section 7, relating to the continuing medical education requirements for permanent and institutional licenses, by inserting a new Section 55, relating to the Commissioner of Health's authorization to issue licenses to radiological technologists, a new Section 56, relating to the Good Samaritan Law, and a new Section 57 relating to penalties, amending Subchapter 11 relating to the practice of podiatry, and by making technical amendments, be approved by this committee and forwarded to the Committee on Rules and Judiciary for further consideration. I so move.
Motion properly made by Senator Saru, seconded by Senator Blyden. Senator Carrion, roll call.
Senator Marvin A. Blyden. Senator Blyden, yay. Senator Samuel Carrion. Senator Carrion, yay. Senator Alma Francis Heiliger. Senator Alma Francis Heiliger, yay. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins, yay. Senator Janelle K. Saro. Senator Janelle K. Saro, yay. Senator Kurt A. Viale. Senator Kurt A. Viale, yay. Senator Novell E. Francis Jr. Senator Novell E. Francis Jr., yay. Mr. Chairman, 7 yeas.
Thank you very much. Madam Clerk, Bill number 34-0041, an act amending Title 27, Chapter 1, Subchapter 1, by amending Section 7 relating to the continuing medical education requirements for permanent and institutional licenses by inserting a new Section 55 relating to the Commission of Health's authorization to issue licenses to radiological technologists, a new Section 56 relating to the Good Samaritan Law, and a new Section 57 relating to the penalties, amendment Subchapter 11 relating to the practice of podiatry, and by making technical amendment has been approved by the Committee of Health, Hospital, and Human Services and will be sent to the Rules Committee for further consideration and amendment. Motion, Senator Saru.
Thank you, Mr. Chair. I move Bill number 34-0042, an act repealing Title 3, Virgin Islands Code, Chapter 23, Section 415, relating to the boards of examiners for medicine, surgery, dentistry, pharmacy, nursing, optometry, physical therapy, chiropractic, and podiatry, and reestablishing the respective boards' establishment of and reestablishing the language in Title 27, Virgin Islands Code, Chapter 1, Section 1A, and establishing a temporary board be approved by this committee and forwarded to the Committee on Rules and Judiciary for further consideration. I so move.
Motion properly made by Senator Saru, seconded by Senator Viale. Roll call on Bill 34-0042.
Senator Marvin A. Blyden. Senator Marvin A. Blyden, yay. Senator Samuel Carrion. Senator Samuel Carrion, yay. Senator Alma Francis Heiliger.
Yes.
Senator Alma Francis Heiliger, yay. Senator Kenneth L. Gittins. Senator Kenneth L. Gittins, yay. Senator Janelle K. Saro. Senator Janelle K. Saro, yay. Senator Kurt A. Viale. Senator Kurt A. Viale, yay. Senator Novell E. Francis Jr.
Yay.
Senator Novell E. Francis Jr., yay. Mr. Chairman, 7 yeas.
Thank you very much, Madam Clerk. Bill number 34-0042,
an act repealing Title III Virgin Islands Code, Chapter 23, Section 415, relating to the boards of examiners for medicine, surgery, dentistry, pharmacy, nursing, optometry, physical therapy, chiropractic, and podiatry, and reestablishing the respective boards' establishment of and reestablishing the language in Title 27 Virgin Islands Code, Chapter 1, Section 1A, and establishing a temporary board have been approved by the Committee of Health, Hospital, and Human Services and will be sent to the Rules Committee for further consideration and amendments. Point of information, Senator Suru.
Thank you, Mr. Chair. I'm making this point of information on behalf of you and of the members of the committee that just to reiterate to the listening of your audience, 34.0042, as it pertains to the boards, this bill will be bifurcated and it would be submitted in the nature of a substitute. So when it makes its way to rules, it will be in the nature of a substitute. Per the revised Organic Act, we cannot have more than one board to be discussed in a particular legislation. So this legislation discussed the Board of Medicine, Surgery, Dentistry, Pharmacy, Nursing, Optometry, Physical Therapy, Chiropractic, and Podiatry. So what 0042 is aiming to do is specifically address the Board of Podiatry. So we're going to leave the Board of Podiatry as the focus component, and then we'll get to, when we discuss the Board of Podiatry, the board will be comprised of 4 podiatrists and 1 regular citizen, 1 member, 1 physician, sorry. So 4 DPMs, Doctor of Podiatry, and 1 physician, and then, or community member, correct? And then it will go into, so while the board is being complemented, fully complemented, we'll have also, what we struck was a compromise between everyone, basically. And a temporary board will be established in the interim, and it will be comprised of, well, the Board of Medical Examiners, and the ad hoc committee, the temporary board, will only last for a period of 120 days. So it'll sunset after 120 days. And we also struck the section that discussed the naturopathic board, as that should be discussed in its on a separate bill. So we're going to promise the community that we're going to come back with a nature of a substitute, which I'm sure will be submitted today or tomorrow, and it'll be a different bill in the Committee of Rules and for session. But we have to move now because this has become a matter of public exigency, specifically in St. Thomas St. John District, where there's no podiatrist, and over here the length of time to see a podiatrist has become exorbitant. So we have to act and act now. Hence, we are moving a flawed bill today that will be corrected in the near future. So thank you for the time, Mr. Chair.
Thank you very much, Senator Saru. Point of information, Senator Viale.
Thank you, Mr. Chair. I just wanted to put on the record that the last section that the good senator said we're going to omit that deals with naturopathic medicine will come in the next bill. So we have already discussed that particular subject in this committee, but because we cannot combine 2 board bills, it's going to have the amendment in the nature of a substitute for the podiatry, but we also will have a next bill that deals with naturopathic medicine, so we might need to special order that particular bill since it has already been discussed in this committee, to special order it at the next level or special order it at session. And with that in mind, there's a need for us to remove Bill number 34.0046 because that deals with naturopathic medicine. So I'm going to make a motion to remove that motion.
Motion, Senator Viale. You recognize.
Mr. Chair, I move that Bill number 34.0046, an act amending Title 27, Virgin Islands Code, Chapter 4, Section 193, relating to the service term of members of the Board of Naturopathic Physicians, be held in this committee at the call of the chair. I so move.
Motion properly made by Senator Viale, seconded by Senator Blyden, Senator Sorrow. Hearing no objection, so ordered. Thank you
We don't have the number.
very much. I think that this concludes the agenda for today. This has been a very productive meeting. We heard from groups who are usually behind the scenes. The Virgin Islands State Nurses Association, the Nurse Licensure Board, and the Medical Examiners Board. They do play an important role in our healthcare system, and we thank them for their input today. My thanks to also to the Department of Health and the hospitals, as well as the Attorney General's office and the representative of Continuum Care, and their insights on today's bill to include the Nurse Licensure Compact. It takes teamwork to create strong legislation. I appreciate everyone's efforts towards bringing these measures forward. Today also represented a territorial day of prayer for COVID-19, as well as our brothers and sisters in St. Vincent. We continue to pray for their safety during these difficult times. There were also some texts and information in regards to what's transpiring at the Wang Louis Hospital. There will be a separate hearing in which we're able to hear from the professionals from the Wang Louis Hospital and updating us and what's going on there. I must say, however, that there is some effort to get that air condition up and running. There was some start of the chillers, and the air condition have arrived for the purpose of being able to create a safe working condition for nurses as well as those that are visiting the hospital. So stay tuned, and certainly there'll be a scheduled hearing in regards to that particular issue, and we'll be hearing from the professionals from the Juan Francisco Louis Hospital on an update. There's no further business, and the Committee of Health, Hospital, and Human Services is hereby adjourned. I want to thank everyone that participated in today's hearing, certainly media, my staff, the hardworking individuals from Central staff. Thank you very much, Ms. Picard. Colleagues, thank you very much for a very productive day. The Committee of Health, Hospital, and Human Services is hereby adjourned. God bless.